We'll call our meeting to order, please. This is the Santa Barbara City Council. Today's March 10th, 2020. We will do our Pledge of Allegiance, please. Call the roll, please. Ms. Gorman?
Councilmember Jordan? Here. Councilmember Alejandro Gutierrez?
Here.
Mayor Potem Sneddon?
Here.
Councilmember Friedman?
Here.
Councilmember Harmon?
Here.
Councilmember Oscar Gutierrez?
Present.
And Mayor Murillo.
Here. Thank you. We have a ceremonial item today. Ms. Clerk, can you read that for us?
Item 1, recognition of complete count committee in support of the 2020 U.S. Census.
Count Committee in support of the 2020 U.S. Census. Whereas the U.S. Census Bureau is required by Article 1, Section 2 of the U.S. Constitution to conduct an accurate count of the population every 10 years, with the next enumeration on April 1st, 2020, the first to rely heavily on online responses. And whereas the ongoing challenge for the U.S. Census Bureau is the undercount of certain groups, a challenge amplified in California where many individuals from diverse communities and demographic populations are considered traditionally hard to count and are at risk of being missed in the 2020 census. And whereas California receives nearly $77 billion in federal funding that relies in part on census data, a full count of California's population is essential. And whereas the data collected by the census also determines the number of seats each state has in the U.S. House of Representatives, is used to distribute millions of dollars in federal funds to state and local governments, and is used in the redistricting of state legislatures, county boards of supervisors, and city councils. And whereas the census is a massive undertaking for which California's leaders have dedicated a historic amount of funding and resources to ensure that every Californian is accurately counted, a considerable task that requires cross-sector collaboration and coordination between tribal, city, county, and state governments, community-based organizations, educational institutions, and more. And whereas the City of Santa Barbara, along with other local governments, the state, businesses, schools, and community organizations, is committed to robust outreach strategies with a focus on reaching the hardest to count individuals. Now, therefore, I, Kathy Murillo, by virtue of the authority vested in me as mayor of the City of Santa Barbara, hereby recognize the importance of the 2020 U.S. Census and support efforts to ensure a complete, fair, and accurate count of the members of our community and all Californians. There it is. Beautiful. Ms. Maiden, will you give us a few words on what you're up to? And thank you.
Thank you. Put my glasses on. So good afternoon, Honorable Mayor Murillo and council members. Joni Maiden, the co-chair for the Santa Barbara County Census 2020 Complete Count Committee. I'm also the director of the Department of Child Support Services at the county. Our Complete Count Committee is comprised of over 100 members from local governments, private entities, and nonprofits. And we're working collaboratively to employ a grassroots approach to raise awareness about the importance of completing the census questionnaire with a focus on reaching the hardest to count populations in our county. Every 10 years, there is a nationwide count of every person in the U.S. The first census was conducted in 1790, and the next one is National Census Day, April 1st, 2020. And it's important for our community to get everyone counted because, as the mayor read in the proclamation, it helps us get our fair representation in the U.S. House of Representatives. It is used to draw district boundaries, the data from the census, and the data is also used to determine how much funding is distributed to state and communities for programs that support schools, childcare, medical care, food assistance, housing, and public transportation. For each person that is uncounted, the statistics are that funding for services is reduced by $2,000 per person per year for 10 years because the census is conducted once every 10 years. The U.S. Census Bureau had been at one of our meetings and told us during the last census, Santa Barbara County had a reply rate of about 79%. So if we think of the percentage that did not reply, they're undercounted. Although April 1st is the National Census Day, starting on March 12th, the U.S. Census Bureau will start sending notices inviting households to respond to the 2020 census, and completing it will be easier than ever because you can do it online, over the telephone, or you can request a paper questionnaire. If you self-respond and answer all of the questions, you will not be contacted by a U.S. Census Bureau interviewer. So we're trying to encourage everyone to be proactive and self-respond. The various organizations in our committee have devised a myriad of outreach strategies to help ensure every person here is counted. And some of the outreach your city has conducted through the management of Jessica Metzger has been to set up an information table here at City Hall, provide information in newsletters, include informational inserts in the water bills that you're sending your constituents, and conducting presentation for other city departments. As well as that, there are questionnaire assistance centers and questionnaire assistance kiosks that are going to be set up throughout the county to help anybody who wants to go in and get information about how to complete their census, or they can actually use a computer to complete it there if they don't have access to technology or broadband access or even a telephone. To find out more details about all of those events, you can visit the local county census website, santabarbaracountycensus.org, and I know that Jessica is also working on some events that will be developed a little bit further into the next few weeks. When I took over the co-chair responsibilities, which was at the end of December of this year, the person who was doing it at the county left the county, and the very next day that I took over was my first complete count committee meeting. I was completely blown away by the compassion and energy of the committee and all of its members, including Jessica. She's been a powerhouse and such a great support, and I just wanted to acknowledge all of her help and efforts in getting everyone in our community counted. And I'm happy to answer any questions that you might have.
Are there questions? Well, let's have Ms. Metzger come up and
Okay.
tell us a little bit about, thank you, since she's our city staffer, Jessica Metzger, and you are thank you, ma'am. You are putting together some events, and if our council members can help you if you're, targeting certain neighborhoods and.
Yes, Madam Mayor, we are putting together 3 separate events, one for the west side, one for the east side, and then one for the children of our community. And I'll be in contact with all of our council members to see if you can attend any of these events in the near future as we solidify the dates that we're going to have them.
Very good. We thank you for working on that and hoping everyone understands that it's safe for them to respond to the census, and we sure need them to be counted. We'll go ahead and close that item. And Mr. Casey, are there any changes to our agenda today?
No, Madam Mayor.
Okay. We'll go to public comment now, and this is the Mark Marshall Wofford. You'll be first. This is our opportunity to hear from people on items that are not on the official agenda. And Holly Perea is over there by the window. She will make appointments with us if you want to talk with us. She'll get you answers from staff. We're careful not to have a back and forth on this public comment because it's not on the agenda. Mr. Wofford, you have 3 minutes. Go
Thank you,
ahead,
Madam
please.
Mayor, and hello, everybody on staff.
This last couple of years, I've never tried so hard to please everyone, including myself. I've done 2 of those Deltopias, 2 Earth Days, and a couple of summer solstices, and I've helped build the floats. I've done a lot of other stuff, picking up trash along the beach on the cleanups, and I've been working out in Isla Vista as well at the Campbell Preserve or Reserve with Jessica. They have these snowy plovers, which are an endangered bird species. There's less than 1,500 of them left on this whole coast. Let's see, and my health is kind of dwindling now over all this. I'm 60 years old now, and I'm feeling it. Believe me, I've had a couple operations lately, and I'm due for one more on my shoulder. I'm trying to work out something with the vice principal up here of the city college, Miss Ralston, who was nice enough to show me the blueprints, which includes a bike lane, stoplights at the west campus, also a crosswalk on Oceano Avenue. And they're in dire need of some lights up there on both sides of the street. I keep getting the same old feedback, and I've been told this might be 2 years, and it could be as long as 4 years before anything is done. So if I need to get a petition or whatever it's going to take, I'm going to keep trying to get this done. And only time will tell. I know everyone is very busy about now with all the elections going on. Thanks for your time and patience, and have a blessed day.
Very good. Michael, you're next. Gerard after you. Aaron after him. Phil Walker. I know you like to sit down there. You're welcome to sit there, Michael. And I'll remind people that it's a privilege that we allow you to use visuals in this context. Go ahead, please.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Lord, give us this day our daily bread, and forgive us our trespasses as we forgive those that have trespassed against us. Lead us not into temptation, but deliver us from the evil one. For thy is my kingdom, my glory, and my grace in all things. Hallelujah, Emmanuel. Today, I will be giving thanks to the First Peoples of this area, and I will also be honoring Grandmother Agnes Baker of the Thunderbird clan of the 13 indigenous grandmothers with the Hopi prophecy. There will come a time when the earth is weeping and the animals are dying. A tribe of all races, creeds, and colors will come, and they will dance upon the land, and they will clean the waters. And they will be known as the warriors of the rainbow. Thank you.
Gerard, you're next. And I won't be taking any more public comment speakers after this. So go ahead.
Oh, I'm the last one. Oh, glad I got in. Thank you, Honorable Mayor and the City Council. I thank you so much. And I want to thank the churches in the Santa Barbara community for assisting with the feeding and the clothing of the residentially challenged. I choose to not call it homelessness. I hate that word. I despise it. I'm residentially challenged, and that's where I stand. I want to put on an event in Alameda Park underneath the gazebo, a free concert, because I have a lot of professional musicians that I know as friends. I'm going to be 62, so I'm feeling it too. But in my life, I'm a certified chef by trade, and I'm a professional fundraiser. So I'm going to bring my talents and give it away here in Santa Barbara. And I want to put on a free concert in the park, and all the proceeds will go to assist the residentially challenged people here in Santa Barbara. And that's the way I want to give back, because, you know, people helped me throughout my years. You know, to be able to live, to be able to be 59 years young. You know, and I appreciate everything that Santa Barbara is doing, from the clothing to the food. If it was me, I'd be doing breakfast, lunch, and dinner every day, 7 days a week. And I'd use my food stamps to pay for it all, because I know how to buy food. And I know how to buy inexpensive food that feeds a lot of people. Pasta, rice, you know, you can feed a lot of people with that. You know, and I could get a lot of stuff donated. I mean, tractor trailer trucks. I know the vice president of Lee Jeans, Lee, L-E-E, and the president of Speedo, the national sponsor of the Olympics. I know the president of Speedo. And because, you know, I always wanted to give back. That's why for the past 30 years, I've been working in the nonprofit industry, getting donations for different nonprofits. And my goal is to have my own nonprofit one day. And it's going to be called the Gifts from My Heart Foundation. And I want to be able to give back easily and gracefully to everybody that's in need. And right now, I'm residentially challenged. And it's hard because at my age, having chronic rheumatoid arthritis in both my legs and my hips, sleeping on the sidewalk is not very good for my body. But I'm doing it. You know, I have a daughter in Goleta. And I came up to see her, and by circumstances, I became residentially challenged. I don't even want her to know I'm here, because I don't want her to see me like this. So thank you for being here. Thank you. And if there's anything I could do to be of service to this community, you can let me know. My name's Gerard Pepe. Everybody calls me Pepe, like Pepe Le Pew, the little skunk on TV.
Thank
That's
you.
Same spelling and same
Thank you, Gerard.
pronunciation. Thank you, Mayor.
Very
Thank
good.
you, City Council.
Thanks. Aaron, you're next. Phil Walker after you, Viren David Singh, Megan Baker, and Kim Stanley. Are you here for public comment, Ms. Stanley? Okay, she'll be the final speaker. Aaron, go ahead.
Thank you, Madam Mayor, members of City Council. I was up here last week and talked about some things that scared me, and I just wanted to come up. I spoke to Holly a little bit, and she gave me some perspective on maybe some things that you guys were unaware of. So I've been on the 500 block for about 15 years, running Sandbar off and on. The last about 6 or 8 years ago, somewhere in that range, there was something called the NET team. It was called the Nightlife Enforcement Team, and they patrolled downtown Santa Barbara, kind of give us a hard time about IDing people and stuff like that, which is great. But at some point that stopped. I don't know, maybe it was a chief change or a captain change or something, but when that stopped, basically the State Street has just gotten worse. And so I don't know if you guys got the letter from Clay Holdren about him being assaulted and all that stuff. I mean, that's basically just the same thing that happened to me, but I took it outside and the guy ended up punching me. So it's kind of the same thing. But those things happen all the time. And I guess my thing is that as a city, we took away the power probably from the police. I think we were trying to be kind of nice to the residentially challenged, or people on the streets, or drug addicts, or homeless, mentally ill, whatever. And I understand that we don't want to obviously persecute somebody, but at the same time, downtown State Street is basically how this community makes its money. And I know that sounds a little crazy, but if you think about all the things that we can't do anything about, nobody's coming to Santa Barbara to see my house on the Mesa, not one person. But the things on State Street, they might actually attract people. And when they attract people, they rent a hotel or they take an Uber. And then that trickles down to the city, makes more money. So we give up our beautiful city on busy weekends, during the summer, to the people that come here in the hopes that we can make enough money from them to basically make this community better for all the other people, for Milpas, for Mesa, for whatever you need. That's the beauty of Santa Barbara. But we've failed all the business owners. And the problem is that they're now being turned into, God bless the Amazons of the world that have come here to save our city, but you've now swapped out a place that was getting tax revenue for a place that's now just getting rent. So please understand that we're now swapping places that people may have come to Santa Barbara to see and pay money to see, for places that are now businesses that just have an employee that clocks in and clock out. Great, no problem with that. However, in the end, we're gonna have less money. And so the other thing I would challenge you on is that The TOT, I think, is misleading right now because we've added a lot of expensive rooms like the California and maybe the Miramar, but we have a lot less people coming to town, and we have a state street where we're trying to attract them with that has drug addicts and homeless people and residentially challenged, the mentally ill, and it needs to stop.
Your
Please take
time
control of the
is up.
streets.
3 minutes sure goes by fast.
Yep.
Thanks, Aaron.
I'll keep coming back.
Very good. Phil Walker?
Good afternoon, Madam Mayor, members of the City Council, and City Administrator Paul Casey. I feel great today. You know, this kind of weather, my neuropathy is influenced by barometric pressure, low pressure, the rain's drenching, and I feel good. Okay, the one thing I came close to not feeling good, I was walking up here from a couple blocks on Upper De La Guerra, up here right where all the construction's going on, and this was on the it would be the northern side of De La Guerra. On the sidewalk, the rain was drenching down. There was probably a quarter, a half inch of sheet flow on the sidewalk itself. You know, I was getting through it, and here comes the guy, and boom. I didn't even know he was there until he blew by me on a bike, just pumping up on a mountain bike, pumping up the sidewalk, and it was that close. And why he didn't ride in the street where there was less water and there was no traffic on the street whatsoever. But let's hear it for the boarders, the skateboarders, because I can always hear them coming. And as a most rule, they're always very respectful. They'll pull off or I can dodge them. But the wheels on the transitions in the sidewalk have a click, click, click. And you can, bikes, I see electric bikes on the sidewalk going 30, 35 miles an hour now. So it's a big, big problem. And I'm sure people have been hurt, and fortunately I've been able to avoid it. But this rain is great. I don't think Kachuma, I don't think it dumped up there and bumped over in Bradbury, but it's good to see anyway. Thanks much.
Thank you. Mr. Singh, you're next. Oh, handouts. Okay. Thank you.
Madam Mayor and council members, my name is Brian Singh, and I recently formed the Santa Barbara Restaurant and Convenience Store Association. I have an idea to permanently revitalize Santa Barbara. I presented this to the Chamber of Commerce 11 years ago during the recession and to other business owners in the past, and they loved it, but sadly enough, practically all have changed or closed their businesses on State Street. Many organizations and the city has made valiant efforts to revitalize downtown, but to no avail. The fight against high rents, changing eating habits and taste, changing demographics, and trends that has killed shopping centers throughout modern cities and ours, and of course that led to online purchasing. You all have seen a record number of businesses close and new ones open only to reclose again in downtown. If we lose downtown to a largely residential conversion like many developers are proposing due to the prolonged vacancy, this will affect tourism adversely. What we need to do is find a solution to fix this permanently. Santa Barbara became well known from the 80s throughout the world because of TV soaps like Santa Barbara. Later we acknowledged throughout the world, Santa Barbara was acknowledged as the American Riviera. And later still, for decades, home to famous people in the arts, entertainment, social, and political arenas. We have incredibly well-known personalities living in the cities of Santa Maria, Santa Ynez, Santa Barbara, Montecito, and Carpinteria. Therefore, what we need to do is capitalize on tourism. We need to let the world know that we have some of the most famous people in the world living here or have lived here. And how do we do it? By emulating Hollywood. We make our very own Santa Barbara Walk of Fame. Or, if copyright infringements occur, Santa Barbara Streets of Stars. We start this by having the first star outside Arlington, where we host a lot of our film festivals. And upon installation of each star, we have a grand party to celebrate the event. The star will be in the shape of a square and an eternal star with the description of the award, so there's no copyright infringement issues. The star placement will continue from downtown, crisscrossing State Street to give equal exposure to businesses on both sides of State Street. Tourists will then therefore have to come and start all the way up from the CBD where the Arlington is conveniently located. They will then have to walk down back to the ocean, benefiting businesses on both sides. This will permanently draw hundreds of thousands of tourists each year from the US and abroad. This cost of these stars can be shared by the city, public contributions, and by property owners
Your
of State Street.
time is up,
As a resident, I
And you-
hope you'll give this idea some thought.
and we
Thank you
can
so
keep,
much.
we can keep these to
Yes,
take a
that's-
look.
Absolutely. Thank you so much.
Please make an appointment with Holly, and I'm happy to meet with you.
Okay, thank you.
Thanks for having ideas. Megan Baker from Westmont College. Tell us all about your program. Go ahead.
Good afternoon. My name is Megan Baker, and I'm currently attending Westmont College, as mentioned. My goal today is to bring awareness to the benefits of social media, and I'd like to propose that the most appropriate use of social media would be as informational channels that the city could use to increase its ability to broadcast its messages to the widest possible audience. By posting city updates to platforms such as Facebook, Twitter, Instagram, and YouTube, you will reach a much larger demographic that can help foster and advocate change in our growing times. And these are the people, especially the youth, who are going to be helping promote all these changes. With the city council meetings once a week, during the middle of the day, persons of lower socioeconomic statuses and adolescents are unable to attend these meetings, and ultimately they are not being represented. And 17 cities in California already implemented social media advertising and have recorded significant changes and engagement with their communities, and that as a whole says a lot for itself. However, this is not to say that social media should be the predominant tool to communicate emergency information, but posting items such as discussion boards, online services, agendas, council meeting recordings, etc., would serve the community well and be extremely valuable to the city councils in hearing the opinions of all demographics and not simply those who are able to attend these meetings. It would also be viable to update the city's website to make it user-friendly, as even I, someone who is knowledgeable and able to navigate technology, had a lot of difficulty in the navigation of the layout of your website. And through this, you can also post hyperlinks to your city website, and it could a lot for the text count that I know some platforms have. So that will also be of service. And I believe it's the duty of City Council to update their methods of communication to serve the community in the best manner possible. And this can be notably effective through the use of social media. Thank you for your time, and I hope you consider my perspective and the impact that this would have.
Councilmember Alejandra Gutierrez has a question or a comment.
Yes, thank you for
Thank you for coming by. I really would like to meet with you, so if you can make an appointment with Holly in the back. This is an idea that I've actually been thinking about it, so I would like, if you're interested, with your classmates to meet with me and we can
Of course.
Talk about the idea.
Of course, thank you.
Thanks. Ms. Stanley, you're our final speaker.
Madam Mayor, City Council members, I do want to mention something about item 8, but I'm here for another reason primarily.
You have to wait until item 8 then, but go ahead with your,
Okay.
please.
You'll be hearing some ways that the transportation, that the Lower West Side Neighborhood Transportation Management Plan has improvements for the west side.
You have to hold
And-
your comments about the
No, no,
Lower
I'm
West
not.
Side.
I'm
Oh,
just saying that you're going to hear that.
Okay.
When you hear item 8. So you're going to be hearing about how to improve the West Side neighborhood. And I also want you to know that the West Side has one park, Bonnet Park. It's in a very dense area. It's got one basketball court and a play structure and some grass. I would like you to look into opening up Harding School as a recreational zone for West Side residents. I live on the West Side, and we drive over to Washington School to play basketball on the weekends because Harding School is closed. and I think it should be open to the community for recreational purposes. There's no place to go on the west side for kids to recreate. On that same note, in my pipe dream, I think that a pool on the west side would also really be a great recreational idea. And it seems like La Cumbre Junior High might be a good location for a public pool for West Side residents. That's it.
Councilmember Oscar Gutierrez wants to speak to that, to your
Thank
comment.
you, Madam Mayor. This is something I've spoken to the principal of Harding School, and so the school district would be the governmental body to lobby about that, because they're the ones that would approve that. But I would like for you to contact me so you and I can both lobby them together, if that's okay.
That'd be great.
Okay. If you look for Holly, she can give you my contact info.
Okay.
Thank you.
Thank you.
Thanks,
Thank
Ms.
you.
Stanley. That closes our public comment period for today. Thank you, everybody, for coming out. We move on to our consent calendar. Are there items to read, Ms. Clerk?
Yes, Madam Mayor. Item 2, lease agreement with Skate One Corporation. Recommendation the council introduce and subsequently adopt by reading of title only an ordinance of the Council of the City of Santa Barbara approving and authorizing the airport director to execute a lease agreement with Skate One Corporation, a California S corporation, for approximately 4,600 square feet of building space and adjacent parking lot space at 6100 Hollister Avenue, Building 5 at the Santa Barbara Airport for a term of 10 years with 2 5-year options to extend. And that is all.
If there's no further objection, we'll waive further reading, and I'll entertain a motion to move our consent calendar forward. That was Friedman. Jordan? All in favor? Aye. Any opposed? Okay. Consent calendar done. We move on to item 7. Ms. Clerk?
Item 7, presentation from Santa Barbara County Public Health Department on regional preparedness and efforts related to the coronavirus COVID-19.
So, staff, whenever you're ready, sir.
Good afternoon. My name is Chris Males. I am the, Madam Mayor and members of council, sorry. My name is Chris Males. I'm the Training and EMS Battalion Chief with the City Fire Department. This afternoon, we've brought quite a group of individuals with us to talk to you a little bit about COVID-19. A little bit of background, COVID-19 began in the Chinese province of Wuhan and quickly spread worldwide. Most up to date, we've got approximately 118,000 cases worldwide with about approximately 3,000 deaths and 47,000 people that have recovered. As of right now, to allay some of the public's fears, we have 0 confirmed cases in the county of Santa Barbara. However, we're all aware that this is a changing issue by the minute. One word we'd really like to reiterate today is collaboration. Collaboration is very important when we have a situation like this. We're hoping that after today's discussion, our city leaders, citizens, and visitors to Santa Barbara will feel reassured that the city is placing great emphasis on the issue and is doing our very best to keep people safe. All of our personnel are networked in at a local, state, and federal level. We are receiving sound information and basing our decisions on facts, evidence, and medical best practices. From a first responder's perspective, regarding the fire department, your firefighters are equipped with all recommended personal protective equipment. We received additional training and are ready to respond to any incident in the city of Santa Barbara. Next, before we get started, I'd like to make a few quick introductions so you know some of the people that are up here with me this afternoon. From the city of Santa Barbara, if you have any questions regarding the airport, Henry Thompson is here. Any questions regarding waterfront, Mike Wiltshire is here. From your city fire department, we have Fire Chief Eric Nickel, Operations Division Chief Lee Waldron, Fire Marshal Joe Porre, Yoli McGlinchey, the Emergency Manager, Liliana Encinas, our bilingual public outreach coordinator, and we also have Dr. Jason Przdowski. Dr. Przdowski is a local emergency physician, and we are also fortunate to have him as our fire department's medical director. Dr. Przowski has spent a great deal of time up to today with our firefighters, making sure that we're educated and well-prepared. We can't thank him enough for that. From the County of Santa Barbara, we have Paige Batson and Dr. Henning Ansorg, the Public Health Officer. And from Santa Barbara Cottage Hospital, we have Ron Werft, President and CEO. We have Dr. David Fisk, who is the Head of Infection Control at Cottage Hospital. And we have Dr. Brett Wilson, who is the Medical Director of the Emergency Department at Cottage Hospital. With the aforementioned subject matter experts, you really don't need to hear any more from me. And we're hoping that between all of us, we can answer any and all questions that you may have. This is a wealth of knowledge, training, and experience with us today. And we'll begin the presentation with Paige Batson, Dr. Henning Ansorg, and Dr. David Fisk. Thank you.
Thank you.
Okay.
Your name is Mattson, M-A-T-S-O-N?
It's B-A-T-S-O-N.
B-A-T-S, thank you.
Yes, so good afternoon. Good afternoon, Madam Mayor and City Council members. My name is Paige Batson, and I am the Deputy Director for the Community Health Division of Santa Barbara County Public Health Department. So I want to thank you today for having us here to talk to you a little bit about what's happening with COVID-19. As you know, things are rapidly evolving ever since we learned of the outbreak beginning in Wuhan, China. And there's a lot going on in terms of updated case numbers. Everybody's really concerned about updated case numbers. We are receiving a lot of daily guidance from the California Department of Public Health and the CDC in terms of what we need to do as far as testing and public health prevention recommendations and so forth. So I'd like to begin my presentation, as was already stated, that we have 0 cases in Santa Barbara County. And we currently do not have any individuals that we are highly suspicious of that are going to be possible cases. And that's what we usually refer to as persons under investigation. And so, as you know, the outbreak has spread. It is now spread to other countries, Italy, South Korea, Iran, Hong Kong, Japan, and so forth. And as a result, and because it's spreading so fast, it had reached the U.S. And at that time, on January 31st, the U.S. declared a public health emergency. And on March 4th, due to cases that we were seeing here in California, Governor Newsom also declared a state of emergency. On March 5th, the Department of Managed Healthcare directed full service commercial plans and Medi-Cal plans to ensure that their enrollees have a reduced cost sharing to 0. And why this is important is because it allows for individuals who are concerned, who are having symptoms of COVID-19, that they would be able to go and seek screening and testing access without being concerned about payer sources or deductibles and so forth. So now individuals who have any COVID-19 related expenses, i.e. an emergency room, hospitalization, et cetera, will be able to do that without any cost sharing. So this is really good for us because the sooner we learn of a case in Santa Barbara County, the sooner public health can begin to implement public health interventions. Additionally, on March 8th, we received updated guidance for schools, colleges, and for large public events. And those documents provide a lot more detail than previous documents about what would we need to do and when would we begin social distancing, especially for schools that are very concerned about when do they close, how will they close, when in that kind of discussion. Those types of decisions are made with very close discussion and consultation with our health officer. But those documents are very explicit, and Dr. Ansorg will speak to those a little later. Oh, I'm so sorry. Okay. In terms of cases, yesterday morning, we had 423 cases in the U.S., And in Santa Barbara, in California, we had 133. Notice this says 114. That's because the numbers are changing consistently. So this morning, this was submitted to you yesterday, early afternoon. So this is, we now have 133 cases. 24 of them are repatriated. 44 of them are travel-related. And 28 are person-to-person. And 19 are community transmission. And 18 are of unknown sources. So I just want to say a little bit about the numbers. The numbers will vary depending upon what source you go to. There will be lag times, there will be, sometimes the media gets numbers beforehand and so forth. And also the reporting may be a little different. For example, sometimes they will report a presumptive case in their numbers. Presumptive, all that means is that the individuals are yet to be confirmed. So for us in the Public Health Department, when we are reporting numbers strictly from the California Department of Public Health or CDC. So don't be alarmed when you see differing numbers. Okay, so today we are still receiving notifications from the California Department of Public Health on travelers. We're seeing less and less in terms of those individuals that are traveling from mainland China. So also the CDC has broadened its testing criteria for what constitutes a person under investigation. This is very important because early on in the outbreak, the testing was very limited for two reasons. One is that there wasn't a lot of testing available, but also because they were restricting testing to only those individuals that had travel-related exposure and who had symptoms. Now they pretty much have broadened it, and they allow for medical providers to make that clinical decision as to whether or not testing is indicated. And that'll be based on risk factors and signs and symptoms of COVID. Additionally, we're expanding it to include for hospitalized individuals to be tested so that it can inform hospitals about whether or not isolation precautions are necessary. So that's very important for our hospital system. Additionally, they're encouraging testing for individuals greater than 65 years of age because they are more at risk, and for those with chronic medical conditions such as lung and heart disease. So these are the individuals that tend to get more ill and require hospitalization. And lastly, we still will continue to monitor those individuals who have been exposed to a suspected or a confirmed case within that 14-day period, or who have traveled to those geographic areas that I mentioned earlier. Those would be individuals that would be at risk if they present with symptoms. Okay, so in Santa Barbara, so far we've monitored 45 individuals that we were notified by the California Department of Public Health. 20 of them have cleared. Currently, we have 5 that we are still monitoring for the 14-day period. And 18 others that were referred to us, either they didn't meet the criteria, they either were self-referred and did not have those risk factors that were required, or Santa Barbara was not actually their destination. And so currently we only have one person that we're pending notification, because we get the individual's name and then we have to go out and find the individual. So far that process has worked really well. Public Health is prepared to do that monitoring. We have a very solid system in that we do this every day in our disease control and prevention unit. We do it for TB and measles and everything else, so we're pretty confident in our process. Lastly, we activated our Department Operations Center on March 6th. We're open from 9 to 12, Monday through Friday, and the main purpose for that is to be able to respond to our medical health system in terms of whether they need resources, whether masks or ventilators or what have you. So with that, I will pass it over to Dr. Onsorg, our health officer.
Thank
Thanks, Ms. Batson. When you said 45, you mean, and you said Santa Barbara, you mean Santa Barbara County,
Yes.
not just the city?
Yes,
Okay.
thank you.
And thank you for being here. I didn't say that, first of all. We're so grateful you're here. A lot of people watch our meetings, and so maybe more than they watch the county meetings. And so this is good information that you're giving to everybody. We're super grateful. Dr. Answer, thank you.
Madam Mayor and City Council members, my name is Dr. Henning Ansorg. I'm the Public Health Officer for Santa Barbara County, therefore also for the communities inside Santa Barbara County. Let me reassure you that as the Public Health Department, we do consider this situation to be serious, and we are prepared and we continue to prepare. This is what we have been trained to do, and all of us in our dedicated department have ample experience with disasters. We have been on the front lines with different communicable diseases in the past, from Ebola, MERS, over to H1N1, and all sorts of communicable diseases, and have been successful. As the health officer, I've been given the honor and the authority to make decisions with regard to limiting movement of citizens when it is important for the public good and public health. I do take this not lightly, and we are really in very close contact with the CDC on the federal level, as well with the state health department called CDPH in Sacramento, and our Southern California health officers, because our situation sometimes is slightly different from Northern California. And with our community partners, Cottage Health here in the South County, obviously, Santa Barbara, and large clinics, small clinics, and we are in very close communication. Dr. Fisk and myself are on the phone several times a day, discussing cases and scenarios and so forth. We have a very robust emergency response team at the county, which is reaching out to nursing homes, helping them to prepare appropriately for an epidemic that is, in the making. Fortunately, it hasn't spread locally here in the county, but all of us physicians, I probably can say that we believe this is just a matter of time, that we will have cases in the city of Santa Barbara and the county of Santa Barbara. Our neighboring county to the south, Ventura, just had their first case, but it was travel related to one of the cruise ships. And no other cases so forth. To the north, our neighbor San Luis Obispo do not have any cases, just like us at this point. The health officer of San Luis Obispo today sent out a message to the constituents there to recommending social distancing at this point already, because of the fact that we do believe that containment is probably no longer an option. In public health, we consider containment an option when we try to isolate sick people in the beginning and try to slow down the spread of virus disease. We've been quite successful, especially also due to the federal mandatory travel bans and so forth, and mandatory, self-isolation and quarantining of travelers coming from China. That started early in February. But now we are in the first week of March, and the landscape has shifted significantly. So we have reached out to all schools, school districts, K-12 to institutions of higher education as well. You see organizations, City College, Westmont College, and so forth, and they all have emergency plans in place. They are all advised to increase their disinfection of, frequently used surfaces, and they're all advised to not allow any sick teachers, staff members, or students on their campuses. And we're in very close communication on a regular basis with schools. our biggest concern, because the vast majority of people who will come down with this virus will have a mild, let's put it that way, a mild version of a disease. They will not require hospitalization. It's just like, a bad upper respiratory infection or bronchitis. They will recover well with chicken soup, tender loving care, as I always say, at home, and some Tylenol for fever. But about 80% can get, sometimes severely ill. And those are usually elderly people or people with chronic medical conditions, underlying medical conditions like poorly controlled diabetes or, heart failure, renal disease, chronic lung disease, and so forth. Elderly folks unfortunately have a little bit of a weaker immune system than younger people, and therefore are at higher risk to develop a severe pneumonia that may require even intensive care at the hospital. So what we would like to stress is that those folks should really be extra careful how to protect themselves, not just with frequent hand washing and hygiene, cover your cough. We all have heard this like a zillion times now, but it is really the best measure to protect yourself. Wash your hands frequently, have good hygiene measures, don't touch your nose, eyes, or mouth. If you can, it's pretty hard, I found out this morning. Don't shake hands any longer. I think it's reasonable to just do this nice old-fashioned fist bump or elbow bump or something like that. And just stay away from sick people, stay away from crowded places. Clean surfaces frequently at home, at work, and so forth. If you are one of these people with a weaker immune system, try and find out if you can work from home. There's a lot of virtual electronic ability these days. Cottage Hospital even is rolling out a virtual doctor visit, which is really fantastic. It's open to everybody, not just to Cottage patients. And so we can avoid further spread or rapid spread of the virus. If the virus were to come to Santa Barbara and spread rapidly in the community, I might be forced to, ask for or demand, more likely, cancellation of public events. At the moment, those are all recommendations. We hope that the community is alert enough to follow these guidelines, because it is going to be very protective, not for the individuals alone, but also for the community at large. There was a lot of sentiment in the community about the cruise ships for obvious reasons, because there were like 2 or 3 cruise ships that have significant outbreaks on them, and that is very concerning. We are in very close communication with the state on these issues, because we are not the only port city, but in the state of California, but I was informed by our new waterfront director that the cruise ship that was slanted for March 24th has canceled on their own. So we have a little bit of breathing room, and I understand that City Council of Santa Barbara, in conjunction or followed by Board of Supervisors of the county, have already sent letters to the cruise lines requesting to hold off on any disembarkation for now. That is the status quo. So I think our community members could feel reassured about that. For sure, that is not an easy decision to make for the city, because it has a huge financial loss for many businesses, and I understand that. But sometimes public health supersedes those concerns, unfortunately. Anything else? Let me just see. As I said, we are working very closely with our community partners in healthcare, the large and small clinics, College Hospital in particular, and from our from our health department from the county, we are rolling out a brand new website. It is going to be online tomorrow, which is going to be updated daily, several times a day, and with current information, numbers, recommendations for restaurants, public event planners, for schools, for individuals, and so forth. And we really hope that this will be a good information addition to the public. I would like to invite Dr. Fisk now to talk on his perspective from Cottage Health.
Thanks, Dr. Fisk. So there's no questions on that one section. If I could ask a question, sir?
Of course.
So you said that San Luis Obispo County is recommending social distancing, even
Correct.
though they don't have a confirmed case yet. So that's sort of one of the first steps, and then if we do declare an emergency, or if you do, right, it has to be county public health, then the different categories would be forbidding large social gatherings, or is it recommending against large social gatherings? How does that work?
Well, I think we have to sort of make a decision on every individual case.
Okay.
For instance, if you are able with a gathering to stay at arm's length, so to speak, or an outdoor venue with very good sanitary situation and everything, that might be still an option. Maybe more virtual meetings can be scheduled for, but anything that is very close contact for people should be probably canceled. But we are not at this stage at this point. And those are just measures that are part of the armamentarium in trying to mitigate further spread of the virus. Does that answer your question, ma'am?
Yes, thank you. So we're asking questions on what Dr. Answerg just presented, or and another presenter?
Mm-hmm.
Do we want to go to the well, he might, Dr. Fisk might give us information that we have questions. So let's go ahead and hold off on questions. I will too. Go ahead, sir.
Okay, thank you, Madam Mayor and members of the council. Pleased to be here this afternoon to discuss this timely issue with you all. And I will limit my comments to focusing on what's happening at Cottage Health in this regard. And I would start by saying that Cottage has been preparing furiously for this for well over probably a month and a half now, right from the time when we knew that this was going to be spreading widely. And so Cottage has convened multidisciplinary morning meetings of probably 25, 30 individuals throughout the organization, representing just about every arm of the organization to plan for this. And planning at a hospital and health system level involves not only thinking about a patient who might walk in through the ER, but it even involves small details such as thinking about eventually where your next heart valve implant device is going to come from because of disruptions in the supply chain from China. So our morning meetings have involved senior administration, leaders of the medical staff, and the emergency department leadership as well, with Dr. Wilson, who's here today. It's involved security. It's involved our laboratory, Pacific Diagnostic Labs, the main regional lab, and their expertise in deploying testing for this. It's involved nursing leadership, facilities management, those who help clean the rooms at Cottage. So truly a widespread effort throughout the organization, and we meet over an hour a day to prepare for this every day of the week, 5 days, Monday through Friday. One of our main emphases at Cottage has been to not only be prepared to take care of patients who might come down with COVID, but also to do what we can to protect our staff at Cottage so we can continue to provide services and minimize exposures to patients who have COVID. Because at the moment, although this may be changing imminently, at the moment, if a healthcare worker is exposed to someone with COVID, they need to take 14 days off work. And when you're dealing with highly skilled and highly trained staff and people with a lot of experience, it doesn't take long until you are compromised as a healthcare organization if you've got large numbers of people on furlough. So to that end, we have deployed efforts to reach outside the walls of Cottage to the media to try to get the word out that if someone thinks they're going to need services at Cottage, i.e. through the ER, that they call first if they think they might have symptoms of COVID. So they can actually be met outside of the hospital and by staff who are prepared to take care of them, staff in protective gear, so a potential patient can be masked and brought into our specialized negative pressure rooms to minimize transmission within the hospitals, in accordance with guidance we were receiving from CDC and CDPH on that. Similarly, we have signage posted at our public entrances so that the public knows that they should not be visiting Cottage if they have symptoms of a respiratory infection, so we can start to minimize transmission on that front as well. And our marketing team has been working with the media and others to get that word out to the public. And those are all part of our efforts to protect our staff. A few other highlights of it, we have really been focusing on the equipment we need to provide care for COVID patients. In particular, N95 masks, which we in Santa Barbara are all too familiar with, as Dr. Ansorg mentioned earlier this morning from fires. These masks are the standard mask that healthcare workers wear at the moment when they are taking care of a suspect patient with COVID or a confirmed patient with COVID-19. And these are international shortage. Cottage, fortunately, is well stocked in N95 masks, but we continue to monitor that supply very carefully and also to implement processes and procedures to limit our usage of the masks. Because during a time like this, sometimes the masks vanish for people's personal consumption, and we need those to do our work at the hospital. So the hospital is being very proactive in actually limiting access to N95 masks to the healthcare workers who are going to be directly involved in caring for these patients. We're also monitoring supply lines for gowns and gloves and goggles and face shields that we need to care for Cottage patients, and have been able to successfully, I think, secure alternate sources when some of the primary supply chains have been disrupted due to trade issues or production problems, in many cases from China, as they had grappled with this epidemic. Cottage has also put into place widespread education campaigns of our staff, ranging from the basics of what COVID is, all the way to what you need to do to protect yourself, and actually giving us refresher courses on putting on and wearing appropriate protective equipment as we provide our care for the patients. And that's been done both in person and with online videos have been posted, and emails, and many avenues of education that we are pursuing. The Cottage is starting and working on developing contingency staffing plans if indeed our staff was compromised and not able to care for patients because we were sick. And so that's also something that we've been proactively pursuing, and also working diligently to communicate with our partners in providing healthcare throughout the region. And as Dr. Ansorg mentioned, he and I almost have a hotline back and forth with each other right now, and that's a very productive dialogue so that we can try to address patients who might have symptoms of COVID that have come to our attention, or patients who have risk factors, but also to develop widespread programs and roll out systems that will help our community at large in preparing and managing this when it does come. And I fully believe we will be having confirmed cases in Santa Barbara, and we'll be having people sick enough that they require inpatient care for this in Santa Barbara as well. Another thing that Cottage we're doing is not only being reactionary to what's coming, but we're working to anticipate what might be coming, because the nature of this outbreak is changing so quickly, as Paige said, hour by hour, day by day, and that we need to be flexible in our approaches. And what might be guidance from CDC one day can change the next day, and sometimes we see things locally on the ground here where we feel we might need to take an approach slightly different from what's recommended from CDC, because it takes time for them to implement things on a national level. So with that, I would just also add the virtual health platform that Dr. Ansorg mentioned is something that Cottage is expanding, where part of the guidance from CDC now is if you don't have to go to your doctor and might be able to communicate over the phone if you have a COVID symptom, think about reaching out to your doctor that way. And Cottage has this service available now, and so people can reach healthcare providers if they have concerns about COVID symptoms, yet that doesn't require a face-to-face visit that then would potentially expose a healthcare provider's office to the virus. And that's all I have, so thank you.
Okay, so before we end, I just want to share, we're really excited about our new public information portal that's supposed to go live this evening. It's supposed to be very user-friendly. It's much more robust. It's going to have a lot more real-time information. So we encourage you to visit our website if you want to receive just daily updates. It should be live this evening, so for more information, visit us. Thank you.
Thank you. We'll take questions from the council, and then we'll do public comment. I'm assuming we have some speaker slips. Ms. Harmon, you go ahead first.
Thank you, Madam Mayor. Thank you all so much. I learned so much from this presentation. I really, really appreciate it. So my questions fall into a couple of different buckets. So I'll just start first with the virus itself. And I should preface my questions by saying I'm asking these of you because a lot of people have come to me asking these questions, so I'm hoping you can shed a little bit of light. COVID-19, can you talk to us about, I've heard from a lot of people it's just like the flu. Is that true? What makes it different? And I think there's some confusion about what it is, and that is increasing the level of anxiety. So can you describe, and you did it in your presentation, but tell us a little bit more about the symptoms and what makes this different from a very bad flu season?
I would respond to that, and thank you for that question, because that is a very important practical thing for those of us to consider as we're thinking about our own health and the health of our loved ones. And the COVID-19 virus is a virus that infects our respiratory system, and it can infect us from the upper part of our respiratory system, such as the back of our throat, all the way down into our lungs. And so, as Dr. Ansorg mentioned, most people who get infected with COVID-19 will have symptoms of upper respiratory infection, what we all think of: sore throat, cough, potentially congestion, feeling lousy, malaise, but we're not seriously ill. We don't need oxygen to breathe. We don't have pain in that situation when we breathe, and our breathing rate is not dramatically elevated. COVID can, and in the cases we're seeing that have severe outcomes, move to the lower respiratory tract, and there it causes symptoms of pneumonia, which is pain with breathing, inability to catch one's breath, can't get enough oxygen in, and eventually, if it gets really bad, inability of the lungs to function and do their critical work. So that's the big picture of sort of how it behaves, and the distinction for those of us in the healthcare realm is when has it moved into the lower respiratory system where pneumonia and compromised lung function are present, and when somebody may need additional levels of care in the inpatient side and to be admitted to hospital for that. Now, influenza can do the same thing. However, influenza, many of us have partial immunity to influenza from previous exposures to currently circulating influenza viruses or similar influenza viruses that have circulated in the past. We don't have immunity to COVID-19, so people are more susceptible to it on average than they are influenza. However, influenza in terms of symptoms is more likely to show up with having fevers than COVID is. We at first thought most people with COVID-19 had fevers. We now know it's in the range of probably 45% from some of the studies coming out of China. But certainly influenza, another hallmark of that is very, very sudden onset of symptoms. You can go from feeling fine to feeling like you're hit by a truck and shaking so badly you can't hold a cup of water within 5 minutes. And influenza For those of us, any of us who've ever had it, is a very dramatic onset of illness. COVID may not be that way. It can be rapid, but it also can be slower over a period of days in its worsening of symptoms. So there is a lot of overlap, but there are some subtle differences in terms of how the virus symptoms show up. But that's, to me, as an infectious disease physicians worry about influenza more than anything, as its potential to be a devastating disease globally. And we've learned to respect influenza from the previous epidemics and pandemics that happened, and from the sheer fact that it's still, killing about 20 to 30,000, sometimes 50,000 people in a year in the United States on an average year. And so whereas COVID so far, almost all the cases that have led to death in the United States have been associated with one nursing home in Seattle or in Kirkland. Influenza, as they say, it's killing a jumbo jet full of people every day in this country. And so, yet we don't worry about influenza. So that gives some perspective on the situation, I think.
Thank you.
There's just one thing I think is crucial also for the citizens to understand, is that bad outcomes in COVID are really limited to elderly folks and people with compromised immune systems or chronic diseases. It's very rare in children. And if they have something, it's very, very mild, just the sniffles or something. That's our understanding so far. Whereas influenza can kill children, can kill healthy younger adults in great numbers. So there is another difference to the influenza outbreak. Not to minimize the risk of COVID, but just as Dr. Fisk alluded to put it in perspective. We tend to forget about the influenza risk.
Thank you. My next question was about vulnerable populations specifically. So children, you said, are not particularly susceptible to this. I haven't heard anyone speak about the impacts on pregnant women, pregnant people. Can you please address whether that is of particular concern?
Sure. I think the answer is it's too early to really know its impact on pregnancy. We would have reasons to suspect that pregnant women may not do as well if they get infected with COVID as a woman who's not pregnant. And that's based on experience with other viruses like influenza, where influenza kills pregnant women at 5 times the rate of non-pregnant women. But it's still very early to know, and there are paradoxically some conditions that when women who are pregnant get sick with them, they actually don't do as bad as other people. So I think it's too early to tell, but we do have concern about potentially women who are pregnant and this virus. The thing that we are seeing, though, is people in institutionalized settings, such as these nursing homes, are particularly vulnerable, not only because of age and its impact on immunity, but because of the close quarters that people are in. And just like we saw in the Diamond Princess cruise ship, this virus can spread rapidly in close confines.
Thank you. Just a couple more questions. Thank you.
Take your time.
I'd like to move on to testing. And as someone myself who is not necessarily in one of those vulnerable populations, if I come down with what could be a common cold, how is someone like me supposed to determine whether and when to seek testing specifically for this virus? And really, what do we want? What would you like us to tell our neighbors when they say, oh, I have a scratchy throat, and is this COVID-19, should I get tested? Where's that line, and how do we draw it?
Well, let me answer in a roundabout way. If we suspect somebody has influenza, we want them to be tested as quickly as possible because we have medications that only work if you take it as soon as possible. With this virus, it's a little different. This virus can start very mildly, and you just have something like a bad cold maybe, and then over time, sometimes over a week or two, it can develop into a serious lung issue. So if somebody who is generally relatively healthy and feels a little unwell, like I'm coming down with a little cold, like flu-like something, I don't think it's reasonable to immediately get alarmed and race to the doctor to get a test. Our testing capability is still a little bit limited, even though it is really ramping up dramatically compared to last week. We not only have public health labs run the tests, which is a little cumbersome because they have to be approved by me to be run at the public health lab, but as of today, LabCorp and Quest are running those tests that can be ordered by any provider without any need for approval by public health. So that is a big advantage. We are hoping that the providers use the testing capabilities judiciously in the beginning until we have really a lot of test kits available, that even minor cases could be considered for testing. At this point, we encourage our doctors and providers to utilize the test judiciously. And one of the reasons is that it doesn't mean that the sooner you test, the better your result is going to be. If you're generally a healthy person, you should just stay home, take care of yourself in the usual manner, and not go to work, of course, and not make other people sick. But there is no medication out there that would shorten the course until now. But things move fast, and maybe in a couple of weeks we do have a medication.
And I would add, from the Cottage perspective on that, that if you have mild symptoms compatible with an upper respiratory infection and you come to the Cottage ER requesting testing, you're not going to get it. And so we feel very strongly that testing is appropriate for those who are going to require hospital admission because it will inform other aspects of their care when they are there, but it also is done to help identify potential patients who could spread it within the hospital. If we did not test them, we wouldn't know that and put our staff at risk. But we also feel that it's important to protect the capacity of the Cottage Emergency Department to care for people with other disorders. And if suddenly there's 1,000 people coming to Cottage ER saying, I want to test because I have a sore throat, that's going to impact the ability to provide care to our community for other illnesses.
Thank you. That's extremely helpful. And can you briefly describe, just so folks know, what type of test is it? A swab, a blood test? What is it?
Yeah, the testing involves swabs of the far back of the nose and the far back part of the mouth. And if someone is making has a cough that produces sputum, that is also sent off for testing.
Okay, thank you. My next question, you talked about the outreach that you're all doing, which sounds so wonderful. Have you translated that information into Spanish for our Spanish-speaking neighbors? How are you communicating with those folks?
Yes, our website, everything we are producing. Oh, I'm sorry. Yes, everything we are producing from the Public Health Department is translated in Spanish, and that goes all the way from our press releases to our educational materials.
And my final question, I think, is for Mr. Casey. I'm hoping that you can describe for the public quickly the city's contingency plan. I know you all spoke about, particularly at Cottage, how they're dealing with staffing issues that may arise. Can you tell us a little bit about the city's plan?
Yes, thank you. Madam Mayor and council members, very similar to Cottage and other major employers in town, and probably most employers in town, needing to plan for a scenario in which we have a number of vacancies and having the backup and plans in place to maintain critical services. We provide a lot of critical services, from running a water and wastewater treatment plant to having fire personnel and public safety personnel and others. So each department is kind of its own unique operating circumstance, and so they're putting those plans together and having them in place. Well, at the same time, we're encouraging people, if they're sick, to stay home. We have a lot of dedicated staff who want to come to work anyways, but we're following the guidance that if you're sick, stay home so we don't get more employees sick. But we are putting those plans in place and are confident that we'll be ready.
Thank you. Thank you all very much.
Mr. Friedman, and then Ms. Sneddon after you.
Thank you. I have a few questions. The first is kind of staying on what to do if someone gets sick. And for full disclosure, my spouse works at Glida Valley Hospital. And so we talk about it there. So if for some reason, either at Glida Valley or anywhere in the community, the recommendation is to go home for 14 days, and you live in a household where there's children and a spouse, what do the children and the spouse, should they self-quarantine as well? Because it's not like you can separate the sick employee from the family.
Well, we have to deal, in public health, we have to deal with similar situations frequently in tuberculosis care, for instance, where, one person in the household has to isolate. There are ways to do that. Even in a household, believe it or not, it's really interesting, but our disease control team is very good at assessing those situations, and I think the recommendation cannot be one size fits all, but probably has to, it depends on your apartment or house, how many bathrooms are in there, are there shared spaces, or can one person maybe be, a sick person maybe be more isolated in a bedroom with an attached bathroom if the luxury is there, and scenarios like that. Paige, do you have any other input on that?
I think in the event, I'm so sorry. In the event of a COVID case that we had at home, and if we had to consider those household members as exposed, we may want to consider putting them also on a 14-day quarantine. So it just depends on the context. So, and the other environmental factors that Dr. Onsorg just mentioned.
Thank you. That's important. I want to stress that to the public is each case would be evaluated as they come in, and so that we can make informed decisions on that. And kind of along those lines as well is I also work in a grocery store, and as the media and others have noticed, there's been a lot of buying and a lot of crowding in our grocery stores. And so any just best practices, because there's a lot of concern about places, say that a health order comes out to limit going to crowded locations. But yet grocery stores are crowded locations. How should the community deal with basic essential services such as shopping for groceries or things of that nature should a health order come out?
That's a good question. I usually recommend to go to the grocery store at 7 a.m. But I don't know yet. The honest answer is I don't know yet myself, but fortunately I have a very dedicated and smart team behind me, run by Paige Batson with 20 years of experience with all sorts of disasters. And, we probably can rely on fire and emergency personnel and first responders if that were, a scenario that you're talking about where nobody is allowed to go to the grocery store, that we provide, to our community members.
Thank you. My point was more of their crowded spaces, so just take the normal precautions that you're recommending now.
Definitely. Normal precautions, wipe down the grocery cart handle, of course, and, try and find times when the store is not as crowded. So the 7 a.m. was not just a joke, even though it is a little bit of a joke, but there are rush hours at grocery stores, and try and have as much room around you as possible. We're always saying arm's length, so 6 feet away from a different person. Try not to stand in a line for a very long time, and that's make sure you wash your hands frequently. After you've been to the grocery store, make sure you wash your hands.
And earlier it was mentioned that on March, Governor Newsom declared a state of emergency. Can we better define what that is? There's certain legal things more towards funding, but what does that mean as a state of emergency? Because what I want to clarify is it doesn't mean shelter in place or those types of things, but can you help us understand what specifically a state of emergency is in this case means?
Basically, it means a lot. It means it can offer us certain immunities within the state. It also can bring in more resources, and it's more along the lines of resources and being able to. The immunity piece is probably the biggest thing that at least when they declare that. It also helps us when we declare something locally to be able to draw upon resources as far as prevention and so forth. So it's not necessarily that there's more dollars available or that more anything happens, but it's more of a process.
Okay, so it's more related to the available resources that we have at our disposal to both react and plan for this, and it's not declaring that the number of cases has reached a certain threshold.
Yeah.
Thank you. And I also have, before I get to cruise ships, a question about our homeless population. How are we working to provide services and make sure that our homeless populations are being tested if they should be, or what happens if they need, if there is a positive, or trying to make sure that they're in situations where they can have prevention as well?
Yeah, that is obviously a very challenging topic. How to protect the homeless population in a time like this. This is a priority that we are working on internally in the county and with our partners in the city and county. We are, evaluating setting up hand washing stations. Obviously, somebody has to pay for that. They need to be maintained, secured, protected from vandalism and all sorts of things. They have to be in really strategic places, and as well as the shelters need to have, and they do have, a very strong and robust plan in place. They have very strict guidelines what to do with, somebody, for instance, who has tuberculosis, which is sort of a respiratory infection that is very contagious. We oftentimes put up patients who have come down with tuberculosis in a motel with a good ventilation system, where one room has essentially isolates them totally with their ventilation, so other motel members, guests cannot get sick. And we are looking into very various scenarios in how we can address the homeless care under these circumstances.
Thank you.
Mr. Friedman, I'm going to take the liberty of calling up Jeff Schaefer with SB Act, Santa Barbara Alliance for Community Transformation. There are nonprofit partners in dealing with people who are residentially challenged. And Mr. Schaefer, if folks, is it okay if it's your presentation, but Mr. Schaefer is working on this issue with us internally?
Yeah, thank you, Madam Mayor and members of City Council. I don't have a white coat, so I'm not the medical expert, but our role is really to try to coordinate all of our homeless service providers, as well as those individuals and families experiencing homelessness as well, to coordinate a plan. So we've already been on the phone with all of our shelter providers as they discuss to talk about what their plan is in place. We have our steering committee on next Wednesday, where we're going to take with 18 different partners, so we're going to take a percentage of that time to put toward a discussion about all the plans of the homeless service providers. Yoli has already been in contact with us from the city as far as emergency management, so she's given us some training. Today there were several phone calls with the COC and also the city that different providers have been on to get educated themselves. We have a lived experience working group this week, Thursday at 1 at Christ Presbyterian, where we're going to begin to gather together some of the individuals experiencing homelessness, have a discussion with them about how to help them and how to communicate with the population that's experiencing homelessness as well. Our ultimate goal is to, as the street population, due to comorbidity and other health issues, is more vulnerable, to support them. So also the Alameda Park meal sharing, which we oversee and coordinate. We have a meeting Thursday night with all the meal providers to discuss what we're going to put in place. We've reached out to the county to get their policies, and Parks and Rec and Public Health to put some stuff in place. Because those meals, both Pershing, Alameda, so there's a Sunday, Wednesday, and a Thursday. Most of those meals are not just food, but they're also connected to Doctors Without Walls, connected to organizations such as Home for Good, AmeriCorps, CityNet that try to get people into housing. So those meals are still very important to keep going if we can, depending on social. So we're doing the training on social distancing and all that, but we don't want to also pull away. And also to protect volunteers. There's a lot of volunteers that are working at these meal sharings that are a little bit older as well. So all that's very important. I think what's important for us is to have the correct connections with the county and the city so that if things are put in play, that we make sure we're communicating to all of our partners the right message at the right time in a timely fashion. And I feel like through our steering committee, those are all things that we can do as well. So those are, everyone's kind of at a different place, but I know the Transition House, we've been in contact with Salvation Army, PATH, and who am I forgetting? Rescue Mission. They're all putting things in play right now due to various trainings they're having.
Thank you, Mr. Schaefer.
Thanks, Mr. Schaefer. Go ahead.
Mr. Casey, maybe this question is, I have questions regarding cruise ships and then also the airport. Is now the time to ask those questions with staff or Madam Mayor?
Yes, please.
I'll start with cruise ships because that has been a very engaged topic with the public. And Mr. Wiltshire, if you could give us an update on the cruise ships, the future scheduled visits, and then what steps we're taking at the city and other measures, and also in terms of putting a temporary halt to them until the CDC changes their travel guidelines on them. Who has oversight over this? What's the city's role in this? If you could just give us an overview of cruise ships.
Yeah, absolutely. Madam Mayor, council members, Mike Wiltshire, Waterfront Director. I'll give a little background on cruise ships. So our next previously scheduled visit was March 24th, which was the Grand Princess, which has self-canceled. As of last night, the mayor and the county has issued a letter requesting that our remaining cruises not disembark in Santa Barbara until the CDC recommendation to not travel by cruise is lifted. There was the remaining 10 cruises between now and June 17th. So the thought on the city side is really to tie this to the CDC. They're really the experts on the disease, and we're not necessarily the health experts. So relying on them and Santa Barbara County Public Health to make some of these decisions based on cruise ships will kind of dictate where we go. A good thing is we have some time. So as of now, we haven't heard back from the cruise industry on our request, but if they abide by that request, then we are cleared through summer. And we typically have cruises in spring and fall, so June 17th would be our last one for this season.
And there's been some talk about why the request rather than just stating do this. And can you talk to the jurisdictional issues of this so people understand what authority we have and other agencies that might have authority over cruise ships coming to our area?
Yeah, Madam Mayor, council members, without getting too far out of my lane, I don't want to speak legally too much about it, but I'll defer to our city attorney on that.
Thank you.
Mr. Kalan, thank you.
Thanks, Mr. Wiltshire. Madam Mayor, members of the council, Councilmember Friedman. On February 2nd, the Coast Guard issued a Marine Safety Information Bulletin. That bulletin notified ship commanders that symptoms related to COVID-19 were hazardous conditions under federal maritime law, and that the ship commanders had to report in with the relevant authority for Santa Barbara, who happens to be the district commander of the 11th District or the captain of the port of Los Angeles and Long Beach. We have a marine safety detachment here, and our port is regulated by the captain of the port of Los Angeles and Long Beach. So anyway, that bulletin's still in effect and will prevent ships from both entering navigable waters or mooring or anchoring here without communicating with the Coast Guard. And it sets up this Marine Safety Information Bulletin, sets up a detailed protocol to make sure that exposures within the last 14 days are covered. Having said that, I've also advised Mr. Wiltshire that either coming ashore or disembarkation, whatever you want to call it, in Santa Barbara can be regulated by the city, provided we have a public health emergency and provided that that regulation is consistent with orders from the captain of the port for the Coast Guard.
So we will be monitoring with our public health experts as well as the Coast Guard for the future going forward on these, on terms of our options for limiting them.
Yes.
And then maybe Mr. Kalan, and this would be Mr. Thompson. For airports, there has been some, we've been communicated on the airport itself and what is the risk of the airport, and can you speak to the airport, please?
Yes, sir. Madam Mayor, Councilmember Friedman. To date, the airport is experiencing business as usual. We have not seen a drop in passengers or service provided at the airport. However, we do expect that as this pandemic evolves, we're going to see some type of an impact, likely a reduction of passengers, a reduction of scheduled service into the airport. We're thinking possibly in the month of April is when we'll begin to see the impact, and that's based upon information that we're receiving from airline bookings at this point in time. We are monitoring, what's happening. We're taking our information and guidance from the experts, and that's at the federal level. So we take direction from the FAA, DHS, CDC. They're monitoring air travel, and there is currently no domestic travel ban in the U.S., and I think that's important for everyone to understand. The travel bans are only affecting international ports of entry, of which Santa Barbara is not, and for travel to destinations like China and Italy at this point. So there's, the experts are saying that the risk of contracting this on an airplane is relatively low. And so you have to listen to what the experts are recommending and look at your own personal circumstances and determine whether or not you should travel or not. But we do not currently have any restrictions for Santa Barbara.
Thank you.
Okay.
That was Henry Thompson, our airport director. Thank you, Mike Wiltshire, harbor director. Stand by, there might be more questions. And folks, I hope you don't mind if those questions come out of our staff and maybe you're learning something and we're all in this together. So thanks. You're done then, Mr. Friedman? Ms. Sneddon, go ahead. Oh, Ms. Batson.
Oh, yes, I just want to clarify what the state of emergency proclamation means, okay? I'm going to go ahead and read this. Aside from allowing more resources, it says that the emergency proclamation includes provisions that protect consumers against price gouging. That was a big one, and I couldn't think of it right offhand. And it also allows for healthcare workers to come from out of state to assist at healthcare facilities and give healthcare facilities various flexibilities that they may need. So there's more to it, but those are some of the key changes that would happen with the proclamation.
Thank you for those clarifications. I think those are all helpful for us in understanding the response and the elevated response we're not eligible for because of that. Thank you.
Yeah, they just don't want to charge $50 for hand gel.
And Madam Mayor, I
go ahead.
Got to piggyback on what Ms. Batson said. One of the interesting things in that proclamation is that the governor has essentially commandeered the fairgrounds, including Earl Warren, as space available should it be needed.
Great, we're getting a lot of information. Ms. Sneddon, go ahead.
Thank you, Madam Mayor. Many of my questions have been answered. Thank you. And I so appreciate you being here to answer all of our questions. Some of these are random and come from people who've asked them of me, and I think it's better to have the experts answer them. And the first one is, do we know how it's actually transmitted? I've heard recent things about fecal shedding or touching surfaces or airborne or stay 6 feet away or further than that. Is there information on how it's actually transmitted, and can it be transmitted through animals or just person to person? How long does it live on a surface? That kind of thing.
The primary mode of transmission of this virus is through respiratory droplets. And so those are droplets that we extrude from our respiratory tract when we cough or sneeze. And they have the potential to travel short distances. meaning a few feet from the body. Okay, it's different from something like chickenpox, that is a much smaller particle and can travel or stay suspended in the air for a prolonged period of time, and that we then just breathe in. But this is something that is felt to be transmitted by droplets, so being in that's where the close contact becomes a factor. So if you're 6 feet away from someone, your chance of acquiring this through a droplet that's comes out of someone else is much lower than if you're 2 feet away. These droplets can live on surfaces, so there is the potential for transfer to someone if you touch a surface and then touch your mouth or your nose or your eye. And so there is certainly some potential for that, but the primary mode of transfer is felt to be through direct droplet transmission. It is not, there is not, realizing that we are still early and this is a virus we just found out about in December and we're learning more about it, we do not have particular concern about transmission through our waste. And so the CDC has issued no special guidance for handling of human waste in the healthcare settings. And also we don't believe that pets are major vectors for this, although they might actually transiently in a short term have the virus like in their respiratory tract. We don't believe so far, based on what we know, that they then incubate it and become factories for spreading it to other pets or other people.
And how long is the resident time on a surface? So a droplet hits a surface, how long is that virus?
Yeah, it's a period of several hours. I think that's still somewhat up in debate. When a situation like this comes out, from our experience with other viral infections, we might hear an initial statistic, and then later on we hear a statistic that's several days different from the initial value. So I think it's fair to say it's a matter of several hours, but how long, I don't think we really know.
Thank you. And then along those lines, with disinfectants, and people we're out in stores, and I hear now you can't get it on Amazon, hand sanitizer, and how important is a particular type of hand sanitizer or soap and water, or people talk about making their own with various ingredients.
Vodka.
And vodka and aloe, I hear, but then the vodka is not high enough alcohol content. And I mean, we're getting to a place where you go to the store, it isn't there, and people are coming up with very creative ideas. And do you have anything to offer on that?
I think I would defer to Dr. Ansorg's expertise on that. Okay.
So soap and water is still the best cleaning method. Always, if available, it's always better than a hand sanitizer. If you can have, there's no usage, there's no water and soap available, a hand sanitizer is the second option, and it needs to have 60% or more alcohol. And that's why vodka doesn't work. Doesn't have 60%, only has 40% of alcohol, and therefore it's not
It's
sufficient.
a legitimate question. Yeah, I mean, there has been a lot of discussion about that.
With regard to cleaning, diluted Clorox is perfectly appropriate for cleaning surfaces in the house, or even, so there are EPA-regulated cleaners that are used in healthcare settings and so forth. But for regular households, just dilution of bleach essentially is perfectly appropriate to kill the virus.
Thank you. And then along those lines, people are stockpiling water. Can you speak to the safety of our water sources?
To my knowledge, there is no risk to the water sources because there is no fecal-oral transmission.
Thank you. And then, there's my question there, vodka and aloe, but you answered that. Spring break is coming up. Any advice for either people here traveling or the people who may be traveling to come here? Any special precautions for spring break?
I think our creativity is really, in demand with creating a different kind of spring break experience this year, because the counties in California have different rates of disease currently. Santa Clara County was the first one that actually issued, social distancing order, strong recommendation. Other counties have followed up on that, and so air travel is always an issue. However, yeah, I think it also depends on who is traveling. So again, if somebody is elderly or has underlying medical conditions or has a weakened immune system for various reasons, they should really be cautious and make maybe postpone the travel plans or make different plans. And I hope that our social media frenzy population will post a lot of good ideas, and I'm very eager to learn more myself. But I think our creativity is put to the test here.
So staycation.
Yes.
Okay. And then the question was answered about a Spanish-speaking community. Any particular advice on food handling? Buying food at the market? Any particular special care?
I think a much bigger risk from food handling is E. coli infection or salmonella. In reality, I think that's what we see from our food supply, and that is a major public health issue that gets very little attention, but leads to large numbers of deaths and hospitalizations and millions of illnesses annually. So I think the same rules apply with our food handling for this as applies on a general any given day of the year. If you're handling meats, in particular, you need to not only wash your hands before and after, but you need to wash down the surface that contacted it. When you were preparing it before it was cooked, you need to cook foods thoroughly and wash your vegetables, even if they're triple washed, pre-washed at the grocery already. You need to wash them on your own again.
Thank you. I just have a couple more questions. So you said that the growth rate might be different in different cities. Do you know what the current, is it like 1.5 or around, or do we know the current growth rate? I realize it changes daily, hourly, but.
Well, we believe it's similar to influenza. So on average, one sick person will make 2.5 other people sick. But we learned so much about this virus. This could change once we find out that there are a lot of actually people carrying the virus who have very mild disease and they don't seek healthcare necessarily and don't get tested. Once those numbers get included, our percentages will be very different. We are always really smart in hindsight.
Mm-hmm. And then with children, they may not exhibit extreme signs of the disease, but they may be incubators or carriers?
Potentially.
Yeah.
We don't have really solid science behind that, but that is definitely a possible scenario that we need to be aware of.
Okay. And then just one more. I was really happy to hear you say that we need to be nimble and that we're responding to this locally in a way that might not be the same as a different city or a different area, and I just really want to express appreciation for that. And so I am wondering too, though, how will the community be informed when things change, and who makes that call? I hear what you're saying about some of the calls made, but who is the team that's deciding when a major change will happen, and how will the public be informed?
Well, we have a public information officer with a whole team, from the county health department. They are probably the main distributor of messaging to officials, to other agencies, to our partners in healthcare and emergency responders and so forth. And it is pushed out through press releases, through provider alerts that go to all doctors in the area, through social media, and as of tomorrow morning, also our updated website with really updated current information and guidance. And then we have phone calls, and once we would declare an emergency, we will have what we call the JIG, a very highly staffed phone operation for people to call in as well and get advice.
Excellent. Thank you. It's so helpful to have one source of information in place to go as we get all these different questions and misinformation. And it's very helpful to be able to tell people where to go. Thank you.
Councilmember Alejandra Gutierrez. Thank you.
Thank you again for coming in. I have a couple questions, so please bear with me. And some of my questions also come from the community, and some of my questions are also if it hits Santa Barbara, what is our emergency plan type of questions. I represent a district that is a bilingual district, but from what I experience and my neighbors experience with the mudslides, a lot of them live in homes with a lot of family members, and I know that the information is online and it's in Spanish, but what type of outreach, like community outreach, are we doing to give the information we're learning now? Because these are also the individuals that might not be insured, hesitate to even go to the doctor during the year. They have to work because their daily work depends on paying the rent at the end of the month. So I know that the fire department does a great job with Liliana. I know she's very known in the community, so I want to acknowledge that. Thank you for your work. But overall, what is the county and the city doing?
So one of the things we've been doing, as with other kinds of diseases and TB and whatever, influenza, one of the things we're trying to do right now is reach out to the Spanish radio, finding other methods of communicating. We just did a couple of Spanish radio, and where there was, the different radio stations have really allowed us to reach a community that wouldn't typically go online or are not able to access information during regular business hours, if you will. So that's one of our methods of trying to reach that population.
And Madam Mayor, while Ms. Encinas walks up, I want to, City Council during the last budget cycle identified this as an area of need of improvement for the city and funded a position that we embedded into the Fire Department Office of Emergency Services to provide that bilingual outreach that then does become a citywide resource at times like this. And so then we hired Ms. Encinas, who agree is fantastic, and she can kind of share with you more about what she's doing.
Thanks.
Good
Ms. Encinas.
afternoon. Good afternoon, Madam Mayor, members of the council. Thank you, Ms. Gutierrez, for that shout out. I try to include all of our community with our emergency messaging. And so we do have ongoing collaboration with the County Office of Emergency Management, and we make sure that whatever information goes out to the public goes out in a timely manner in Spanish as well. We do have citywide, we have a whole community committee, which consists of local nonprofits, small businesses, places of worship. And so we don't summon them, and I quote unquote summon them with frequency unless it's an important subject to touch. And so we will be doing that in the next week. We will be summoning these nonprofits, and it's a large consistency. It consists of Latino Elders Outreach Network, several networks that get together. And then we are trying to update our information either through social media or on our website. And we do have an information line where people can call in, and it's a number that they call, and we have a message specific to, right now it's COVID-19, whatever the emergency is, it's in English and in Spanish. So those are some of the things that we are doing citywide.
Thank you.
Thanks.
I'm just wondering, is it possible to provide information about our website? Because as I mentioned, our information is also available in Spanish, and we have an outgoing message line. And so later on, depending as things progress, we will possibly set up like a hotline or maybe even a call center so individuals can call and ask questions as well. And those will be staffed by bilingual staff as well.
And we do have a great relationship with our radio, or Spanish language radio, and actually we have a live interview tonight. And so they do give us on-air time, and we always refer to our county public health, and we do refer them to the Center for Disease Control or for the state public health department, because all three platforms do have Spanish language information. So thank you.
Thanks.
So my second question, I wrote a lot of these questions on my phone. I'm hearing doctors on a national level saying that for many survivals is going to boil down to ventilators, breathing machines to help those with the worst case. Getting clear on how many we currently have, where they are, and how we can get any if we need it. What is the planning around the ventilators?
I can speak to that in part from Cottage, that Cottage, not only for ventilators, but negative pressure rooms, where COVID patients would be cared for initially. Cottage, throughout its system, has 47 negative pressure rooms already up and running, with the capacity to add significantly larger numbers of those should they be needed. Cottage has, as you know, multiple intensive care units, surgical, medical intensive care units, and pediatric intensive care and neonatal intensive care units. And we have, at the moment, my understanding is just shy of 1 ventilator per ICU bed. There are caches of these in emergency supplies also available if more were needed, both from Cottage and I believe Dr. Ansorg had mentioned earlier, some through their resources as well.
So just to let you know, we have 5 hospitals, and across the 5 hospitals, we have 60 airborne isolation rooms, and we've calculated that there are 32 vents available amongst all those hospitals, but we also, Santa Barbara County Public Health Department also has a cache of ventilators that can be used to assist our hospitals if needed.
Thank you.
I think that the ventilator question gets invoked when outbreaks like this are modeled for the most severe type of scenarios. And if you look at the most severe scenarios that have been modeled of this, ventilators do come in short supply. But I think given what we're seeing globally, we're unlikely to see that severe of a scenario here.
Okay, thank you. Let's see. Bear with me. I did say that I was going to ask some crazy questions. So the public is also wondering, again, worst case scenario, people are hearing that it's going to get worse than, eventually it's going to happen here. So they're worried about if the city or the county has a plan for large quarantine places. Also, during the mudslide, we have a large population that commutes from, Santa Maria or Ventura, Oxnard to work here, like nurses, doctors, police officers. So is there a plan in place for that?
Maybe I can speak to that. Large quarantine places are needed to watch over healthy people who've been exposed to a disease. So, for instance, healthy cruise ship passengers have to stay somewhere being observed if they develop symptoms. That's a quarantine. If the virus would hit Santa Barbara area, we would be beyond capability of doing that. We would enter a different stage of public health care, which is called mitigation. So the most important part is really isolating sick people, and most of them can safely isolate at home. If they are really ill that they require hospitalization, they will be isolated at a hospital. So we are not looking into venues that, other than the federal government, they need venues where they, quarantine repatriated people, for instance, and they usually use air bases or military bases for that. But I don't anticipate that to be necessary for us in the city of Santa Barbara.
And Madam Mayor and
Casey.
Councilwoman Alejandra Gutierrez, and I also am not hearing any prohibition against inter-county travel, and so I'm not hearing that initially. I also want to say that during the debris flow, we had a full closure of transportation, and we were able to maintain services and actually identified city employees as essential, critical employees working with the county through the Office of Emergency Services, and got the employees that we needed to in. So that's firefighters, police officers, and like I mentioned, wastewater treatment operators and water treatment operators. So I'm confident that working with the county, getting the essential employees like Cottage employees and county personnel as well, that will happen.
And so that's it for my questions, and thank you so much.
Mr. Oscar Gutierrez and then Mr. Jordan. Thanks for waiting.
Thank you, Madam Mayor. So you stated that the governor declared a state of emergency, but that does not mean it's a state of emergency for our city, is that correct? What would constitute a state of emergency for our city?
Well, we thought about that at length, and we came to the conclusion that we would elevate our level to a state of emergency once we hit certain targets. And we came up with 3 scenarios. One would be that we have our first actual case of confirmed COVID-19 in the county anywhere. That would be reason enough for us to declare local health emergency. The other options would be that our neighboring counties have widespread community transmission. And because there's so much travel between the counties, commuting and so forth, that would be reason enough for us to declare this. And if we had multiple cases that are being tested and we anticipate that those test results will likely come back as positive, we would also declare a local health emergency. So we implemented these 3 triggers. And if any of those were to become reality, we would start we don't need to start the process. All it takes is really 5 minutes. We have everything prepared. And it would be just a formality from our perspective because we are prepared to do it, in a matter of minutes.
Okay, so in all likelihood, there's a possibility that there's already somebody in our county that has it and they're just not aware. Is that correct?
Well, that is very likely. However, if that's the case, that individual most likely is not very severely ill and hasn't, sought medical care or, is improving fairly quickly. So, yes, we would most likely get our first severe case to the hospital setting.
Can you comment on whether or not you feel that our medical infrastructure is able to support an outbreak?
I feel quite confident because, we have such an excellent cooperation with our healthcare partners. Inpatient and outpatient cottage is, exemplary in its outreach, and large clinic systems like Sansom Clinic, for instance, who I believe take care of 75% of our population here, and also other clinics, like the neighborhood clinics or the county healthcare centers. We have 3 of them in Santa Barbara. No, one is Carpenter Villa, technically. But I think we are well equipped with excellent infrastructure. We have excellent cooperation with our emergency prepared teams, with our emergency doctors, with fire, county and city. And as a community, we have gone through so many different disasters already that it's a pretty closely knit community, and we've been preparing, and I think we will be very well equipped if this became necessary.
Can you comment on how many personal protective equipment kits the medical currently has, and how long that would last as our situation is now, and how long it will last in case of an outbreak?
Well, I don't think I'm authorized to give you the exact number, but it's very large. We are also fortunate to have Direct Relief International here in our backyard, who are always extremely helpful to their hometown. And the CDC and the governor gave very clear guidelines on under what circumstances certain brands of officially outdated N95 masks would be safe to use, and we have a large cache of those available, readily available. I think we are in good shape in the city of Santa Barbara with regard to the protective gear. Maybe one exception is a certain size hand gloves that is the most common size, but I think our partners are working tirelessly to get that covered as well, and maybe some surgical masks which are in high demand. So I think compared to other areas in the country, we are pretty well equipped.
If we were to discuss an emergency ordinance banning social gatherings, how would that be implemented and enforced?
That's a Mr. Kalan question?
Yes.
Okay.
Yeah, Madam Mayor, Councilmember Oscar Gutierrez, the predicate for that kind of ordinance would be a local emergency declaration, and you would think through the kinds of restrictions for public facilities like libraries, meaning publicly owned facilities, libraries, council meetings, planning commission, and so forth. Then you would also want to think through the kinds of restrictions you'd apply to private gathering places like movie theaters or Libero, Arlington, that kind of thing. But the predicate of having an emergency declaration is important because it justifies the use of the extraordinary power to essentially keep people out of public places during normal hours.
And if we were to enforce an emergency ordinance to ban social gatherings, is there someone that can comment on what the financial cost to the city that would be, or the legal cost of any kind of legal action as a result of that?
Madam Mayor, Councilmember Oscar Gutierrez, I can't speak to the cost of enforcement. I would imagine that we would find theaters cooperative in that circumstance, because I also imagine there would be significant public concern about the health effects of gathering in public to back up your action on the emergency.
Mr. Casey, would you pencil that out and let us know? Maybe that's not something right off the top of
Madam Mayor and Councilman Oscar Gutierrez, it'd be really hard to pre-predict what the financial impacts would be to city revenues from canceling such gatherings, because it's really the ripple effects on the local economy that you'd need to try to estimate, and really have no benchmark or prior experience with that to build off of.
There any estimates on how fast this virus may mutate to become more aggressive or even more easily contagious?
Thank you for that question, Councilmember Gutierrez. This virus mutates rapidly. It's in the family of viruses known as RNA viruses, and they are the most highly mutable viruses that we see. That doesn't mean it's going to become more aggressive. It could mutate to become less aggressive. And that is something we see in these scenarios. Sometimes as epidemics go on, actually mortality rates drop off over time as the virus becomes less lethal. So we know it's changing. We know it changes quickly. There is some suggestion from some reports that there might already be more than one strain of this virus out there. However, we don't know which direction it will go in its change as it changes. We just know it will change.
Is it currently the number of people catching the virus, is it currently rising, or is it starting to plateau or fall as of now?
Well, globally, the numbers are increasing rapidly. In some of the areas that were hit early on, there are some early reports suggesting maybe it's starting to plateau in those regions, such as Wuhan, China, and in South Korea. But I think we cannot assume yet that that's the case and let our guard down, that this is going to, stop spreading in a period of weeks. But we're, I would say, cautiously hopeful that there might be some early favorable signs from China and South Korea.
There's no treatment or cure for it as of now?
There are some experimental treatments that have been tried and are in clinical trials here in the United States already and in other countries, but nothing has been proven to work at this point.
So when it comes to, DIY solutions, would things like lemon and lime juice or vinegar, would that be an alternative that could possibly kill germs and viruses?
You mean as a cleaning agent?
Correct.
Sort of thing?
Certainly there's acetic acid in these, and they may offer some protection against some organisms, but we really don't have good data to address its impact on this virus.
And when it comes to the harbor, airport, Amtrak, Caltrans, MTD, what are the protocols or procedures if there's definitively someone in those outlets who is showing signs? Like, do you just stop all action and get that person treated or evacuated from the area? Do you stop everyone who's around them and get them quarantined? How does that work?
Paige, do you want to speak?
Well, assuming that we're notified of the individual on the train, plane, et cetera, we would work with the particular entities to begin doing some what we call contact tracing. But again, that would depend on some level of confirmation that the individual is in fact ill because of COVID-19 as opposed to influenza or something else. So a lot would depend on notification. So we know that with flights, we are notified through the California Department of Public Health if somebody has measles, TB, or anything else. There is a natural notification to the Public Health Department. I have to tell you, we haven't had any experience with Amtrak or trains. So I wouldn't know, but certainly if we were notified, that contact tracing would occur.
Mr. Casey, I know that New York Subway is having their crews wipe down the subways every night. Are we doing anything like that for MTD?
Madam Mayor and Councilman Oscar Gutierrez. So MTD is its own separate authority. I assume they're doing additional deep cleaning, as most entities are. We are doing deeper cleaning of our city offices and buildings, of doorknobs and surfaces of common contact. I have not heard directly from MTD about what they're doing, though.
Thank you. Those are all my questions.
We'll go to Mr. Jordan and then public comment. And I see some of you folks out there for the appeal. Please know that there's an item after this ahead of the appeal. But maybe you're learning a lot through this presentation, so you're okay sitting out there. So, Mr. Jordan, okay, go ahead.
Thank you, Madam Mayor. Can't possibly be another question left, can there? If some of you were as old as me, of course, you would have a rule against how many white jackets you're going to be in front of in a given year. So I'm already about 5 years screwed up right now. So I don't know what we'll do. I have just a couple questions that I haven't heard, and I also, as Mr. Werf knows, that every chance I get this over the past 10 years as a planning commissioner, I have never failed to remind people that of communities in this state, few, if any, and I lean towards if any, have the luxury of the medical resources that we have available to a community this size. And that's spoken with no disrespect to the county. I would just admit my ignorance there, but a great deal of familiarity with cottage and Sansom systems. And I am just encouraged to hear much of what I've heard, and I know that the background or the foundation of that is based in what a blessing we have to have these two medical organizations in our city. I may have missed, so I'll just apologize if I ask a question, but did anybody mention how many lab test kits we actually have available?
It's a rapidly changing number. So LabCorp and Quest were coming up with about combined about 4,000 tests a day. Now, be advised, that is a national number, so it's a pretty small number, but that is on their first day of business. So we are hoping that they're ramping up significantly. The state of California has the most tests available through the public health labs. We have currently 15 labs running the test already, and 4 more labs will be joining as of this week sometime. And so we have a two-pronged approach so far. We have the commercially available labs for, providers in the community, in the hospital, and if we need a test result fairly quickly in order to prevent an outbreak, for instance, in a nursing home or in a facility like that, then we have a much faster turnaround of the test results with our public health lab system.
Then
the exact number, I'm honestly not sure.
One of those tests, I'm only as smart as Google tells me. One of those tests requires a different time period or 2 tests, whereas the other test is quicker and 1 test?
Yes, that is true. The test that is used by the public health labs has to be validated if it turns out to be positive by a CDC lab, so that it is definitely a disadvantage. The other test is automatically valid when it comes back as positive in the commercial lab. So the turnaround for the test result is longer with the commercial labs. However, it doesn't require a confirmation. Okay. Whereas with regard to public health, I would not wait for a confirmation test if 5 nursing home inhabitants, residents would have a positive test result. I would trust that, obviously, because that would be an indication to act quickly. So we are trying to reserve the quick turnaround tests for public health scenarios for the most part.
And then you mentioned as one of your triggers the number of tests being done. So you're actively tracking countywide how many tests are being done daily?
Yes, because at least the tests that are run through the public health lab system, they have to be actually approved by myself. So I know exactly how many tests were done on any given day. The lab tests that are run through LabCorp and Quest, they will report the result to the public health lab because it's a reportable disease. But those test results have a 45-day turnaround. So we will be notified regardless. It's just a slightly different time frame.
Very good. And then you talked about those triggers, and what I heard was you have potentially 3 different triggers. Correct. To go to a what you would call a local health emergency, right?
Yes.
And I heard a different question, or I heard a question from Councilmember Sneddon that you only answered part of it. And what I've heard a great deal of frustration with, or lack of knowledge, is the relationship between you, California Department of Public Health, and CDC, and what you can unilaterally do regardless of what they are saying. So could you talk a little bit about that? You are able actually on your own, without DPH or without CDC, to state that there is a local medical emergency.
That is correct, sir.
Okay. And any one of those 3 triggers, as you have this right now in your mind, would enable that to happen, correct?
Correct.
And so that's been part of the frustration of the picture, I think, is who gets to do what, and do we have to rely on CDC in Washington arguing over what to tell people, what to not tell people. And so I think that's reassuring. And then, of course, the other overwhelming input from residents has been regarding cruise ships. So if you were to have one of those 3 triggers occur and you declared a local medical emergency, what would be your opinion of cruise ships continuing to disembark in Santa Barbara, given that would be, the way I heard it, that would be your trigger to move towards a non-group gathering scenario, and how would that relate to cruise ships, in your opinion?
That's a very complex question. because of the authorities that are involved in the cruise ship regulations. From the health department's perspective, it is up to the CDC because they are usually running under foreign flags, so they are national waters, and so they are under the federal government's authority, plus the captain of the port for our area is in Los Angeles and Long Beach, who has the authority to for quarantining, so there are very, very robust protocols in place.
On cruise ships? Or
yes,
on
the
land?
reporting to the CDC from.
Okay.
So if there are ill people, sick people on the cruise ship, they are it's mandatory for them to report it to the CDC,
Okay.
and they would obviously involve me as a local health officer, and inform me. However, you could probably conjure up a scenario where everything falls through the cracks with the CDC and with the Coast Guard.
So I've already done it for you. It's a 7-day cruise. You get infected somewhere on and off. You have a 14-day incubation once you show the symptoms, but you haven't shown the symptoms yet, and you disembark, and you're potentially infecting, right? I've done that math too on where all those little gaps in protection could be, right? That's what you're referring to?
No, not really. I was thinking more along the lines that the CDC gives the okay, and I disagree with the CDC's decision. That would be a scenario that is possibly possible. However, as you've heard, we are actually off the hook because the next cruise ship has already self-canceled.
Right.
The federal government, I'm in contact with the state government because we have several port cities in the state, obviously. I do know of Monterey that they have requested for cruise ships to not disembark until further notice. And my understanding is the city of Santa Barbara is following suit, and so is the county of Santa Barbara.
Okay.
So you put me a little bit on the spot, and I've been in contact with county council, and county council has been in contact with city council on these issues. They're pretty complex legal issues, but if push came to shove, I would have the authority to block a ship from disembarking.
Very good. So let me take you off the spot. Mr. Colon, so I'm pretty sure you see the chatter. So 10 cruise ships through June, but almost half of them, 4 of them, are in a 5-day period early in April, the 6th, 7th, 8th, and 11th, which conveniently comes after we've been out of session for 2 weeks also. And so what you told us earlier was that that we are essentially not in a good position with a cruise ship tossing anchor down. They are certainly allowed to do that. But, well, then I'll need some help on this memo, that it's a little gray after that in terms of using getting permission or not to use city facilities to come on shore. And that if there was a local public health emergency, and I'm paraphrasing, we would still have to go ask permission from the Coast Guard captain or the port to stop or continue that.
Madam Mayor, Councilmember Jordan, no, that I did not mean to say a couple of those things.
Okay.
The first is that I did say, and I believe it's correct, that the district commander or the captain of the Coast Guard Port of Los Angeles Long Beach has authority to either prevent ships entering navigable waters or prevent them mooring or anchoring. Where I've advised that the city has authority is in its letter of understanding, which is essentially a license agreement. And to tell you what a license is like a ticket to the ball game. If it rains, you don't get to go. It's not a lease, it's not ownership, it's not a property right in that sense. So we have these letters of understanding that essentially establish a rate schedule for the cruise lines. What I'm advising is that if there is a health emergency, the city would be well within its authority to not allow the use of city property for disembarking or coming ashore, whatever you want to call it, passengers leaving the ships. The second piece of what I said is that whatever order we issue about disembarking passengers has to be consistent with orders from the captain of the port or district commander. It doesn't mean that they have to mirror them or that they are dependent on the orders, but our orders need to be consistent with what the Coast Guard does.
Okay.
Is that better?
That's better than the sentence I'm reading. Yes. So, and I appreciate that because I think that's been overwhelmingly the amount of emails of concern I've gotten. So
back to your hypothetical.
Yep.
While the council is gone, your city administrator is empowered to make a proclamation of an emergency should the county not do that. With the level of coordination that I see happening so far between the city, the county, the medical providers, and the Coast Guard, I have little doubt that we will know well in advance of the council's vacation whether we're canceling disembarkation of passengers.
And Madam Mayor and Councilmember Jordan, and that's why we sent a letter yesterday, even while this legal issue and kind of trigger points are being evaluated. We just wanted to be on the record quick and early that these upcoming ships we don't think are appropriate to be coming right now.
Yep.
And so we sent the letter off immediately to do that while we work through these other trigger points as we get closer to that date.
very good. I think that's all I have. Thank you, Madam Mayor.
Thanks. Ms. Gutierrez, did you have one more thing? I see your light on again.
Yes, just
Okay.
2 quick questions. And this is for the public to understand. So a lot of people out there are very upset that why did it take so long for the city or the county to give us some, answers to our questions. Can you guys explain to the public, why there's time taken in order to give information
Information on what?
on
on
the
cruise
virus,
ship?
on the virus, and how the city and the county are taking steps to control it and monitor it?
I think we have, from the county public health perspective, we have had very frequent communication via press releases. We had multiple, myself included, multiple interviews with the local press. We have a public information officer who is full-time with a team on it, with social media messaging, with a website that is updated regularly. This is a very rapidly evolving situation, and whatever we are telling you today may be slightly or a lot different tomorrow evening this time. So it is very challenging to stay up to date. I've been on in phone conversation with CDC, CDPH, Southern California Health officers, local partners like Cottage and Sansom and so forth, on a daily basis for several hours every day. So just as things go, it's a challenging situation. So I hope the public understands. We have to learn this as we go. This is we cannot really rely on old information, and it changes so fast. That is pretty breathtaking. I hope that with our new platform, which is much more user-friendly, it's all bilingual, and gives all the links to the CDC information, which is, by the way, really remarkably well done. It is a very difficult situation to spend that much time on learning about this and at the same time communicating the changes. So I understand that there may have been some shortcomings, and I hope that our new impetus on this new website, on our extended phone services and so forth, will satisfy those needs better.
Thank you. That's it.
Okay, very good. We'll go to public comment. Michael, you're first. Kathy Janega Dykes, Phil Walker, Jeff Bard, Milt Hess, Stephanie Armstrong, Carrie Kelly. So go ahead.
My turn on?
Yeah,
Okay.
thanks, Michael.
One thing I've noticed in my time here off and on is that there is no public bathrooms open at night. I mean, there's the one, I think, next to the county building in the public garage. And besides that, there is no public bathrooms open. And we have the concern of not only this virus, but we also have Hep A and multiple other things. This is a high transient area. Without a bathroom, that's causing quite an issue. And I've also seen multiple times the AMR, your contracted medical service, completely avoid people that definitely needed a health and wellness check. Now, if they don't feel comfortable with addressing the person, they could call the police for a health and wellness check. And so what I have a recommendation is that maybe you guys could consider opening that Stern Wharf's bathroom. Now, you've already got AMR parked right down there in that parking lot. Yes, they already sit at the parking lot right next to the skater park. So there would be someone present there, because they could just park in the roundabout, and then maybe we could have a bathroom open. It would be watched, and it would be considered.
Ms. Janega Dykes.
Good afternoon, Madam Mayor, members of the council. My name is Kathy Janega Dykes. I'm president and CEO of Visit Santa Barbara, and many thanks to the representatives of our medical industry for providing such valuable information, because the health of our neighbors and our visitors is of paramount concern to us. Today, I'm speaking on behalf of one of our region's largest employers and taxpayers, the travel and hospitality industry. And I'd like to give you just a brief briefing on the primary markets and actions that we're taking to lessen the impact of the economy to our community. And I say this because, as we heard earlier, the situation is changing rapidly. So this is basically our plan as of today. As we all know, Santa Barbara is held in such high regard from visitors across the world. However, it's really important to understand that 82% of our region's hotel stays are actually sold to U.S. residents. 18% come from international, 82% from the domestic, and 58% are Californian. Through February, visitation through the Santa Barbara South Coast has been in a relatively favorable position compared to the U.S. overall, and partially because Santa Barbara is a boutique community, not this international gateway. But as we move further into this pandemic and the underlying risk to the U.S. economy, we're increasingly concerned about the 13,000 jobs created by welcoming visitors to the South Coast. Visit Santa Barbara, as you all know, is fully staffed with seasoned experts to face this period of uncertainty. With the renewal of our Tourism Business Improvement District recently, we have now new funds to be able to divert during this critical time. Last week, I reviewed our budget and reallocated funds to marketing programs with the highest likelihood of adding short-term visitation. Our updated media plan heavily prioritizes the drive market. We talked a lot about that earlier over the direct fly markets. And in current climate, we feel strongly that the regional travelers will be the most likely to prioritize Santa Barbara trips over other destinations. Concurrently, Visit Santa Barbara's popular Third Night Free initiative, which was held over the shoulder season, now has been extended through June 30th, again, trying to encourage people to travel in this area. And please keep in mind that every decision that we're making is fact-based. It's based on data, not emotionally based. In the coming weeks, we'll continue to give you updates. We are providing weekly updates to our hospitality industry on the status of COVID and ways and tools that they can use as well too. And as Visit Santa Barbara focuses on motivating travel to our region during this obviously very unpredictable time, we know that the work of our public health professionals is even more taxing and yet critical to our success. You have our greatest respect and complete confidence, and thank you all for your ongoing support.
Thanks, Ms. Janega Dykes. Phil Walker, still here? Come on up.
Good afternoon, once again, Madam Mayor. Excuse me, members of the City Council. Let's see, it was November 7th, 1966. I was dropped off an OD bus from SeaTac to Fort Lewis, Washington, apparently right into a raging spinal, AKA bacterial meningitis epidemic. Never told anything. Apparently seven troops, recruits, passed away right in my barracks unit, and there were a lot more in the totality of Fort Lewis and also Fort Ord, California. So the amount of disclosure today is just truly amazing, but I think the U.S. government needs to look further and further, and all the medical staff, into what the whole situation is in the Wuhan city and that province in China. Because there's been so much talk about the use of night soil, fecal application, transmissivity of the virus jumping from species to species. And we are so fortunate to here in the city of Santa Barbara County. The city has a state-of-the-art wastewater treatment facility. The water system is protected, segregated, and considering what I went through, and there was never any disclosure at all, and you were just run into the ground, even in basic training, let alone what happened throughout the world at that time in Vietnam. The amount of what you would say are cautions that have been put out already about getting proper sleep, proper hygiene, none of that was done. We were lucky to get 3 or 4 hours sleep a night, then back in the field in constant rainfall up in the Seattle area. So all I can say is I feel blessed to be blessed with a very strong immune system too. And I'd like to thank the staff quickly from Cottage, because I'm a subcortical brain injury survivor, and Dr. Charles Lowenthal, was my primary responder. My wife told me I nearly died, and
Can you address us, please?
yeah, after 2 years, she didn't tell me that, but I'm still here talking to you, so thank you very much.
Very good. Mr. Bard, next.
Hi, in honoring in the spirit of Dr. Li Wenliang, a true hero of this era. You may recall me from the South Coast Homeless Advisory Committee. Grant House nominated me, and I served the county. And I obtained a reputation for being a very harsh critic of the shelters and the warming center and certain other agencies for their lack of infection control. I fought the chief medical officer really quite vigorously over. I wanted isolation of coughing patients. I wanted head to toe. I wanted ventilation. I wrote up a five-point pandemic plan addendum in the event of a pandemic in 2013. I submitted a 10-point plan for Freedom Warming Center. All of that just got me, we almost ended up in civil court. Okay, but let's start with a clean slate. I criticize policies. I don't attack individuals personally. Okay, please consider suspending the vacation if this gets bad. Please consider going to 3-minute public comment. Immediately suspend ticketing and harassment of people who camp outdoors. Okay, look, protocol schmotocol. They don't follow the TB protocol. I have identified in my research at least 3 cover-ups by shelter systems in New York State, Jacksonville, Florida, and Ground Zero, Los Angeles Rescue Mission, had a TB outbreak of a novel strain. CDC dispatched a team. That's the last we ever heard of it. And I went to the county and I warned, and it was coming, and it came. So now, thank you, council. Excellent questions. Harmon, And over here, Jordan, I'm new to this council. Excellent questions. I'm very impressed. And most of the issues that I had were addressed, except a couple. The pseudoscience that I've railed against for years is feeding the wet markets in China that are run by organized crime, which is where you get exotic species from all over the world, and you get viral mutagenesis and the virus genome trades, and this is the cause of the problem. It's going to come again. Now, finally, our big hope is young people. At first, I was depressed to hear that young people aren't affected because I thought they're just going to go party and pass the same, share the same pipe, and it does us old people off. Then I realized, no, there's a window of opportunity because with viral mutation, it could mutate and start going after young people. So we have a limited time. If we can get these kids into virology and immunology, these fields are exciting fields. And we have people in this town who can motivate youth. And if we can get youth working on it, they can go in and do clinical care, and they don't have to worry because if they get sick, they just get a mild illness. So here's our window of opportunity if we can mobilize youth and get university people, get these kids working on this before it mutates and goes after them. And it will mutate. Thank you.
Okay. Mr. Hess, are you still here? Ms. Armstrong, after you, Carrie Kelly will be the final speaker. Welcome.
Mayor Murillo, members of City Council, good afternoon. My name is Milt Hess, and I'm here to offer my perspective on the COVID-19 epidemic. The attention that it's receiving nationally in the press and just being front of mind with everyone is remarkable. I don't think I've seen anything like this. Well, I don't remember anything like this in my life. But the psychologists have a name for this phenomenon. It's called the availability bias. And it's a cycle that feeds on itself, generating concern in the public, generating press, generating more concern. And it's not necessarily proportionate to the nature of the risk. Now, I don't want to get sick with coronavirus, with COVID-19. I'm well into the elderly category of people most at risk with the disease. But when I compare the response to this epidemic with other preventable public health problems, I have to urge you to keep things in perspective. For example, in 2017, guns killed nearly 40,000 people in the United States. In 2018, there were over 36,500 traffic fatalities in the United States. And during the 2018-19 flu season, over 34,000 people died in the US. Now, we reluctantly accept these preventable deaths because we don't accept what it would take to prevent them. Tighter controls over guns, more stringent controls over impaired driving, enforced flu vaccinations, and quarantine of the sick. So I pose the question, how much are we willing to disrupt our normal lives to address the threat of the coronavirus? And that's an open question. By all means, we should take reasonable precautions to avoid getting sick and making others sick. But a massive disruption to our normal lives because of this new disease does not appear to me to be a proportionate response compared to the other hazards that I just described. So thank you.
Okay, thank you. Ms. Armstrong?
Good afternoon, Madam Mayor and City Council members. I'm Stephanie Armstrong, the Interim Executive Director of our Chamber of Commerce here in the Santa Barbara region. On behalf of more than 600 members, I want to express our appreciation for the updates and information shared by our public health officials this afternoon. The health and safety of our employees, employers, and the larger community is our top priority. Toward that end, we are committed to making preparations for operational continuity plans, ensuring that remote work is an option for employees to the greatest extent possible, and reminding all members of our organization and community of best practices with regard to public health and safety.
We believe there is much that the city can do to support the community in preparing for the coronavirus, and we have heard about some of that work this afternoon. We ask that the city leadership continue to follow the advice of public health officials and refrain from taking sweeping actions that would limit our region's social and economic activity unless advised to do so by those officials. We understand that there is a great deal of concern and a considerable amount of misinformation circulating, but we do have access to expert advice, and we hope our community will rely on that. It's too early to shut down smaller community-based gatherings of chambers of commerce, SCORE chapters, economic development groups, and others where attendees are coming from within the Tri-Counties where there is no community spread. We encourage the continuity of business operations with the necessary precautions that are already in place to address public safety. As time goes on, further actions may be required, but to put a restriction on business activity that's crucial to the regional economy does not seem necessary at this time. We urge you to let public health take the lead on these issues. On addressing these issues. Our businesses are extremely resilient, but they get that resilience in part because of public agencies taking necessary but proportionate actions when it comes to moments of crisis. Thank you for your time.
All right, very good. Ms. Kelly with Downtown Santa Barbara, final speaker.
Madam Mayor and City Council members, thank you for having me today and allowing me to speak. I want to echo what Stephanie said, or Stephanie from the Chamber. I'd say this is an unprecedented time with this virus. I haven't been in Santa Barbara that long, but I have learned that Santa Barbara is a very resilient community, and I'm very happy about that. It is vital for our economy that we have a response to this illness that is based on data and a strategy that is nimble enough to be changed if necessary. You know, it's wonderful that the City Council meets so frequently. Usually where I'm from, it's usually once a month. So this is very helpful, and you can stay up to date on these issues. I would urge caution in taking any longer-term action, but focus on short-term actions and approaches. Downtown Santa Barbara will be working with our partners like the Chamber and Visit Santa Barbara on a response and assisting all of our members. We just had a downtown conference scheduled for Wednesday through Friday this week that was canceled, but we're in close communication with other downtown organizations as well in California, and we'll share any pertinent information as that becomes available. Thank you for your time.
Very good. That closes public comment. Mr. Friedman, did you have closing remarks, or go ahead?
I'd just like to give some remarks just to kind of summarize what I'm hearing today, and hopefully kind of a few things moving forward, especially in particular to cruise ships. So first, I'd like to thank all our public health officials that came today and our first responders. I think we all learned a lot, the public learned a lot, and thank you for answering our questions and having a really good discussion here today, and my colleagues for asking really great questions. A lot of those came from the public as well. And as I also want to thank the public who's contacted us with a lot of their concerns. And as we can see, there's a lot of thought and preparation that is going into the planning and response efforts here. And due to the fast changing nature of this, sometimes it is hard to communicate that, or difficult to communicate that to the public because it's so rapidly changing. But we are doing our best, being government and our public health partners, to provide the adequate information. When we think about it, the primary goal, or one of the primary functions of government is the protection of public health and safety. And we see today that this circumstance we're in is essential that we do that, and that we have coordinated efforts, because something like this has no regional boundaries. And in terms of just moving forward, I especially appreciate our last few commenters from the Chamber, Downtown Organization, and others in terms of we need to act on information from the scientists, the public health experts, and agencies that are the forefront of these decisions. And as we've heard today, some of them include the Center for Disease Control, Department of Public Health and Human Services, California Department of Public Health, our own local public health, the U.S. Coast Guard, the governor, and state legislatures. We're all working on this and trying to coordinate these decisions, because what we don't want to do is act independently of each other, which could lead to unintended consequences and actually be more disruptive and make it more difficult for the public to understand what's going on. In particular, it's not just cruise ships that are these discussions, but also the airport. This issue came up today, Amtrak. Should things get more cases 101, and how people are coming in and out. So those are all decisions that we need to be based on science and data. Individually, I've spoken over the weekend with former Supervisor Manala Congressman Salud Carbajal. I spoke with his Chief of Staff, Jeremy Tittle. I also spoke with our Assembly Member, Monique Limon, just to express what we're hearing here at the council to them. And Congressman Carvajal's office is committed to working on our behalf if we need to in terms of the Coast Guard and helping any that we need. So I'd like to ask if one of the suggestions is for our staff, Mr. Casey and Mr. Colon, to work with the county public health and county council and the Coast Guard just to come up with a plan so we're all coordinated. I think I'm hearing that, but I want to put that out there on the record so that we do have we have that communication with them in terms of the cruise ships going forward, at least through these ones going in through June, to have those discussions. And at the federal level, Jeremy told me that the federal government has passed over $8 billion towards this. They're looking at more potential measures to look at a national level of how we can respond to this at a national level. And Assemblymember Limon also expressed that the governor and state legislature are working to provide the resources that our public health needs in this state. So there's from all levels, it's going forward, and we're looking at all things that we need to do. And then finally, in terms of just a measured response and basing our decisions on the public health aspects of it, we also need to consider if we were to act prematurely or independently of, say, Goleta or Carpinteria, there are effects that could come into our vulnerable populations, and especially those who are seniors or those who are lower income that don't necessarily have the ability to lose paychecks. I think our last few speakers mentioned that, because it also gets into the rent, it gets into just your utilities, and to make sure that we're basing this so that there is the least impacts to our most vulnerable residents in terms of their economic well-being. So with that, I just encourage us to continue those discussions with the Coast Guard on the cruise ships, and I really appreciate the coordinated effort that we have here and the expertise. Someone mentioned it, that in our community we have, I think Mr. Jordan might have mentioned it, but we're so fortunate to have the level of expertise in the medical community here for our size, and look forward to continuing to receive updates on this and the coordinated efforts, and appreciate all that everyone's doing on behalf of the residents of our city.
Thanks. Ms. Harmon.
Thank you, Madam Mayor. I will keep my comments very brief. I imagine our public health experts would like to get back to their good work. So first, I just want to take a second to acknowledge the many people who have emailed us and called, and those that are here today and watching at home. We live in an era of misinformation, and the commitment that I've seen from all of you to getting real, true, accurate information, it's very much to be applauded, and I really appreciate that. And additionally, in so many of the messages and calls that I've received, that I know we've all received, a lot of you began your comments and questions not talking about concern for yourself, but for others, and how elderly folks and people with compromised immune systems might be impacted. And to me, that's just so representative of the Santa Barbara ethos, and it really reminded me of how proud I am to live here and to be your neighbors. Of course, a huge thank you to our county public health officials and those that are working in conjunction with them for coming today. You guys are really at the heart of dealing with this, and we're so grateful for your expertise and your leadership. It's clear that there are some unknowns right now, but what we do know is this: here in the county of Santa Barbara, and through county public health in particular, we have all the tools in place we need to deal with whatever might come. Here in the city in particular, I really want to highlight to folks that we have an organized and extensive contingency plan in place to ensure that our community continues to enjoy the level of service that they deserve and that they've come to expect. I think that's a really important point that us here at City Council can drive home. On cruise ships, clearly we've laid out that we have a plan for that too. That plan's been working thus far with the cancellation of the ship on the 24th. That's a real success, and I I have every belief that we will continue to enjoy that level of success. And in the event that that changes, I know we are all committed to doing everything within our power to ensure that our community stays safe. And we'll continue to monitor that and to take steps as necessary. So I'll just close again by thanking all of you for your good work and for this really amazing presentation. I have learned a ton. In my house, we're washing our hands a lot. We are taking precautions to disinfect, which is pretty hard to do with a toddler, but we're doing it. I hope all of you are doing the same, and I think by doing that, working together, we can keep our city safe and keep everyone healthy.
Thank you. Mr. Oscar Gutierrez.
Thank you, Madam Mayor. I'd like to thank everyone who came to speak and educate us on the situation. I don't feel comfortable with at the level of precaution that we're taking, and I know a lot of the residents don't either. I strongly believe that if there was an outbreak here, it possibly could have been prevented by us taking a little more of aggressive steps. I don't feel comfortable with the cruise ships coming, at least until the numbers start to drop. Like they said it themselves, that they're not dropping, they're just going up. I know that we're a tourist-based economy. We have 4 avenues of people coming in and out of this town because we're a first full-service city, and that makes me worried. So I would like us to discuss, banning the cruise ships until the numbers start to drop, and even restricting the amount of social gatherings that we have. I kind of want to throw that out there without officially making a motion, just to gauge people's opinions and thoughts on the matter. Thanks.
Well, people are asking, what are we going to do if the cruise ship insists on coming? But I think what we've heard is that the Port Authority and the Coast Guard Authority is saying, don't let people get off of the ships, right? And so I think, Mr. Gutierrez, if it comes to that, we'll take action. I don't think we need to ban cruise ships right now. They're at bay, and we can certainly take it up. And then what I've heard about social gatherings is that if the county public health declares a local emergency, that would be the first step to taking action related to limiting assemblies. Am I getting that right, Mr. Casey?
Yeah, Madam Mayor and Councilman Oscar Gutierrez, let me state where staff's perspective is on the cruise ships first. I think we're in agreement that right now is not the time to have cruise ships coming to Santa Barbara through June. And that's what the letter to the cruise ship industry yesterday was saying. And that's where the coordinated effort and dialogue that's occurring amongst all the different agencies. My waterfront staff is talking to county public health almost on a daily basis about it. And county supervisors Hart and Williams sent a letter concurring our request to the cruise ship industry. So there's coordination occurring there as well. I'm speaking frequently with my counterpart and the CEO of the county, Ms. Miyasota, and city attorney is coordinating with the county council at the county as well. So I think there is agreement. As has been expressed a number of times, it's really complicated and we got to be strategic about how we kind of go about doing that. But I think the goal is we don't want cruise ships coming between now and June. And so we're going to continue to execute on that. And unless I hear otherwise, that's the way staff's going to act going forward.
And then closing public spaces. We're ready to do that if there's an actual epidemic in our city and county, I think. So, Mr. Kahlon?
Madam Mayor, as I said when I responded to Councilmember Oscar Gutierrez, it would be necessary to have an emergency declaration of some form if we are going to take urgent action to shut down public gatherings.
Are you satisfied, or Mr. Gutierrez?
Thank you, Madam Mayor. It's just that the governor already issued a state of emergency, and the physicians had stated that pretty much as soon as one confirmed case is in the county, that they most likely will declare a state of emergency. I just think that why would we wait for that to happen when we can take steps now to try to prevent it? That seems to be some of the sentiment that our residents are asking us to take measures to do to keep them safe. There's a lot of our community who are vulnerable, and some of them can't be here physically to speak because they're scared. And I feel like we should just uphold our oath to keeping the people as safe as possible.
Ms. Sneddon, Ms. Gutierrez, your light's on, but I think you just had it on from last time. So Ms. Sneddon, go ahead.
Thank you, Madam Mayor. I just so appreciate you taking time out of actually combating this epidemic to spend time here with us. Just to reiterate, I think that we need to stay vigilant, stay prepared, be on alert. I really appreciate the staying nimble approach, that this is quickly evolving, and I personally feel at the ready to take your information and advice on how to act quickly. Councilman Oscar Gutierrez, I am prepared for that type of action if there's a trigger, and once that happens, I'm a little bit concerned about acting too prematurely, although I want to be at the ready to act quickly should these triggers occur, which it sounds like it's not a matter of if, but when. And I think I'm hearing that we'll be prepared when that time comes. Really emphasizing staying in communication. Very appreciative of this communication and the website that you'll be launching, and having one central place where we can get our information is really going to help with the spread of misinformation. I feel like at a national level where we have mixed information at different times, I'm going to rely on our local health officials to really be looking at Santa Barbara and how this is affecting us here. And I'm going to make the very big assumption and fair assumption that your care for this community being safe is as great or greater than ours. We are all in this together, but I do want to be ready to act quickly should that come. On the cruise ships, I think it's a little bit different situation because of the potential for going to port to port to port and spreading quickly. That I would be in favor of being much more proactive about, and let's just not have that here to as much as we legally can. I just want to voice that I just don't think this is the time for cruise ships, as we're all in agreement. But just want to state that, and I'm going to count on our local health experts to let us know when we have options to be more proactive, that this is a request for me, and I think several of us, that if there are things that we could be doing more proactively, if there's more we could be doing to head it off ahead of time, an invitation to please let us know. That I believe we want to be proactive, or at least know that the options that are available to us. And this has been so incredibly helpful answering our questions, and thank you for taking the time.
Mr. Friedman, and then Mr. Jordan. Thank you, folks.
I just want to clarify for the public, in light of Councilmember Oscar Gutierrez's comments regarding cruise ships, Mr. Casey said it, but I want to clarify it from my own perspective, is that we are moving forward with basically a moratorium on them. The direction is to provide that at this point through the CDC travel restrictions on cruise ships, the advisory they have is working. And so the direction that I'm supportive of is for our city attorney and whatever city staff we need to work with the county public health, the county council, and the Coast Guard to work through these legal issues. At the same time, we're asking voluntarily for them to comply, because that's the quickest route, actually, or one of the potentially the quickest route to get them to not come to port. And then there's this backup option about them disembarking that we're also exploring. So I just want to make that clear that from what I'm hearing, it's unanimous support up here from the council and our city staff is no cruise ships through the scheduled ones in June, Then there is a summer break, and then we'll address those as conditions change and we get more information. So I just want to be clear on that on the cruise ships and the direction that I'm hearing from all of us up here.
Thanks. Mr. Jordan?
For weighing in, I would echo the comments on aggressiveness with cruise ships, if you want to call it that, and just for the reason of the density of the number of people there, their historical ability to pass stuff amongst themselves that far exceeds cars driving into town, trains coming into town, or planes coming into town. In terms of what's going on or what should be going on with group gatherings, I also would, my response right now to somebody who would want to talk about that is that if you have a concern, you just don't go do it. And it doesn't need to be martial law yet. I will tell you in my day job, this is already happening. I handle a ton of accounts that start with the two words Santa Barbara. Just start adding Museum of Art, Museum, Moxie after that. And they are already questioning back to their insurance carriers what they're going to do, how they're going to handle their group gatherings, should they start to worry about that. So these kind of things are already happening out in the public sector away from the medical industry. So these aren't conversations we're having in a vacuum. They're taking place constantly all day long right now. And I think at this point in time, it's just prudent to say that if you do have a concern, that you practice social distancing or no group gatherings, and then wait for it to either improve or get worse, and then revisit it.
Thank you. My comments would be that I will contact Amtrak and MTD. That's my role as mayor, is to be in touch with those outside agencies and find out about their disinfecting practices, and I'll write a memo to the group. I haven't heard anything about closing the airport. I've heard from some of the business people that are concerned about that, where we are proud of our airport and also proud of its protocols for safety and public health. So that's in the mix. Of course, we're keeping an eye on the airport. Thanks to everybody who wrote emails. I think I answered them all. I didn't get through all the phone calls that came, and I'd call somebody back. I was on the phone last night, and then they wanted to talk about potholes and other stuff. So I'm trying to get through my returning phone calls, just to let you know out there. And then if we get to the point of ordinances related to helping workers who are sick or closing public spaces, we're ready to do that. We need to let the public know. I like how Ms. Harmon said it, that it's public health and safety is a very serious responsibility that we have, and we're doing our best. We're doing our best with the cruise ships within the legal framework that we can. And so, Mr. Gutierrez, you're on record with your comments. I don't hear other people from the council saying, let's go ahead and do a ban. That's a pretty strong statement. So I'm getting ready to close this hearing, but I see your light on, sir.
Yes, thank you. I just want to emphasize that other cities are, shutting down major festivals like Coachella and Stagecoach and South by Southwest. I just got notified that UCSB is not going to allow attendees to watch sporting events, and I believe City College is doing the same. So I guess just going off of what Mr. Jordan stated, could we just encourage the public and organizations to cancel themselves, so to speak, as opposed to being as aggressive and coming out with an ordinance? Can we do that? Can we make a statement? Can the county do that? Are you doing that?
You're right. I got an email too that UCSB is limiting in-person meetings if they count among their research groups. So people are taking initiative on their own. Groups are. So did you have a question for our county representatives? You said, are they?
Yeah, so are they just encouraging organizations to basically do the social distancing themselves without having to have any type of emergency ordinance implemented?
Sir, go ahead.
At this point in time, since we don't have any community transmission in the city of Santa Barbara or the county of Santa Barbara or in neighboring counties, we are only recommending self-imposed abstinence, so to speak, from going to these events. We are not in a position. We don't have the data, the science that this would be helpful at the moment, and it would harm the industries. So it's sort of a fine line, and to time that perfectly is really an art. And I appreciate your concern for your constituents and the city at large, and believe me, I have the same. But we have to weigh the pros and the cons, and I think without any proof that there is any sustained, transmission in the community, I feel pretty hard pressed to implement such draconic measures at this point. Now, this could change overnight, and it's a challenging situation because what we want to do is we want to protect as many healthy people so that they can still stay healthy and the sick ones to get the care, but we also don't want to impose unnecessary harm to people due to shutting down whole industries and so forth. So it's a very fine line, and I'm just hoping that our timing will be perfect. So bear with us. For the time being, we did send out press release for a strong recommendation, especially for vulnerable people to consider that for themselves. We're trying to empower those people also, because everybody has to take care of themselves and their family and their, first. And once we cross this threshold of having confirmed, multiple confirmed cases, which, constitutes transmission in the community, then, we are ready to make the next step.
Okay, so I'll just speak for myself that I understand and respect your position. I don't entirely agree with it, but I will just ask the community to voluntarily contemplate rescheduling some of these events until at least the numbers start to drop globally. Thank you.
I think that's a very reasonable approach.
Thank you. With thanks to Dr. Pristowski, Ms. Batson, Dr. Ansur, Mr. Werft, Dr. Fisk, Dr. Wilson, all of our city staff, Chief Males, thank you so much, everyone, for the information and the discussion. We'll close this item. And we need a break. It's been a while. We'll take a 5-minute break. Thanks. Let's call ourselves back to order. Let's see. We're back in order, thank you. We're on item number 8, please, Ms. Clerk.
Item number 8, West Side and Lower West Neighborhoods Transportation Management Plan. Recommendation that Council A, approve the West Side and Lower West Neighborhoods Transportation Management Plan, and B, adopt by reading of title only a resolution of the Council of the City of Santa Barbara supporting West Side and Lower West safety enhancement infrastructure improvements and directing staff to apply for a grant to fund design, environmental review, and construction.
Very good. We're ready if you are staff.
Madam Mayor, council members, thank you. Good afternoon, long afternoon. Public Works is here to talk about the west side, and you may recall if you were watching when we were on the east side a long time ago and we did our first neighborhood transportation improvement plan, and that effort yielded millions of dollars of grants and improvements to the east side. And one of the greatest reasons of doing those communities, the east side, west side, is they have disadvantage points for our active transportation planning grant program. So we wanted to go to the west side next and hopefully yield the same success that we had on the east side. So this conversation is about what we did when we went out to the west side, what we learned with our Vision Zero strategy, that's your strategy, and what is the fruit of it, and what are the projects we're trying to attempt to go after. So we have the all-star team. We have Jessica Grant, who's running transportation planning, Derek Bailey, our traffic engineer, and take it away.
Ms. Grant.
All right. Good afternoon, Mayor Murillo and council members. Jessica Grant. So why this planning effort? As we did at the east side, we wanted to continue the success that we had. We want to improve neighborhood livability in the west side. What was different from the east side planning effort to this planning effort is during this time we the council approved the Vision Zero strategy in 2018. During this planning effort, we had a very robust public outreach. It began last April. We kicked it off with the listening workshop. We also followed up with a community survey. During this time, we also received emails and calls. Paralleling this effort, we are also conducting a Vision Zero traffic safety assessment where we would analyze collisions to see if there was any patterns. And between the public outreach that we received and the traffic safety analysis, that all sort of blended together, and it came up with approaches. That led into then last June into the approach workshop where we discussed potential solutions to neighborhood concerns. And this was all boiled into the West Side and Lower West Neighborhoods Transportation Management Plan. So what's in the plan? It's a Vision Zero focus with respect to safety. The plan also discusses at length the community feedback we received and what were the major emerging themes that I'll discuss in just a couple minutes. And then most importantly, as part of the plan, is implementation of it. And so that's broken up into 3 different sections of already funded projects, projects that we include in our operational budget, and then unfunded projects that we would be seeking grant funding on. This is just an example of a heat map that we do during the collision analysis. So in red would basically be where we're detecting higher levels of collisions. So that would detect a particular pattern, and followed by orange and yellow and green where we still have collisions happening, but not as much in the areas where it's shown as red. This is an example of the collision data from nighttime. The yellow dots are not collisions, it's the streetlights. But what we see here, for example, the intersection of San Andres and Carrillo, there was a pattern of broadside collisions. Over here along Mission Street, the pattern was driving under the influence. around the intersection of San Andreas and Mitchell-Torena, there was a pattern of vehicle-pedestrian collisions. Then from the collision data that we received, and then the community, with the community feedback, then we'd like to see where is that overlap. What we've heard from the community, if we had to describe it in 3 particular themes, the themes are to make walking safer and more inviting, more neighborhood lighting, and safer biking to school and work. For this part of the presentation, I'll hand it off to Derek Bailey. Given these themes, put them in context, then he's going to go over the funded projects and projects that are ongoing as part of our operational budget.
Madam Mayor, good afternoon. Derek Bailey with the City Public Works Department. One project that we've had in the works for a few years now is the Carrillo Street corridor west of Highway 101. Most of that effort is going to be at the Carrillo-San Andreas intersection, but the project includes corridor lighting from the freeway all the way up to Miramonte. So that'll provide nice, consistent lighting for both the street and sidewalks in that area. The intersection improvements are going to benefit all modes of travel. It's going to reduce the pedestrian crossing distance. That actually helps our traffic signal timing a lot because we have a lot less flashing don't walk time that we have to give pedestrians. And that way we can provide more green time to vehicles in different directions. So the intersection is going to become more efficient, and we're also adding left turn arrows from Carrillo Street into the neighborhood. The project also includes a new crosswalk at the intersection of Carrillo and San Pascual. As part of our studies, we noticed there's a surprising amount of pedestrian crossing activity at San Pascual. Very wide street, very busy, but yet a lot of people were crossing. So we were able to work with Caltrans and through the federal funding that we are getting through for this project, able to incorporate that feature into the effort. We expect this to be under construction sometime this year. Recently completed in the Lower West neighborhood, the new crosswalks on San Pascual Street at both Ortega and Coda. Also included with the crosswalks are new lighting. So this was done in conjunction with the recently completed paving project on San Pascual Street. And in design right now is the West Side Bike Boulevard project. It's a $4.5 million project, and the purpose of the project is to provide a really high-quality cycling route through the west side and also from the west side into the downtown area. The original scope was to include the bicycle boulevard on Chino Street, and that was identified in the bicycle master plan a few years ago. When the bicycle master plan was put together, Chino Street was identified as being kind of the ideal location in the west side. It's close enough to the freeway that it can be used for crosstown commuters, but at the same time it would provide a really good safe routes to School Street. And it's close enough to provide good connectivity to Lacunga Junior High and Harding. And at the time we did some traffic analysis and the project appeared feasible. But now that the project is funded, and we did a deeper dive into the traffic analysis, we did discover a pattern that makes the project very challenging to move forward with. There's a pretty heavy cut-through movement from Carrillo Street, up Chino, and then across Mitchell-Torena Street Bridge into the downtown area. Almost 1,300 to 1,400 vehicles a day are doing this movement. Fully a third of the traffic on Chino Street is doing it. If we were to move forward with the Bicycle Boulevard project on Chino Street, we would have to divert that traffic in order to create a safe cycling route. Diverting that traffic would cause a lot of other problems in the west side. Traffic would likely divert to either San Andreas Street or Gillespie Street. Gillespie Street is a nice, quiet residential street right now. San Andreas Street is operating close to capacity, so putting additional traffic on there would likely cause some safety issues.
And Mr. Bailey, to be clear, these are people traveling from the Mesa down, cutting through the west side to get downtown. It's just for people who aren't oriented on this map.
Yes, Madam Mayor, that's correct. From the Mesa through the west side and then across the Mitchell-Traina Street Bridge,
Okay.
likely to avoid congestion at the Carrillo Street interchange.
Very good.
So through the neighborhood transportation planning effort, one of the ideas that came up was instead of one bike boulevard, two. And as we wrestled with that, it actually started to make a lot of sense. So what's being proposed now and what we're working with Caltrans on for a scope of work change for this $4.5 million project is a bicycle boulevard on Gillespie Street that'll go right past Harding and right up to the front door of Lacoumbra Junior High. It's going to be a great bicycle boulevard, and not a lot of work has to happen to Gillespie Street in order to make it a more bike-friendly street. There will be some new crosswalks installed with the project. The second bike boulevard will be installed on San Pasqual Street, and that's going to be a really strong connection for commuters that cycle out Modoc towards Goleta and UCSB. So the two bike boulevards, actually, the more we thought about it, made a lot of sense in serving the two really distinct target audiences that we're trying to serve with this project. So in addition to the funded projects that have already been implemented or are in the works right now, there's a lot of day-to-day operational projects that we do every day. There's sign maintenance, pavement maintenance, intersection visibilities. A recently implemented low-cost improvement was putting in a leading pedestrian interval of the traffic signal at Mitchell-Traina and San Andreas. Just the walk light comes on a few seconds early. Just gives pedestrians a head start into the intersection at an intersection where we had some pedestrian-involved collisions. So then there's some unfunded projects that were identified as part of the pedestrian master, or the West Side Transportation Management Plan. Both city identified through Vision Zero planning efforts and things that we heard from the neighborhood. One of the things we heard was to make the neighborhood safer and more inviting for walking. And some of the most frequently suggested things that we heard was to improve intersections along San Andreas Street and Chino Street, sidewalk infill throughout the neighborhood, but the most frequently mentioned was along West Valerio and Kayakino and up towards Ealings Park, and missing pedestrian access ramps. On San Andreas Street, we are proposing to build 5 curb extension intersections. And the graphic on the left illustrates the benefit of curb extensions. As you see, the driver on a street like San Andreas that has a lot of parking has really good sight lines of pedestrians wanting to cross. So in addition to making the crosswalk safer, this also preserves parking on San Andreas Street because we don't have to put in a whole lot of red curb to add sight lines. On Chino Street, one of the potential solutions is to install pedestrian islands. And this is a map that just summarizes all of the potential pedestrian improvements that staff identified and that we heard from the community in the west side and lower west neighborhoods. I'm going to turn it over to, oh, I have one more, sorry. We also heard about improved neighborhood lighting. Improved neighborhood lighting throughout the neighborhood, but specifically on San Andreas Street was the most frequently commented. This map shows the San Andreas corridor from Canon Perdido all the way up to Mission is a potential corridor for improved lighting, which we would like to move forward with the grant application. And we've also heard more recently through the Modoc Road planning effort that residents would like to see improved lighting on Modoc Road as well. Now I'll turn it over to Rob Dayton.
The unfunded projects that we were looking at, and this is mainly for the active transportation planning grant, and trying to hit it out of the park. The point is we've got to make the points. And so we're really watching what do we have to do to get the points. And so I'll walk you through the transformative aspects of this project that will help us get that money. One of the things that's kind of interesting, you see the bike boulevards in the semi-orange color. The missing links, I'm going to point out, are Modoc and down here to the west side, connecting the west side to the beach. You might remember the Rancheria bike lanes that went in with the bike plan. This new bike boulevard structure, and then right here in this area is where I want to focus on, because during the West Side project, we didn't hear a lot of feedback on this particular street. This street does not have a lot of parking on one side, but this would require the removal of parking, and so we need to beat the bushes just a little bit more with the neighbors because we've learned on-street parking is really key. It was a big issue, which I'll talk about later for the west side. So we need to pursue this more, but this link is really important for the transformative nature of the project. And then the other one is up in the Modoc area. You'll all probably be turning shovels pretty soon on this project in Las Positas, Modoc, and it's going to be a big day for us. Long time coming, since 1974, we've been looking forward to this. So. And then you have the west side with this strong bicycle boulevard network that's coming in, and then you have this gap in between. And so how do we create transformative transportation in terms of bicycling to link these two? And then the other thing is really interesting, this yellow portion right here is the Junipero Bridge. So the Oak Park neighborhood actually, if you get to the bridge, which is pretty easy, once you're over the bridge, if we created this stronger Modoc section, wow, you could get to the beach, feel really comfortable as a parent. So how do we do that? It's kind of tricky. We talked to the neighborhood. We had an additional approach workshop specifically for this section of Modoc at the La Cumbre Junior High. We had two options. This is the preferred option. So this is about what it would look like on Modoc. Very, very close. It's a two-way bike path on one side of the street protected. Probably not with delineators. We're trying to think of something that would look more neighborhood and less construction-y, so we're still working on that. But this is the section that would be from Las Positas over to Mission. And then actually on the section right by the junior high on Portezuelo, that would actually be an off-street separate path if this project was to get funding. The issue here is parking. And that's the tension we want to focus on. We put signs out for that approach workshop. Every I think it was like 100 feet, parking could be affected here. We put signs out for the TCC meeting, the Transportation Circulation Committee meeting. Parking could be impacted. We tried to really beat the bushes. Like, if you're concerned about parking, please come out and express that. It's kind of interesting. It's not necessarily a parking removal. This could be actually favorable for the residents, and we heard both sides of it. What it looks like is during the day, you have bike lanes out there. And then in the evening, after 6 p.m., residents can park on the street in those bike lanes, and 7 a.m. they have to move their car. So we don't have a lot of people parking at night on that street for that reason. It's pretty inconvenient. With the new plan with bikes on one side, there would be one side of the street that would have that evening time parking removed, but then on the other side of the street, you'd get full-time parking in exchange for that. So we haven't heard a lot of concerns. We haven't heard the voices we thought we might get. So we think that the neighbors are favoring that particular proposal. That's our best guess on that.
Mr. Dayton, there's a question.
Mm-hmm.
Thank you, Madam Mayor. Just a clarifying question on that last slide. So the proposed all-day, the one on the bottom,
Mm-hmm.
that would be a protected bike path going in two directions, and that would be 24 hours a day.
That's correct.
And that's your preferred currently
That's correct.
proposal. Okay, thank you. I like that one.
Yes. Okay, so then on-street parking concerns. This is a tough one. We're getting this more and more on the east side, on the west side. You got a lot of people who are, they're scratching to make it in Santa Barbara, as we all had to do at one time. They're bringing their work trucks home. And so you've got a lot of people who use their garage for other things, which is totally understandable, storage. We used to say in transportation planning, 50% of the garages in Santa Barbara are unusable for parking. Now I think we say 20%. Or 80% unusable. So this is the issue. The challenge with our downtown parking program, which we do permits with, that program is specifically designed for employees who are taking over a neighborhood parking during the day. So what happens is the neighborhood we get 90-minute parking, and the neighborhood gets a permit. They buy a permit for $30 a year, and then they can park unlimited on that, but employees have to move. So that's how we fix that problem downtown, the west downtown, some of the east side. When you have neighbor versus neighbor, it's a little bit more complicated and controversial. So if the council is really interested in us at some point, us going down this track, I'll just give you a taste of what it might look like, but it's not something we would run to and be happy about. It'd be like, okay, every resident gets a certain number of permits, so you're limiting it. Maybe there's a way to have people actually park in their driveways instead of on the street. But it's an unsavory discussion, so we're not running to it, but we just want to put it out there that the tension is there. And that it's a real issue for our neighbors who feel like, I can't park in front of my house or on my block. That's a big deal. And so we went to the TCC. We actually took this to the Neighborhood Advisory Committee as well, and there was a lot of support. And then we're coming to you. This is the recommendation. And with you sending us off, we will be busy doing grants for the next 2 months. And we'll entertain questions.
Oh, is that, okay. Okay, so we're looking at approving the plan and then directing you to go find some money. Mr. Casey, you're back right in time, because the first question that I was going to have is, or maybe Mr. Dayton, of course, you can answer this too. So is there Measure C money in the long run for any of this stuff? And I liked when you had funded projects and then you're like unfunded projects. Wait a minute. So grants first, right? And then we go into the Measure C pot of money?
Madam Mayor, council members, that certainly is the prerogative of City Council. I think the dollar numbers, these are pretty large. And Measure C has been focused on road repair and maintenance as opposed to kind of new. We've been able successfully to go after active transportation grants for these types of projects, which allows the Measure C to continue to stay focused. I also just want to caution that once the police station gets underway, the debt service is going to come out of Measure C and suck out a lot of kind of that little extra stuff we've been able to do these first couple of years. So yes, based upon prioritization by council, but I don't want you to think that there's a lot of money to do this. It'll come at the expense of something else that you'll have to balance the priorities for.
Thanks. I don't see any lights, and so I'll go to, okay, so Alejandro Gutierrez and then Oscar Gutierrez, and then we'll go to public comment, or if there's more questions. Mr. Gutierrez first.
Thank you, Madam Mayor. Excuse me. We've spoken about the potential of removing 5 trees from Mission Street in order to have San Pasqual connect to MODOC. Can you speak about what that intersection is going to look like once those trees are removed, and whether or not we can replace those trees, not necessarily in that location since there's going to be a bike lane there, but kind of supplement the rest of the west side with more trees?
Get the location on the slide. Yes, Madam Mayor, Councilmember Oscar Gutierrez. So this is at the intersection of MODOC and Mission. And the part we're talking about is a section of the project we have already approved and funded. This is one of the bike boulevards from San Pasqual that moves over here. The 5 trees that we're talking about are in this section on Mission Street. There is a what would be called a class 1. It will be an off-street path incorporated with the sidewalk, so a multi-purpose path for just a short distance to the intersection. That does remove 5 jacaranda trees, so we would be replacing those trees, and we could even do that throughout the community or figure out places to put those to mitigate that circumstance. And fortunately, that tree grows pretty fast. So we can also place it in the area to restore the canopy eventually.
Madam Mayor, Councilmember Oscar Gutierrez, if I could just add to that, once the path is built, a new parkway will be established. So the existing bike lane on the street right now is basically where the new parkway will go. So the 5 trees that will be removed, there will be new trees replanted in that area, so that the corridor will eventually grow back. But as Mr. Dayton mentioned, we are looking for opportunities to add plantings throughout the neighborhood.
Do you know how many? Like a ballpark number? Anywhere between 50 to 100?
As part of this project specifically, we don't have that number yet, but we do know that there is interest in working with the Parks Department to add some additional trees where there are empty tree wells, basically, throughout the west side. So I can't give you an exact number, but we do know the interest is there.
Could you reiterate which parts of this entire project are going to be done first or more soonest?
So the really important thing to understand is that in order to get all the things across the west side that we want to get, that the neighborhoods was talking about, we really have to get the Active Transportation Program grant. So the transformative aspects of the project on either side of the west side that connect the west side to the larger system and the pedestrian crossing and safety aspects that you heard about, those are going to be paramount. And then what we're doing is we're kind of throwing all the little things in with that. And then the project cost benefit ratio goes up and we get the points for it. So it's really hinging upon, it'll be all at once if we get the money. We'll be doing it all at once. And so that's the key, is we really have to write a grant that shows that this is a transformative project. And that's why we spent extra time with, for instance, the Modoc neighborhood to make sure that they were okay with that, because without that piece, we're not gonna get the points we think we need to sell the whole thing.
You said that one part of the project has already been approved. You already have the funding for that?
The parts that are in the orangish color, that's already funded by through Caltrans, and we're working with them on adjusting that project. And so the tree removal is a part of the funded project.
Do you know how much parking is going to be removed in total?
Madam Mayor, Councilmember Oscar Gutierrez, there's a grand total of 23 parking spaces throughout the entire project. The majority of those parking spaces are going to be on the 1400 block of Castillo Street on the other side of the freeway. So that was a project alignment that came out of the bicycle master plan. As you may remember, there was a lot of tension with the Mitchell-Terena Street project, and the ultimate solution was to duck down one block to Sola Street, and that's what necessitated that parking removal. So that's where the majority of the parking removal will be.
Is there any more parking being removed from the lower San Pasqual area where Rancheria is?
No, there won't be. Other than the parking spaces that Mr. Dayton mentioned as potentially being affected on San Andreas, none below that.
And you'd mentioned the process involved with parking permitting for a neighborhood. Would you be able to facilitate a workshop or a presentation to City Council that could potentially cover a district-wide parking permit program?
Madam Mayor, Councilmember Oscar Gutierrez, yeah, we're happy to put that together. We've had, in my career in 3 decades, we've had that experience, and the closest one that resembles it is Area L. That is a location which is up on near the Modoc area, where it's 2 apartment buildings are starved for parking, and so they impact the street heavily. And so the parking permit was developed there so that those 2 buildings can't get a permit, and so to protect the other neighbors. So it has been done. It was a very difficult process. We still got a lot of complaints in our office from it. But we are happy to walk you through it.
Thank you.
Mr. Friedman, questions?
Thank you. Those were the ones I had. I had one just a little bit off here, but since we're talking about the west side and some of the choke points, what's the future of on Mitchell-Terena where Dutton Avenue is? Because that area, it seems there's always a bottleneck of cars going in. It's basically an alley, but they use it to get up to San Pasqual. And I read in the report there was some discussion of it, but is there a way we can address that particular little T or intersection there in the future? And why wasn't it part of this process?
Madam Mayor, Councilmember Friedman, yes, that intersection will be addressed, and it's part of the already funded project. So that's why we didn't go into that much detail with this plan, because it's already in the works. That section of Mitchell-Trena Street between Dutton and San Andreas is going to be widened slightly so that we can fit on-street bike lanes. Right now, as you're coming over the Mitchell-Trena Street Bridge, the road suddenly narrows and the bike lanes pinch off and the cyclists have nowhere to go. So part of that project will be widening Mitchell-Trena all the way over to San Andreas Street. And then associated with that project, there's going to be an island installed at Dutton. It'll be a pedestrian crossing island with flashers, new overhead lighting, but it's also going to restrict turning movements to right in, right out from Dutton, so that cut-through traffic that comes from San Pasqual won't be able to shortcut through to get to the Mitchell-Trena Street Bridge anymore.
Good question. The Super Kukas intersection.
Yes.
If there's no other questions, we'll go to public comment. Art Ludwig, you're first. Thank you for waiting. You've been out there all afternoon. And then Melissa Cunningham, and then David Landecker, 3 minutes.
Able to switch me over? Yeah, Madam Mayor, honorable council members, new council members, thanks for the opportunity to address you today about the importance of the good work of staff on this active transportation measures and why it's so important. Thanks to new state rules, Santa Barbara is expecting to add as many as 11,000 new units of housing. If these new residents bring 22,000 more cars, this would cause an unprecedented congestion air pollution condition that would degrade the quality of life in Santa Barbara. Everyone wants these new residents to live car light. And the way to ease the traffic, parking, and pollution that this could cause would be to listen to people who are already living car light. What routes and other support are missing, to engage the Bike Coalition early in the transportation planning process, and to evaluate the impact of every dollar spent on transportation for its impact on active transportation as well as on climate. When I was a kid, it was safe for children to walk along Las Positas to Adams School. But now people drive about twice as many miles per capita. We've become too car heavy. The number of miles each person drives is a key metric that should be tracked and lowered. Each action that increases automobile vehicle miles traveled carries high external costs, including increased noise and pollution, more deaths and injuries, lowered health metrics, and reduced property values. On the other hand, each resident who goes car light saves the community thousands in external impacts. The projects in the West Side Transportation Plan will bring us closer to the holy grail of being able to get from A to B using our own healthy bodies without the threat of being killed or injured by car traffic. This would take us a step closer to the implementation of the excellent health and sustainability policy direction that Council has given in the general plan. My family lives on the Lower West Side. We bike and walk for 90% of our transportation. By going car light for 40 years, our family has saved over $250,000 on transportation and even more on health care. We have only moderate income, yet we've achieved home ownership in Santa Barbara largely because what could have gone to car debt went instead to home equity. We never get stuck in traffic. We always have VIP parking, always have enough exercise, spend more time immersed in Santa Barbara's natural beauty. We'd love for the city to lower the barriers that prevent more people from enjoying this community benefit transportation choice. For example, only when all the missing links in the bikeway network are completed will the potential of the network be realized. We thank the city for working to take realization of active transportation's health and economic vitality benefits to the next level. Thank you.
Thank you. It was well done and positive. Thank goodness. Ms. Cunningham.
I agree. Thank you. Hello, I'm Melissa Cunningham with Coast, and thank you, Madam Mayor and council members, for being here and all that you do. On behalf of Coast, I'd like to really thank the Public Works staff for their diligent and thorough efforts in the creation of the West Side and Lower West Side Neighborhood Transportation Management Plan. They have engaged the community, they saw input from Coast and SB Bike, and have presented us with a really crucial project that our city very much needs. We appreciate and support that the staff is committed to Vision Zero, as is evident with the improvements outlined in their plan, such as improved pedestrian infrastructure, as we've just seen, by adding new crosswalks, sidewalks, curb extensions, pedestrian islands, upgrading existing ones, and upgrades in lighting and sidewalk infill as well. And this, along with the bicycle infrastructure, will provide safer routes to all the schools, and there are many of them in these neighborhoods. The addition of the bike boulevards, the multi-use paths, and option number 2 that they presented with the separated bike path on Modoc Road will greatly and positively affect Vision Zero goals for safety and accessibility. And additionally, it'll provide much-needed connections in our city-wide bicycle network. So we encourage the council to please approve the plan and to agree to the resolution, and to please direct the staff to seek funding required, particularly the active transportation grant, so that we can get these vital Vision Zero projects underway and improve not only the lives of the residents of the West Side and the Lower West Side neighborhoods, but of the entire city as well. We will all benefit from this. So thank you.
Thank you. Thanks. Mr. Landecker.
Thank you, Madam Mayor, members of council. I'm David Landecker, the interim executive director of SB Bike, sometimes known as the Santa Barbara Bicycle Coalition, sometimes known as BC Centro. Whoever we are, in the spirit of the day, I want you to know that we started off this morning by canceling our annual event, which was to take place on May 17th. Given everything you've heard today, you make me feel a whole lot better about it. Mr. Gutierrez, that's what it takes, is that we've got to make those choices, and we're making them. I want to thank the council for encouraging things like this and for supporting it and making it happen. It doesn't happen without your support and your originating the ideas. And I want to thank the staff for working so closely with organizations like us in town, and for listening to what we have to say. Most importantly, I want to thank them for showing up to our meetings with their helmets on their bikes. It's just so encouraging, I can't tell you. I want to thank the city for the many steps that are being taken. This and other bike trails, the incredible Celebrate State Street that we're going to have in May. I hope we can still have that, where it just is, it's an exciting thing to have happen. The bike sharing that's going to start in July or August or whenever it is that it actually starts, but it's just the city is doing the things that have to happen. And it should be clear that we do support the recommendations of the city. But I'm up here because I want you to know that part of our job is to give you political cover, because we're the ones who keep saying, do even more, get even bolder, make it happen more, on a larger scale. We're in a world where we need to reduce carbon. We need to reduce obesity. We need to have stronger lungs so we can fight off the viruses that are out there. We need fewer roads and parking spaces. We need to cough less. What we do with this is we make it easier and safer for people, particularly kids, but for all people to be on bicycles. That's what we do as an organization, and it is really important that we do this as a city. Our town is considered one of the nation's examples of how you can actually make it work. And I thank you as our leaders for making that happen. Our job as an advocacy organization is to continue to ask for more. Don't worry, we will. We'll be back, we'll be asked for more. The bottom line is that this is one more important piece of the puzzle. It creates those little connections. It makes it so that these things that we keep doing work together. And hopefully it works well enough that we get funded by the state. You know, that's a lot of how this gets pushed. We thank you for your work in this direction, all of you, because you have all been there every vote. Thank you very much.
Thanks. We'll close public comment, and I'll go ahead and start. I don't see any lights. So when I was running for the West Side seat in the summer of 2015, people were saying, let's do something about the intersection of Carrillo, San Andres, San Pascual. And sometimes government takes a little while to make stuff happen. But I know you worked really hard to get that grant money and that our city is the envy of a lot of other jurisdictions because we were just so good at writing those grant proposals. Is that you, Mr. Dayton? No, it's Ms. Grant. Thank you. Thank you for being so good at getting us money from the state. And the other thing I'll evoke, because I'm just so excited, I hope we pass this unanimously. I have a friend who rides her bike in the rain, and it's kind of rainy today. And people will say, how can you ride your bike in the rain? And she's like, well, I just, I put on a jacket and some boots. And she's just so dedicated. Shannon Miller, can I just go ahead and give a shout out to Shannon Miller? And so she kind of challenges us all, to really enjoy our city and get wet like when we were little kids. And anyway, I always feel like a little kid when I'm riding my bike. And it's a freeing experience. I think I'm inspired by Mr. Ludwig's presentation. Thanks. And I'll pass it to Alejandro Gutierrez and then Mr. Jordan. Thanks.
I just wanted to thank the team for doing such a great job and getting the grants and such a lovely presentation. I also work for Franklin Elementary School, and Franklin Elementary School works with outside organizations because a lot of our students don't know how to ride a bike. But they have definitely benefited from the work that you guys have done in the east side, and a lot more kids are riding bikes. And there's a huge movement in the east side and all of Santa Barbara where a lot of youth that would hang around in areas that are not so very good for their positive influence, they're now riding bikes. And they're now, being out there in the community, and they're owning their community in a more positive light instead of getting into trouble. So thank you so much for making that happen.
Mr. Jordan.
I have a couple comments, but I'll make the motion to approve the plan and adopt the resolution of support and direct staff to apply for funding.
Second.
And thank you all for seconding. Probably Art or Mr. Ludwig, that is about the best and happiest visual presentation I've seen in here in a long time. Sorry, Rob, but these things are happening all over the city, and the great things. Several components of that to me is that they transcend culture, economics. You could make the case that it's great for middle-aged white guys. You could make the case that it's great for transportation options for people who don't have a car. But most important to me was, Art, you thankfully putting up children in those slides, because it also is such an imprinter on where we want to be for the next generation. Not necessarily me, I'm about done, but where we want to be for the generation, the 5 to 10-year-olds that are in our households right now, and what that looks like and what that gives us right now to start on that path. So thank you for that presentation. And again, Rob and your whole team, thank you again for the work you're doing.
Okay, so we have a motion by Mr. Jordan, and we'll say the second is from Ms. Gutierrez, A. Gutierrez. And if there's no other discussion, we'll go ahead and take a vote. All in favor? Aye. Any opposed? Unanimous. Very nice. Staff, thank you. Folks from the audience who waited for a long time, thank you so much. We're going to take a short break so that technical people can help set up for the land use appeal. Short break on recess. back to order, please. Ms. Clerk, will you read number 9 for us? We're not quite ready for you, Ms. Appellant. There'll be time for you.
Okay.
Thanks.
Item 9, appeal for the Architectural Board of Review's project design approval for a second residential unit at 601 Alameda Padre Serra.
So land use appeals are a particularly serious responsibility of our city council. It's called a quasi-judicial proceeding, and there are specific rules and a format. So this is how the meeting will be structured. First of all, council members will disclose any ex parte communications. Then we'll have a staff presentation, and then remarks from a design review board representative, if appropriate, ABR representative in the back there. We'll take questions from the council. We'll have a 20-minute presentation from the appellant. If you don't use your whole 20 minutes, say you have 5 left over, you can use it at the end to make closing remarks after the applicant has spoken and after public comment. So it's up to you how you use your 20 minutes. Questions from the council, and then the presentation from the applicant. Same thing with the applicant. If you save time, you can use it a little bit later. Questions from the council again, public comment, and then council deliberations. Ms. Sneddon, you had a question? Oh, you need to disclose ex parte? Go ahead.
Thank you, Madam Mayor. I had a brief, and I didn't realize I was meeting with the appellant ahead of time, but I had a brief meeting with the appellant and discussed nothing further than what's actually less than what's presented in the material.
Understood. Mr. Jordan?
Madam Mayor, I feel like I had a meeting with the appellant. I was inundated with materials appropriate to today's hearing outside of the normal course of communication. They were just going to council and mayor and not to staff or whoever other interested parties were. So at some point during that process, I asked the appellant to stop sending them to me, but they were still coming to me, so I have not viewed those.
Okay.
I am waiting for information to be given at today's hearing.
That's generally what we try to do is have all the public discussion here. I feel like yesterday at the site visit that I let a little bit of argument creep in, so I did hear some argument from both sides yesterday while we were at the site. So that's it for disclosures. Thank you. Staff presentation. Very good to see you. Thank you.
Thank you so much. My name is Ellen Kokinda. I'm planning analyst. We're here today for the 601 Alameda Padre Serra appeal. The proposed project is a new 1,724 square foot 3-story unit, which is it's proposed to be attached to an existing 2,453 square foot 2-story single residential unit. The proposed plan includes a new 2-car garage with a driveway and turnaround with access from Alameda Padre Serra, or APS. This project received project design approval at the Architectural Board of Review on December 2nd of last year. Right here, this is the existing single-family residence on the corner of APS and Coda Street in the East Side neighborhood. The image to the right is the existing 2-story residence with the driveway off of Coda Street. This is a photo taken from APS it's the north elevation of the existing residence, but it's facing south towards the city and ocean. This right here is a photo that is taken from the rear yard looking at the APS neighbor. And then the last photo, this is just another photo from Coda Street where you can see the existing residence at SO1 APS, and then the 2 other homes, you can kind of get a sense of the hillside, and then the appellant's house 2 doors down. So the ABR's purview is the design of the new unit, and as well as any exterior change to the site. As part of this project, the applicant is requesting 2 minor zoning exceptions, one for an overheight wall and fence within 10 feet of the front lot line, and the second one is for hedges that would be a maximum height of 12 feet along the southern lot line. Just so you understand that the minor zoning exceptions will be considered by the ABR at the final approval hearing. The specific findings for these minor zoning exceptions were not made as part of the project design approval, but just know that it's being requested as part of the project, so that's out of the purview for this evening. Prior to receiving project design approval at ABR, this project received a lot area modification to allow a second unit in an R2 zone with less than the required lot area for a lot between 20 and 30% slope. I think Councillor Friedman asked, is this an accessory dwelling unit yesterday? It's not an accessory dwelling unit. It's just a second unit that was proposed as part of the conditions of approval from the staff hearing officer. She addressed the unit affordability, so it would have, the new unit would have a 90-year deed-restricted affordability covenant, and then there were other outstanding enforcement items that were addressed as part of those conditions. Here is the proposed site plan. The existing residence is shown with the kind of the white blocking. The new unit is proposed in gray with the entry. You can see here from Alameda Padre Serra that there's a new driveway. You would come straight into a 2-car garage, and then you'd have the ability to back up on site, and then the drivers would be able to pull out in a fashion facing forward on APS. This project is a little unique in that when you come in from APS, you're driving straight into the garage, which is in the second level. The top level is the main living area with kitchen and living room, and then the lower level has 2 bedrooms and bathrooms. This is the east elevation of the existing primary residence, where you can kind of see an outline of the proposed unit at the rear. This is the north elevation with the site wall changes. Right here you have the existing residence, and then it kind of steps up with the entry and the new unit right here. It looks like a 2-story unit from APS, but when you're on the southern lot line, it looks like a 3-story unit. You can tell that it's 3 stories. This is just on the other side of the site wall, so you get a better view of what's being proposed. Here's the garage that's on the second level, and then the main living area right here. This is the west elevation. This is where you can really see if right here is APS, you drive in. This middle second floor is the garage. Again, the main living area up here on the 3rd floor, and then the lower level has bedrooms with access to the open yard area. Just one thing to note, I mentioned the minor zoning exceptions earlier. One of them is for the hedge height to not exceed 12 feet along this southerly lot line in order to provide a little bit more privacy buffer. Here's the south elevation. This is the one that is probably the most controversial. And it's, again, you can see from this area where you get a sense that the new unit that's being proposed is 3 stories. So you have the existing residence and then the new unit right here. And I can go into that a little bit more later. So this project went to 2 ABR concept reviews on May 20th and then again on June 3rd. There were no decisions made at either one of those concept hearings, but at both meetings, the ABR expressed support of the mass, bulk, and scale of the project. On September 25th, the project received the lot area modification approval by the staff hearing officer, and then the project returned to ABR on December 2nd, and that's when the ABR granted project design approval. The project was appealed 10 days later on December 12th. So this list are the main issues that are listed in the appeal letter. I do want to say that this isn't a comprehensive list because in the appeal letter you'll notice that there are more items that were listed than are on the screen, but many of them are not within the purview of the ABR, and that's really your role today is we'll be looking at a specific standard of review, and that's what you'll be using. So I've excluded some of the other points. Some of them related to the unit affordability or enforcement issues. Again, those are not within the purview of the ABR. Before I leave this slide, I just want to point out with the first point, compliance with the city charter and municipal code, The appeal letter mentioned that there were concerns that this project didn't comply with municipal code. I can say that planning and transportation staff reviewed this project and were able to make the call that it is in compliance as designed, and as part of the project design approval, ABR also made the finding that it complied with city codes. Probably one of the biggest issues is compliance with the design guidelines. The appellant contends that the project doesn't fully comply with the applicable design guidelines, and she's specifically called out the Hillside Design District, Neighborhood Preservation Ordinance, and Good Neighbor Policy. And then she also mentioned having concern about the sill height of the south-facing second floor windows. That's the windows of the garage that are on that second level, and that they shouldn't be lower than 5 feet. It's a little interesting because the ABR, the guidelines that they use to kind of help them make their design decisions, these are the guidelines that apply, the urban design, infill, and the ABR general guidelines. The others are really more focused on single-family design board, but I can at least say that the issues regarding privacy and mass, bulk, and scale are all addressed in these particular guidelines that the ABR is conscious of when they make their decisions. So in looking at this, the ABR had some real concerns at all 3 of the hearings about privacy impacts, and they asked for ways for the architect to study ways to produce those privacy impacts. They asked to provide an opaque balcony railing, introducing different landscaping and trees within the design. In the first hearing, they requested stepping back the 3rd floor from the southern property line. And then throughout all 3 hearings, they discussed concerns about the full-size garage windows. So in the end, the ABR granted project design approval with the condition that the garage, the sill height of the garage windows be raised to 5 feet. And just to give you a sense of what some of those things are, I mentioned the opaque balcony. So this is, or the opaque balcony railing here. These are the garage windows as part of the project design approval. They condition that they be raised to 5 feet so that they're not providing full windows. This here is a tree that the architect was proposed, again, to kind of block some of the massing, because this is the elevation that faces the appellant. Second kind of major issue is the neighborhood compatibility, and what we mean by that is the mass, bulk, and scale of the actual project of the new unit that's being proposed, and that the appellant was concerned that it's not appropriate with the neighborhood. Throughout this process, she has had concerns that the lot is being overbuilt. And then she also mentioned that the new unit would violate her privacy and personal space. I want to just back up really quick that in the second hearing, the appellant showed or created some photo simulations for the ABR to review, and kind of how she perceived the proposed project was going to impact her views and what she was going to be looking at up the hill. That they took into consideration. Then the architect, as part of his presentation, also provided his own photo simulation, which was part of your packet. And as by the 3rd hearing for project, or by the time they did project design approval, the ABR determined that the project is compatible with the desirable architectural qualities and characteristics of the neighborhood. They called out the size, mass, bulk, scale, and height, and said that they are appropriate for the location in the neighborhood. They discussed the 20-inch height reduction between the 2nd and 3rd hearings, that they appreciated that in order for the project to comply with zoning. And then in the 2nd hearing, they also discussed their appreciation for the architect's accurate photo simulation. So those were the tools that they were able to use to make their determination. Another issue that came up in the appellant's letter is that the proposed project, the new unit, blocks public views of the ocean from a scenic drive. This is the ABR's finding. They were able to say that the design does respond appropriately to establish scenic public vistas. as a supplemental, just to note, as part of our environmental review process, we have our master environmental assessment, which it maps out different visual resources throughout the city that staff use as part of the environmental review. Those are also included in your packet, and this particular site is not identified as a site that has that's part of a visual resource or like a view corridor. However, you can look at those maps and see that there are other parts in the hills a little, and down APS that have been predetermined to be a visual resource in the city. One of the issues that came up is requesting that either the garage not have any windows or that council consider that a carport should be built instead. And one of the major issues that the appellant had throughout the course of the project was that concern about the new garage being converted to a new unit without permits. At least for the first one, the ABR's guidelines generally discourage carport or to have any kind of major massing over a carport because it tends to be a little bit bulky and awkward. And the applicant never proposed that, so the ABR never considered it. But I can say that the ABR was very concerned again at all three meetings to address those garage windows, and that's why they conditioned the sill height to be raised to 5 feet on that southern elevation. As far as the second point goes, enforcement or any kind of unpermitted work is a very valid concern in the city. However, it's not within the purview of the ABR in this particular decision, and generally that's what we use zoning enforcement for. And it came up in several hearings that the applicant is aware that a garage that's permitted as a garage is supposed to be used for parking. And then lastly, there was a little bit of conversation in the letter about dissatisfaction with our procedures, specifically citing that the ABR meeting minutes do not reflect the discussion that occurred by the ABR members at project design approval. This is something that the appellant is correct. Our meeting minutes are not a full transcript of what happens. The city publishes action meeting minutes that include the decisions, but we do provide on the city website full video review, so you can go look back and understand the context of how the ABR does get to project design approval. So in conclusion, staff recommends that council consider the project design approval that was granted by the ABR. And with that, it's all the applicable project compatibility criteria because, again, that's the standard of review for making the project design approval decision. If council concurs with ABR, then you could deny the appeal. If council does not concur with ABR, then you could uphold the appeal. And just for your convenience, we have the project compatibility criteria in your council agenda report, but I also have them in slides if you need to reference them for future purposes. And that concludes my presentation.
Thank you. We'll call up our representative from the Architectural Board of Review.
Yes, and if I just may add, that is Mr. Richard Six, the ABR board member.
Mr.
Madam
Six,
Mayor,
welcome.
council members, how are you? I think the staff did an excellent job in presenting all of the deliberations we went through. I'm very proud that the final vote, the 4-2 vote, reflected the majority, that this was not a large, overbuilt, overmassed building, but yet the dissenting votes still were sensitive to the possible looming of the southwest, the west elevation into the yards, but that was a minor item, and I'm glad that the majority saw the mass spoken scale as appropriate. We did I think with the help of a very cooperative applicant. We reduced windows and did a lot for the privacy of these 3 backyards that are affected. So I think that we did a good job, and it's right where it should be in our deliberations. So if there's any questions, I'll take them.
Are there questions for Mr. Six or for Ms. Kokinda? Go ahead, Ms. Snedden, you first.
Thank you, Madam Mayor. I'm not sure who the question is for. So the 3 stories with the garage going through the middle of it, is that, and then, so the living space is up top, but the bedrooms skip a floor and then are down below?
Through you, Madam Mayor, Councilor Snedden. So here in this south elevation, I'm going to point in my mouse right here. These 2 windows are the garage windows. So the car pulls in from APS, and the headlights would be going out of these 2 windows. Down below are the proposed bedrooms, a laundry area, and bathrooms. And then on this upper level, it's the kitchen as well as the main living area and dining space.
Are you asking if there's a stairway or something that connects them? I'm kind of
Yeah,
wondering.
like what's happening on that 3rd window to the right of your mouse right there? That
This
isn't
one
the
right
garage
here.
in, and then, yeah, is there a stairway? And then also in the context of, in this hillside district, is this something you've seen before? Or is this sort of a new approach?
So let me start off by just mentioning that so here's the driveway off of APS. This is the new entryway. And then you have a stairway going down to the lower level bedrooms. And then you have a little half bath, and that was conditioned to only be a half bath by the staff hearing officer. And then there's a stairway upstairs to the main living floor. I mean, it's definitely a little unusual, but I can say that there was a previous project that was proposed that tried to get a driveway in at the lower level, and there wasn't necessarily enough room, or it was a little bit tricky to somehow get that. So the architect proposed this particular plan to respond to.
Okay, and then between the lowest level and the uppermost level with the garage in between is a stairwell?
Correct. This area right here is, this is the entryway. Again, if you're coming in the driveway, there's this little portion right here that's an entryway. You can go upstairs to the kitchen, main living room area, or you can go downstairs to the bedroom. And there's also, or again, you can pull into the garage right here.
Thank you.
Mr. Jordan, next.
Thank you, Madam Mayor. Could you go back to the south elevation, just before we lose Mr. Six? The windows that you guys are referring to that have been adjusted with a sill height, are all 3 of those windows, the 2 in the garage and the one to the right?
No, the one to the right is, I think, if I remember the floor plans, is one of the landings of the stairway.
Okay.
So the two to the
So,
to the left.
so only the 2 windows are
left.
being raised to 5
Only
feet
the-
sills?
Yes, that's correct.
And then I'm reading the plan we were just on a little different. I read the little windows to the right as being the landing. Is that not right? If you want to jump back to the plan sheet. Where the stairs are, you have that little skinny part at the bottom. Isn't that where those skinny windows are?
Oh, yes, you're correct. So, so all 3 windows, I apologize.
So the
That's
3
correct.
windows
All
are in the
three-
garage. Those
all-
are being raised.
All 3 windows will
And
be
there was no,
raised.
and are the windows, whatever the proper word is for clear on the stair landings? Why are those not being raised also?
I think there's, the architect will clarify, but I think the only window on the landing is the very 3rd floor window. You want to go back to the south elevation?
Yeah, so if you jump back to that slide, they're actually below the sill height on the elevation.
So the 3 mid-floor windows will all be raised to 5-foot sill heights.
But the way the plan is now, you could pause on the mid-stair landing on those right little windows, and those are not above 5 feet, so those would be at 3 feet, maybe.
Oh, the vertical one's way over there?
Uh-huh.
Oh,
No discussion on raising those?
no discussion, no.
None?
No.
Okay, thank you.
Mr. Friedman.
Thank you. Going back to the, thank you for clarifying that it's not an ADU. One of my questions is that if this project weren't approved, does that lot have the ability to put in an ADU under the new state regulations?
So I might yield to Ms. Ostringer, but yes, I can say that they are able to apply for a building permit if they want to look for a new ADU.
Ms. Ostringer?
Mayor Murillo, Councilmember Friedman. Yes, as long as they meet it, I think the new standard is it's half the size. If it's attached, it's half the size of the main resident. If it's detached, it's, I want to say, up to 1,200 square feet.
Ms. Brooke has an answer.
Yeah, Ms. Brooke just made the point. They could also do a junior accessory dwelling unit inside an accessory dwelling unit. So you could technically you could have 3 residences on the property. You could have your main residence, your accessory dwelling unit, assuming you can meet your setbacks, and then your junior accessory dwelling unit within that.
So they could, if this project doesn't go, then there is the possibility they could come back with a new project that could get 2 additional residences, a ADU and a junior ADU? I just want to make sure I understand that.
Yeah, if they can meet the setbacks and the zoning requirements, yes, then it would be a ministerial approval.
Okay. That's good information to have. And then going to the occupancy issue for the affordable unit. I asked this question yesterday, but I want to ask it in public. Is there any restrictions on the owner occupying the affordable unit?
Through you, Madam Mayor, Councilor Friedman. So it would be a deed restricted affordable unit. It's a rental unit, I should say. I know that the owner's family member, if they meet the affordability requirements, then they would be able to rent it out. The city only would place a maximum rental amount, but you could charge less than that. But the owner or whoever rents it would not be able to have their name on as part owner of the deed. So if that makes sense.
So the owner couldn't use it then, but and there's also income restrictions on it too as
Correct, and that would be an annual information that they would have to provide. And when this affordability covenant is drafted, it would be during the building permit process. So like any other affordable unit in the city, people are required to submit information on an annual basis to make sure that they're in compliance with the affordability requirements.
And through that covenant is how the enforcement on it would be, we'd have the enforcement on it. If there was a violation through those, that would tell us the procedures for enforcement. How would it get enforced if there was a violation of it?
Mayor Murillo, Councilmember Friedman, so the affordability covenant would be recorded with the property and it'll run with the land. And then the city, our housing department would monitor that. With regards to any other code enforcement violation, it would depend where it's coming from. If it was a zoning enforcement issue, it would come out of zoning. If it was related to unpermitted construction, it would probably come from the building and safety, but it would be a zoning enforcement issue.
The other question that came up is maybe you mentioned it in the presentation, but I didn't catch it, is the issue of backing out onto APS. Can you talk to that with the turnaround? I'm at the site visit yesterday. There's a turnaround because that's a safety issue that I'm concerned about, is any backing up onto APS.
Through you, Madam Mayor. So this is the site plan. This is the new driveway that's proposed off of APS, where you pull in head first, go into the garage, and then you would be able to back out and then pull out forward onto APS. Katie Mimulski is an associate planner in transportation. She can tell you a little bit more about transportation's review of this project.
Please do. Thanks.
Thank you, Madam Mayor and Councilmember Friedman. The city's transportation staff reviewed the project with the city's principal traffic engineer, and he did not have concerns about backing onto the drive or from the driveway onto APS. Transportation staff recommended the turnaround on site for motorists that would be uncomfortable. So that's why you have the turnaround provided on site.
Thank you. And just two more questions. One, there was some emails that said story poles weren't ever produced for this, but I just want to clarify, was there ever story poles used on this project?
Through you, Madam Mayor, Councilor Friedman, no, the ABR has the ability to request story poles, and they did not do that for this project.
So there's no story poles ever used?
That's correct.
Okay, thank you. And then the last one I have, it's actually during the presentation. On the previous project, the access was proposed on the south elevation, so there would have been a driveway adjacent to the neighboring property owner to the south, if I'm understanding correctly, whereas this project, it's on APS and there's no direct neighbor above them. I just want to understand that point.
Madam Mayor, Councilor Friedman. So yes, I think initially, and I'm not 100% familiar with the project, but they were trying to propose a driveway here, but there are some building elements with the existing residents that made it a tight squeeze, and I think that there are lots of questions about the ability to actually construct that plan, and this is a new architect that the owner is working with for this particular project.
Okay, thank you.
But there is two driveways, right? One coming from CODA and one coming from APS.
For this, yes, Madam Mayor, for this particular project, yes.
Okay. Ms. Sneddon, and then we'll go to the appellant.
Thank you, Madam Mayor. Just a follow-up question. I'm not sure. I'm having a hard time counting the votes and figuring out, so there are the 3 pages in attachment 3 of the votes, and I don't know without the front page there, so there's an action, it's 6 and more, and then the vote is 4-0, and there are 3 people absent that day, and then the next time it comes up, some of those same people are absent again, somebody else abstains. I'm curious about that. So then you still just have a 3-1-1 vote, so it's not a full, how many people would, I mean, a quorum, I'm assuming, is 4. I'm just trying to get an idea of how overwhelming the support was or underwhelming. And then on the third time, it's Cunningham 6, 4-2-0, and I see who's opposed, but I don't know who the other pro votes are. If you could help me with that. I see who made the motion, and I see who's opposed, but who are the other 2 positive votes? Just because it's not, I don't know how to read that.
Through you, Madam Mayor. So yes, there were, over the course of the project, this is ABR is a voluntary board, everyone tries to show up. And so there were some people, some people were there for some of them and kind of mixed in. But with the first 2 hearings, there was support that was mentioned in the minutes for this project. In the third hearing, when the project received project design approval, it was a 4-2 vote in favor of supporting the project compatibility criteria. 1 board member opposed the project with this specific statement, saying that it was inappropriate to say that the general comments given during concept review are binding and can't be revisited. What that means is, again, in those first 2 concept hearings, there's no decision that's made, but they provided supportive comments because the applicant still had to go get their land use approval at the staff hearing officer. So they provided those support. The majority of the board provided supported comments in that second hearing. There was still, I think, one board member who was not supportive at that time. And then again, in the last vote, the actual approval, the project design approval, it was a 4-2 vote.
Thank you. And then could you tell me who the two, I see the 4-2, I see the 2 opposed and the 2 who made the motion. Who are the other 2 in support?
So
on the
there's-
last final.
So for the opposed, it was Board Member Watkins and Olson. And then the other board members that was in support, it was Mr. Six, Mr. Moore, Cunningham, and then Mr. Cunningham was the one to make the motion. And then I'm just blanking on the last gentleman's name. No, I think I mentioned you.
Well, if you can have that answer for us by the time we vote, that would be
I'm
great.
just trying to add them up and seeing that somebody abstained one time and another time, and I can't get them to add up quite. Okay.
Mayor Murillo and council members Dunn, I can't say no one abstained on this one. It was all members that were present voted on that day.
And do we know who the members are who were present?
So forgive me, it
I'm
was
sorry.
Board Member Inswa.
And that's someone who abstained previously.
Right. I think that, through you, Madam Mayor, I think if I remember correctly, I think that he wasn't present for the first one, so he didn't participate in one of the votes. So that's why oftentimes when people abstain, that's the reason, because they need to either watch the video, the full video, in order to be present and be able to make an informed decision on the matter.
Thank you. That answers my question.
Okay, we're good for now. Ms. Valente, come on up, and you have 20 minutes. And if we interrupt you and ask you a question, I stop the clock. So,
Before I begin, could I address?
is that where we are? We are at appellant, right? Yeah. Well, come up to the mic, because we can't hear you if you're not at the mic. Yeah.
Does this count against my time? If I ask a question that's not part of my presentation?
This mic, and go ahead and ask it. Go
Okay.
ahead.
I wanted to clarify that when I emailed the city council, I was told by the city clerk's office that I could email city council. And so I always copied the city clear's office as well, and I don't know how to subtract.
I wouldn't worry about it at this point.
Michael Jordan's name from the list.
That's
It's
fine.
just one link. When I emailed city council, I wasn't doing anything improper.
We're here. We're happy to hear you.
Okay, great. Thank you.
Thanks. Yeah.
I'm going to have to really rush through this, so do I start?
As soon as you
Okay.
start talking, I hit the thingy.
Okay, Madam Mayor, council members. I am here to appeal the ABR decision regarding 601 APS and have requested a de novo hearing. This project would double the size of the existing structure to about 4,000 square feet and add a 3-story element. The proposed design is not compatible with the existing homes. I support multi-generational living and understand that the owners want to create a nice home for their daughter, but this could be accomplished without all the negative impacts. I'm asking that the zoning modification issued by the staff hearing officer be rescinded, and instead an accessory dwelling unit be considered. There are more requests in today's handouts. I have a lot of handouts, including that binder. I'm not the only one who supports an ADU.
An accessory dwelling unit permit application, which could have avoided a number of the complications that you have experienced, and you certainly wouldn't be going through 9+ hearings, discretionary public hearings before the ABR if you had gone that route.
The ABR failed to follow guidelines and procedures. The project does not meet compatibility criteria, and transportation and circulation elements are not being followed. We feel a sense of unfairness that the ABR didn't follow its own rules in making their decisions, We believe that this is due, in part, to the fact that the owner hired the former chair, ABR Chair Kurt Gradine. Sorry, I have a coughed up. I feel that opposition to this project was discouraged from the beginning. Board members and staff seemed reluctant to criticize the project, and discussion was stifled.
No, we don't need an open yard mod.
They don't need an open yard mod. So last I heard that there was still discussion, but sounds like they don't.
Yeah.
You could introduce yourself.
Thank you, Mr. Chair. Kirk Gradine, architect for the owner.
Welcome.
Thanks. It's nice to be here. Thanks for spending your evening.
Here's the ABR vote that led to where we are today.
All in favor? Aye. Let's raise your hands. 4 opposed. Motion carries.
Can I state my opposition why?
Yes.
Well, we have objections to this project and process and have plenty to back them up. The size of the addition is too big for the sloped lot. Planning analyst Ellen Kokinda explains that they need a modification to zoning called a lot area modification.
The lot size and then the slope. This particular parcel has an average slope of 23.7%, and based on that topography is just limited to one residential unit. With a slope of between 20 and 30%, the lot would need to be 14,000 square feet to be able to propose a second unit that would conform to the zoning ordinance.
The required lot size is almost double what they have.
Basically, you're trying to overbuild the lot. I don't really think this is an acceptable project.
We are concerned about overbuilding here. This is a high-profile corner on a busy intersection. Commissioner Schwartz?
Not sure why you've been as insistent and as persistent as you have with this design and this scale, given the exposure of this property to everyone walking, driving by, and your neighbors.
The height, the 3-story element, imposes on others.
The third floor. I feel like this just looms over the property next door.
And they've refused to provide story poles. Story poles were requested numerous times. Why did ABR ignore this request?
Well, then us up the hill, it'd be nice to see the story poles and see if that helps. Just a suggestion.
Exactly how it will affect the rest of us that are around there. And I'm really asking for story poles so that we can really figure it out. Is that okay with you guys? I wish you would do it.
So I just want to echo the request for story poles. It's, I could read the set of plans. This one I'm having a very hard time envisioning.
The way the old and the new are put together. Here, Board Member Insua analyzes the blending.
This project is, for me, is struggling with sort of like a demarcation line. Try to blend in the massing of my new construction with the massing of the existing construction, and to try to make it as if it was a seamless design.
Hillside Design Guidelines recommend stepping back upper levels to blend in rather than stick out. Board Member Insua tries to explain.
But I would have tried to be able to then piggyback, if you would, shift massing where then you were able to then set portions back.
Traffic safety. Backing onto APS is strongly discouraged and impossible to prevent. Allowing a new driveway cut into APS is a really bad idea, and it's contrary to the circulation elements, as well as the pedestrian master plan, which states the number of driveways accessing public rights of way should be limited to 1 per parcel to minimize vehicle access conflicts with pedestrians, bikes, and other vehicles.
I'm really concerned about the safety of this driveway. In order to exit safely onto APS, driver is going to have to back up here and then go up essentially blindly. I wouldn't want to live there and have to negotiate that driveway.
Lack of consideration. The owners already have an ocean view, but they want a 3rd-story view at the expense of their neighbors' privacy, livability, and views. Why is there an open deck on the 3rd floor? These areas look into neighbors on all sides. The architect was asked to create photo simulations to show what would be visible to the neighbors. He used 20-foot adjustable poles with 4-foot markings.
We didn't go all the way to the roof because difficulty and danger of having a pole that high, but by putting those ribbons at 4 feet, first pole was at this corner, it was 20 foot tall. Because I had that 4-foot dimension in the photograph, I scaled the photograph, divide this by 4, and I know how to add an additional foot to get me to the top of railing right here.
I also took a photo from my backyard with my cell phone. I could see the orange markings and got an idea of how tall the building would look from my yard. The tower is 30 feet tall. This is what I'd be looking at. History of unpermitted work. Here, Ellen explains.
The history of unpermitted work, that based on the repeated unpermitted work and then signatures of the zoning compliance declarations which aren't followed, and then having concern for more opportunities for that to.
The architect admits their intention of using the new garage as living space.
Kurt, why is there such extensive windows in the back of the garage?
They do use the garage at times for family gatherings. They want to be able to enjoy the view from there when they do use it on that occasion.
It's just begging for another havable space in my mind. But
Anything other than parking it can be subject to zoning enforcement.
Okay.
This creates privacy and enforcement issues.
Again, I think in a garage, you only need light, you don't need view. So I think those windows should be changed. The sill heights are 5 feet above floor level.
The arrangement of living spaces in this proposal seems to invite further illegal conversion up to 5 units if past behavior is an indicator of future behavior. Landscaping does not address our privacy concerns. This is how trees are maintained by this owner. History of unpermitted work. To fully understand our concerns, it's important to understand the history of this property. The Twassons bought this home in 1994, 8 months before we bought ours. Construction has been done without permits and permitted after the fact, or not, as built or non-conforming. The applicant seems to gain sympathy by presenting as a family struggling to make ends meet. However, public records show that the Twassons own a lot of property here and elsewhere. Owning a lot of property is no crime. It just means they can't play the struggling to make ends meet card.
It's about the car fixing. That's not me. That's my neighbor. And yes, at one time the property was rented out. When my daughter went to college, we bought another property in town, and so I had to rent that out. I was, at that time, single earner. So you do what you can to make ends meet.
In 1994, they excavated under the house and created the unpermitted dwelling in the back. They tried to get the work permitted, but were cited. After signing a compliance declaration, a legal document, they simply reinstalled. The unpermitted dwelling keeps coming back. It's been there for 25 years. In 2001, 601 APS was rented to a college fraternity or something, including this man, who wrote a letter in support of this development. He's their daughter's friend. This is in the agenda packet. According to the Ventura Star and public records, they maintain substandard rentals in Oxnard for farm workers. Tenants had no potable water and were afraid to report them. Citations haven't been taken care of. I don't know why the owners don't fix their properties. They seem to have the financial means to do so. So, to get around the zoning ordinance, they made a deal with the city. Designate the unit affordable, and in exchange, the staff hearing officer would modify the zoning ordinance for them.
The only way the staff could get to support is if there was an affordable unit, if affordability was kind of approved with this project.
Equally outrageous is that the new unit is 3 stories high and intended for the owner's family. There was a different project proposed in 2014. The building had a giant tower entryway, but less square footage than the current design. They went through 9 ABR, 2 show hearings, and the Planning Commission. Board member Witosh questioned such a lavish dwelling as meeting the intent of the affordability designation.
A lot of what's proposed is not under really the intent of the affordable unit, alternate unit density plan. So I find that a 1-story tower volume, 2 floors for an affordable unit, and a 3-level stair is just overwhelming. And that is what is contributing to the size, bulk, and scale.
How does this benefit the city? In October 2018, they applied for an ADU. The neighbors had no opposition. However, in May, the owner hired the former ABR chair and submitted this project. The square footage is greater than it's ever been. Failures in process. There have been failures in the process from the start. I don't know where the applicant got the idea to pursue 3 stories or why nobody told them otherwise. Fast forward to the first concept review. Each agenda item must provide notice to the public regarding items that legally require such notice. For example, the lot area modification needed by 601. To not provide such notice would be a Brown Act violation. I don't see it here. The concept review is supposed to be an informal review process where no formal action is taken. An example of a formal action is making project compatibility findings. Project compatibility findings are supposed to be made at project design approval at the end, not the beginning of the concept review phase. For example, appropriate mass, bulk, and scale. When a project is at this stage, it needs to be noticed so the public's aware, otherwise it's a Brown Act violation. This meeting wasn't properly noticed for this or discussion of the lot area modification. At the very first informal concept review, nothing positive had been said about mass, bulk, and scale. When out of the blue, Board Member 6 made this finding.
Okay. We need a motion.
Most board members find the mass, bulk, and scale and arrangement of the site plan and the parks to be acceptable. The main issue.
Please keep
I'm sorry, yeah.
We need to have the audience quiet.
Not only was this move illegal, but it made it difficult to object to this project. Its biggest problem is its massiveness. It's understandable that there would be public outrage. The assistant attorney was in attendance. The oversight was pointed out and nothing's been done. At the next ABR, June 3rd, here's the agenda item. Project requires a minor zoning exemption for overheight wall. What about the lot area modification? Board Member 6 retracted his finding.
I didn't intend my comments of on the 20th to be anywhere near as a finding. It was a feeling because we weren't making any PDA at the time. It still remains as a non-hard feeling about the mass, bulk, and scale.
However, the finding regarding mass, bulk, and scale remained in the meeting minutes. Next, the applicant needed positive comments from ABR to take to the staff hearing officer for the lot area mod. Comments should be limited to aesthetic issues. They are not interchangeable with other comments. Herein lies another failure. The show addressed the size of the project, the history of unpermitted work, and offered alternate project ideas. The affordable unit was discussed.
And the recommendation there of having the new unit being designated the affordable, if one of these 2 units has to be designated as affordable, we'd rather have it be the existing house because it's older, it's very dilapidated.
The lot area mod was granted. So back to ABR, now at the PDA level. It's December 2nd. The architect is anxious to receive PDA during this meeting, but there are some issues to address. According to the ABR guidelines and procedures, he needs an exterior site lighting plan, Section 6, energy efficient data, Section 7, roofing materials, Section 8.
We're hoping to get PDA, so I just wanted to show you what we're proposing for exterior lighting. Can I do that?
We cannot do that if it was not submitted.
That is correct, Mr. Chair.
With a PVC roof. Do you know if you could get away with terracotta color PVC version? You don't know what your energy calculations are going to be, but.
Right. You know, I
Discussion regarding project design and requests to make changes are open until the time PDA is given.
From this elevation, the three-story addition, it just kind of reads as a big tanker.
I feel like this just looms over the property next door. I would like to see an attempt to, reduce that mass.
Piggyback, if you would, shift massing where then you were able to then set portions back.
The architect doesn't concur.
We're already given positive comments to go on to the staff hearing officer. And despite one architect's concern about setting the third floor back, with comments, right? We had 2 comments. This is a reversal. This is a reversal. If we're going in this direction, you're not going to find a way to reduce the mass, bulk, and scale on this unless you reduce square footage. You want to set it back? We're at the 20-foot setback at the front. We can't move it towards the street.
Let's stop.
Okay.
Apparently, to pacify the architect, Chair Moore shuts down discussion by saying that the mass, bulk, and scale had been decided in June. Oops. This is a video.
I understand that some board members feel that the project hasn't received project design approval, therefore it's still a little bit open to that consideration, but the motion previously was that the board is supportive of the mass, bulk, and scale of the project as proposed.
They talked about lot area modification. It was never noticed. They talked about mass, bulk, and scale. No formal decision was supposed to be made. They did compatibility findings. How could they do compatibility findings when they shouldn't have been discussing it? No formal action was supposed to be taken. Nothing was noticed properly. Then at PDA, they say mass, bulk, and scale had already been decided, and they couldn't talk about it. If the applicant had pursued their ADU application, a new home would have been built by now. Not only did the Planning Commission recommend this route, but it was also recommended by the show. This route would have solved the problems listed above. If the current proposal is allowed to proceed, the city would be creating a public nuisance. The ongoing problem would only get bigger.
Can I state my opposition why?
Yes, please.
I just want to state that this board, the process is usually 3 hearings. It's conceptual, PDA, and final, so I think it's inappropriate for an applicant or the board members to state that general comments given that were positive during conceptual are the same as comments given during PDA.
I concur with that opinion.
Thank you.
Okay.
Thank you. Wow.
You have a whole minute left.
I must have been talking fast.
Okay. Are there questions for Ms. Valente? I don't see any lights, so thank you. We'll save you a minute. And Mr. Gradine, whenever you're ready.
Can I use this microphone? Sure. Okay.
Yes, either one.
Is that going to work? Can you hear me?
Yes.
Oh, great, thank you. Madam Mayor, council members, Kirk Rudine, architect for the project. That was a very impressive presentation. I've never seen anything quite like it. But it was not factual. And I think I can explain it pretty well here. I'm not going to try and address all those points. There was too many. I'm just going to go ahead and tell you why I believe this project meets compatibility requirements for the ABR, went through the proper process, went through a very lengthy process, and that this is an appropriate development for this site. So the existing neighborhood is a mix of single-family homes and duplexes that are of 1, 2, predominantly 2 and 3-story homes. Lots immediately adjacent to the west at 615 APS and to the east at 535 APS are both lots very similar in size and are both duplexes and also have the same slope conditions that we do. So in that sense, we are compatible with our immediate neighbors in the fact that we're not meeting the slope requirements, but we're creating a duplex. 3-story houses or portions of houses in the area. So there's the claim that somehow the 3rd story was out of character with the neighborhood. Directly across the street on APS, of course, there's dozens of 3-story houses, and we'll look at them in more detail. Immediately adjacent, the building, the property that's a duplex that I just mentioned at 535 APS. Let's see if right here is 3-story, straight up, which you'll see, and the appellant's own house is a 3-story house. And in fact, her 3rd story is bigger than the one that we're proposing. We have a 520 square foot 3rd floor area, which is very small, and you can see just by the footprint being shown here that in relation to other 3-story buildings nearby, it's a small 3rd story footprint. This is an accurate representation of the before and after. One of the questions that came up during the site visit yesterday was the relationship to the height of this existing tree. This tree is going to come out, and we're going to plant a new street tree in this area. But I left it in because so that you could see the relationship of the height. The addition is very modest. It's a 20-foot wide face at the tallest point, and then it steps down. This is, I think, 13 feet wide here, and then it meets the existing house. Follows the character of the existing architecture, which is a very traditional style for Santa Barbara. And to me, in my view, steps up with the hillside as is part of the hillside design requirements, and is very traditional style, very common to Santa Barbara. You're familiar with the front of the Coda Street side of the house. And by the way, one of the reasons that the house is in a dilapidated condition is because they've been expecting construction to begin. And part of our proposal, it's been over a number of years, actually. Since 2014, they've been working on plans, which I'll mention in a minute. But part of the proposal is to replace all the windows with new windows and to paint the house, paint all parts of the existing house. But this photograph shows the relationship to the 3-story house immediately across the street, which really from the street is more like a 4 or 5-story house because of its elevation off the street. Here's a closer look at that house at 602, directly across from us. And even though you would call this a 1-story house, it's a story and a half at least from the street level. And I'm just going to start, making you aware of, if you aren't already, that the south-facing view on this hillside is the ocean view. And almost every house has south-facing windows. And besides it being the best view window, it's also, in terms of having an energy efficient house, it's the best side to have your windows on, your large windows. Because, why? Because in the winter, when the sun is low on the south side, it draws the sun in. In the summer, when the sun is more overhead, if you have a shade structure on that side, you're protected. So you decrease your heat gain during the summer, and you increase it to the interior of the house during the winter. It's a fundamental passive solar way of having an energy efficient house. Right adjacent to, actually this is, yes, immediately adjacent. So here on the right is 602. This is 606. Again, 3-story house, but it's actually more than 3 because this is like 11 or 12 feet to the first floor level from the street level. And adjacent to that of the street, 610, another 3-story house with, as you see, big decks facing the south side. This is the side you want to have a deck on if you're going to have a deck. And then going in the other direction, east down APS, again, this, you can call it a 2-story house, but look at the massing. 3, at least 3. Same next door to it because of its height off the street. And this is at 535. This is directly across Coda Street from us. This is a duplex, 3-story. On the other side at 615 APS, this is the other duplex. Now this house is set down from the street, but it looks directly into my client's yard, right? So here's another case where this is really the pattern of development in the neighborhood. Because the lots are small, because the hillside is so steep, if you have more than a 1-story house, you're going to be looking into your neighbor's yard. I'm sorry, but that's the existing situation. This is the immediate neighbor to the south. And this is the appellant's house. So garage with 1 story above, but there's the 3rd story. And the appellant does not want us to have south-facing windows on the 3rd floor, but she has south-facing windows on the 3rd floor. And she has a lot of south-facing windows at the 2nd floor level. So I don't understand how it's okay for her to do it and it's not okay for us to do it. Here's another view from Coda Street on the sidewalk, looking up to the hillside and the 3rd floor element of the appellant's house. And as you can see in the house down below it, there it goes. As I said, it's a condition of this neighborhood where you have a steep hillside and you want to have south-facing windows. And not only do the appellant's south-facing windows face into her neighbor's yard, but this is standing on the deck. As you saw a photograph of me earlier taking this photograph, you don't have to go up to the 3rd floor to look into your neighbor's yard. This is on the deck at the 2nd floor level, looking into her neighbor's yard. So we're going to go to the ABR, the show, the PC history, which no one has mentioned yet. This project, prior to us getting involved, had a long history. This was the site plan for the previous development with the driveway along the south side of the property. It was larger than, it was more square footage than what we're proposing. It had a much bigger massing than what we're proposing. It had 3 modifications that were being requested: a lot area mod, an open yard reduction, and encroachment in the front yard setback. And it was approved with 2 of the mods by the show, by the staff hearing officer. And because the show didn't approve one of the modifications, they appealed it to the PC, the architect did. And the PC approved this project with two of the mods and made a concession. This is a 3-story tower right here, 3-story tower entrance that encroaches on the front yard setback. The other mod in the front yard was they were adding a roof to the existing house that because this portion is already in the setback, was going to create a further encroachment in that front yard. PC said, no, you can't put that roof there, but you can put that 3-story tower there. It's okay. So, and what did it look like? It looked like this. this is a 3-story tower because you can't see the garage buried down below it. And as you can see, this is the parapet height of the existing house. So they were raising the height of the existing house, creating a deck over portions of it, and then a 3-story new residence. This deck actually was part of this residence. And here's the south-facing side. Garage below, and then 2 stories above. Problem was, the architect did not design a slope into the driveway. So what did that mean? It meant that there was no drainage for this whole area. All the water that would come down this hill, as you know, it's steeply sloping, it couldn't make it out to the street. It was all going to get caught back here. And if you raise the garage level up high enough to get this long slope out, you end up exceeding the height limit. You go over the 30-foot height limit. So it was unbuildable in that sense. And that's when I got involved in the project. So you know, the owner handed me the drawings from the previous architect and said, you know, I know there's problems with this, can you make it work? And I studied it, and I couldn't make it work. And so we came up with this very unusual solution, which was a driveway off of APS, an additional driveway, with the car at the parking at the second level, bedrooms below, living areas above. And we went through several reviews with traffic about this to make sure it was kosher with them. Was it going to be safe? Of course. We don't want people backing out onto APS. From the beginning, we were proposing to back out. And also lowering the wall here and making sure that this was a very comfortable back out turn. What was driving the location of all of this was a whole number of things. We are within inches of various limitations. One of them is the open yard area, which was, we're not asking for a mod for an open yard. We didn't want to ask for a mod. And so the west side of the garage is right at the limitation for the mod yard. We're also right at the setbacks for the front and the setbacks along the downhill side. So this is all the problems that it solved. Solved the drainage problem, retains the hedge and the buffer between the properties, because that was one of the other problems with putting the driveway along the side, is you're going to have to take down that hedge. That hedge is not on the neighbor's property, it's on her property. So you put a driveway there and the hedge is gone. And there was also building elements. There's a masonry fireplace that's in the way that you would have to tear out in order to make it work. It reduces the square footage that's needed for the program. So we're not more square footage. We've reduced it by 365. We reduced the scale and massing, which I'll show you in a minute. Reduced the number of modifications. We only needed one. Matches existing architecture and increases the yard areas left open to landscaping and patio. So this is a section that shows how we're tucked in here. And by the way, the garage level is not right at APS. This is part of the strategy. We had to get this down. The driveway slopes down and is put as low as possible in order to meet our height limitation. So there was one slide that was shown that said, oh, here's what a 30-foot story pole looks like. She probably was measuring, I don't know how she got that, but there is no part of the building that you can measure from existing grade and go up 30 feet and say that's the height of the building. That does not occur with this design. This 30-foot height limit is in relation to the existing garage where it meets the driveway on Coda Street, because that's the way the ordinance reads and how you determine height limitation. So anyway, part of this was, again, the main point of this was the strategy, how we're squeezed in. We're squeezed in between the height limit and we're digging in down below. We're lowering the grade down below in order to get the bedrooms in down below. So here's the elevation page, which now you've seen too many times probably. But here's the relationship between what the Planning Commission had approved and what we're proposing. So the pink shaded area was the previous proposal. It was longer, it was taller, it extended over the existing, and if I had drawn it in, it had a higher roof in this section as well. From APS, this shows the difference between what we're proposing and what was approved by Show and PC. This was the first ABR submittal where we showed the relationship of the two, which has changed now. So they asked us to do a number of things. We went through further in the process. One was, as was mentioned, to solidify the balcony so that, again, to provide privacy. And we also had this little corner right here was a projecting balcony towards the neighbors. So we pushed this back 5 feet right here, this corner, and reduced some of the window sizes. And then when we went through Show, we reduced the height further. So this shows not only the 20-inch reduction that we made after coming back to Show, we came back to ABR. We brought the whole building down 20 inches. We also brought the window height and the floor height of the third floor down a foot, and we reduced window areas further. So all of these red lines show where it was, and the drawing shows where we are now. There were story poles, and they were very carefully done and carefully placed. I've been in business for 35 years. I've done probably 24 projects with story poles. We didn't do it the way the city exactly specifies, but it was very accurately done. This was submitted to the ABR by the appellant, saying this is what the project was going to look like from her deck. And this is one of the reasons that we did the story pole effort, was because I knew that that was not accurate, and I wanted a way to represent it accurately. So we did it with 2 poles, one at the front edge of the balcony and one at the back corner, which is actually the closest corner to APS, the closest and tallest corner of the project to APS. The point of the flags was that with a photograph from this angle, you know what 4 feet is. You have flags. I had a flag at the top and 4 feet down, which I measured myself and placed the flag on it. You have 4 feet. Now you have a way to scale your drawing to show what, at this distance, what it's really, how big it's actually going to be. This is an accurate representation of how big that house is going to look from this angle. So I did from two spots. I did it from this location, which is on the deck, and then out in her yard. So here again, this is a little bit taller photograph, so you maybe can see it a little better. The 2 poles are indicated there. I made them in red so that you could see it a little better. They were hard to see in the photograph, but they could be seen. And here's an accurate representation of what that is going to look like once it's built. And I just want to mention that a number of those clips that were shown that were Planning Commission, that was when the architect appealed his project that, one of those mods that didn't get approved at the show, he appealed it to Planning Commission himself. And that's when he got scolded by the planning commissioners, saying, this is out of scale. They were not talking about our project, they were talking about his project. And a number of those ABR clips, the very last one you saw, Howard Wishtosh, that was not talking about this proposal, that was a previous one. To me, that was very disingenuous to selectively take parts of the conversation from ABR, which is very wide-ranging, and where you get different opinions expressed, and you get people changing their opinions from one meeting to the next. So it misrepresented the process. We've been very upfront about everything. There's been no manipulation behind the scenes, somehow suggesting that because I was a former person on the board that somehow I was being given, special consideration or something. No, those guys are harder on previous architects. That's my experience so far anyway. They seem to be tougher on the old geezers than the young guys. But anyway, so this...
You have 10 seconds.
All right. I think I'll stop. Thank you.
Okay, I didn't mean to break your rhythm, I just.
That's all
wanted-
right, I needed it to
I
be
just wanted to
broken.
tell you, okay. So are there questions for the applicant's representative, Mr. Gradine, Mr. Jordan?
Mr. Gardine, could you solve my question on the windows on the south side?
Yes.
If the cut sheet that was up on the screen actually shows them with 5 feet sills, and then just my general question, so are those 3 windows all at a 5 feet sill as shown on there?
No, that we haven't changed the drawing yet.
So they'll come up a couple feet? Foot and a half?
Well, 5 feet. So the sill right now is about at 3, so 2 feet, yeah. They're going to be very small. They're going to be like this top, top bit.
Because you have no choice.
And-
You're going to have
right.
to reduce the size of the windows, right?
Right.
Yeah.
And it's these 3.
Yep.
And this one, actually, the landing in that stairway is down here. So it's already about 5 feet.
So it is.
In relation to the landing.
Okay.
Yeah.
All right, thank you.
Yep.
Ms. Sneddon, question?
Thank you, Madam Mayor. Can you talk about the affordability? Did it end up being
Yes.
the the older unit or the
Thank you.
newer unit?
Thank you for
And-
asking that question. I didn't realize the affordability issue was going to come up prior to the show hearing. And when I found out about it and discussed it with the owner, I made a verbal request to the planner, Ellen Kokinda, that the main house be designated as the affordable house because, as I mentioned, as you saw, a clip of me, the new house is going to be nicer. It just is because it's going to be a brand new building. And so the owner's wish is to have the existing house be designated as the affordable one. I mentioned that to Ellen before the hearing. I mentioned it during the show hearing, in the public hearing. And it got missed. It got missed. So instead of the main house being designated as part of the show approval, it's the new house. And I've had discussions with Ellen since then. I've told her that that's not the wish of the owner. She got back to me and said, oh, well, there's a process you got to go through to have it switched. So it's a substantial conformance process that we need to go through. But that's where we're headed with that.
And then you're still requesting a modification for lot area. Could you?
Yes,
Talk about that
we're
one.
not requesting it. We have received the modification for the lot area. So the way the ordinance reads is that if the slope exceeds a certain percentage, then the lot area has to be bigger in order to accommodate 2 units, right? And we don't meet the slope is quite steep on this site. We don't, it's not 28, I think it was mentioned 28. Oh, well, it's stated as 28, but the analysis I've done, it's somewhere between 20 and 25, something like that. But anyway, I think it's 18% is all it needs to be, and then we need a double lot size. So that was the whole, discussion and issue that was addressed as part of that staff hearing officer. That was what we were looking at. Is this appropriate for a second dwelling to be allowed, given that the lot area it doesn't accommodate it according to the ordinance? That's the modification. And one of the arguments I gave was, as you saw, right adjacent to us, there's 2 lots on either side, both of which are duplexes, both of which have the same slope issues. And so, what would be the logic of saying that we can't do what they have? And actually, if you go along APS, there are others that are like that as well. So that was part of the argument. We received the mod. It was approved by the staff hearing officer. That's not something we're requesting now. We have it. It's been approved.
In exchange for the affordability?
That
Or
was one of the conditions.
what were some other
and-
conditions?
That was it. I think that was the only one.
So
Ms.
the,
Kokinda, were there other conditions?
Yes, Madam Mayor, through you. So there are a number of conditions with the staff hearing officer approval of the second unit on this site. One would be the recorded conditions agreement. Again, it would be a written instrument, a deed restriction for affordability of that new unit. It talks a little bit about that. There would be a zoning compliance declaration required that the owner would sign, saying that, acknowledging that that there would be a maximum of 2 residential units unless they obtained other proper city permits to do something else. The lower level of the existing residence, so there's an unfinished area, like a subfloor space that is not to be converted to habitable space. Again, this is addressing some of the enforcement issues. There's the removal of the lower level laundry room. There was a laundry room that was added with a counter and sink without the proper permits, building permits, to remove that. And then let's see, there was, for the new residence, there's a half bath that is proposed on the garage level, and that was limited to a half bath because of the staff hearing officer's thinking was that if you could cut off one portion of the building and then have 2 residences, so she wanted to make sure that it's just a half bath at that second level. There were also some other landscape maintenance to try to make sure that new trees that are proposed to be installed, that there's some kind of accountability for making sure that they would be healthy and replaced if they didn't take. There's removal of stored items on site, and then just a standard archaeological resources contractor notification.
Thank you.
And
More questions?
Just a couple. So when you mentioned that the older house, the word you used was dilapidated.
Yes.
But then you're proposing that that wouldn't be the affordable one. Does that mean there aren't plans to make it not dilapidated, or?
No, the house needs improvements. And so, in fact, the ABR has asked about that, asked for improvements as well. But changing out the windows and painting the outside is not going to make the house new again. It's still, it has, the inside needs a lot of work. It's an older house. If you start to look at it closely, it's been there probably since the early 60s and been well used. So, no, my understanding, the last time I spoke to the owner about it, is they'd like the main house to be the affordable one.
And is the thinking that the older house already is an affordable unit? So if we're building a new unit that's going over the allotment, that would be the new affordable unit? I'm in agreement that it should be the new unit that should be affordable, but I'm wondering what our staff thinking.
Through you, Madam Mayor, Councilor Sneddon. So I don't know if I fully understand your question, but I can tell you that, again, the way that this project is conditioned, it's the new unit that the staff hearing officer approved to be affordable. As Mr. Godin has mentioned, he has been in conversation with me, and I've reviewed this with other staff members of what the process would be if they wanted the existing residence to be the affordable unit. According to Lucy Graham, who's our housing project planner, the existing unit wouldn't necessarily have to be up to today's building codes if that were to switch, but the affordability covenant does, we have specific standards in terms of making sure that the unit meets health and safety needs of any tenant who would occupy it. So that would be a part of the conversation. We wouldn't, it couldn't be a dilapidated home, if that makes sense.
And I'm in agreement. And which definition of affordable is this?
Through you, Madam Mayor. So this is the 80 to 120% area medium income.
And how does that work if it's a family member? I don't know if this one is or not, but just for affordability covenant,
So the owner is able to rent to anyone in the community who meets the affordability requirements and any other requirements that is written as part of that covenant. And if a family member, so long as that family member is not included on the title of the existing residence, and they meet those affordability requirements, then they would be able to rent to a family member. Again, the city caps it at a maximum rent, but the owner could charge less than what is, if they so wish.
Okay, and I just have two more quick questions. One, so this would be for a maximum of 2 living units. You couldn't later come back and make one of the garages a junior ADU and the other garage a junior ADU? Or would they be able to do that?
Mayor Murillo, Councilmember Sten, they could, if it met the zoning requirements, and the state allowed it through whatever the new state regulations are, yes, they could come back, but they have to go through the process. What the zoning compliance declarations that Ms. Kokenda was talking about, that I believe the staff hearing officer imposed on the project, was basically to put the property owner and any future property owner on notice that, hey, there may have been there were zoning violations on this. You now have been told, and it's recorded, and you've signed an agreement that says you understand that there's a process that you have to go through to build on this lot, and you need to comply with that. It's a tool we use as a city when a property owner, sometimes they say, well, I'm not a sophisticated property owner, I didn't know I couldn't do this. And then we have an agreement that says, well, yes, you did.
And then what about the current zoning violations? I don't understand why this isn't the trigger for fixing those.
It
Or
is.
It is.
Okay.
It is.
And then will there be 2 garages now and 2 different driveways on the 2 different corners?
Through you, Madam Mayor. Yes, Councilor Sneddon. So there are 2 there's the one existing driveway to the existing residence off of Coda Street, a new driveway that is proposed off of APS. So there would be 4 covered parking spaces on site for the 2 units, and that's as what's required by the zoning ordinance.
So it's a duplex with 2 separate units with different entrances, different garages, different laundry, everything in there.
And if I also might add that this particular permit will address all of the outstanding enforcement violations. So even though it's not in ABR's purview, the enforcement issues, this particular permit would address all of the existing violations on site.
Okay. And then I just want to give you the opportunity to respond, Mr. Gradine, that the other comparable properties that you were putting up are all oriented in that orthogonal direction to the lot that we're talking about, and they're uphill and across APS and south-facing windows, and the lot that you're on is a corner lot, and it's the hillside steeps a different way. So I don't think of those as comparable. If you want to speak to that.
Comparable in what sense?
Well, you said they were equivalent. You had the lot that we're talking about, and then you said across the street this way is 3 stories, and across the street this way is 3 stories, and they have the same slope that we're dealing with, and then you pointed out, you said dozens of houses on the other side of APS are 3 stories with south-facing windows, but they're all oriented lengthwise south-facing as opposed to your corner lot.
I see your point, I guess, but I'm not sure what the question is.
That I'm giving you an opportunity. That's how I'm seeing it, and that's my conclusion, that they're not comparable. So this is an opportunity to make a case differently.
Okay, so you're saying they're not comparable in terms of massing. To point to them as saying that these are 3-story houses in the neighborhood is not appropriate because they have different conditions. Is that what you're saying?
I guess I'll just keep my conclusion. Thank you.
Okay. Because I'm sorry, I don't understand.
It's okay.
Yeah.
Okay, very good. Mr. Friedman, questions for Mr. Gradine?
These are either for Mr. Gradine or staff. On the, if an ADU project was to be proposed, what level of review would there be at the ABR and for the neighbors to provide input into the some things in particular, size, mass, bulk, scale, those types of things. Would there be ABR reviews, or is it, I think you said it's ministerial?
You mean if this is approved and
No,
built?
if this one wasn't, and
Okay.
then they came back with an ADU project, what level of review would there be? Specifically in terms of ABR review?
Through you, Madam Mayor, Councilor Friedman. So there was an accessory dwelling unit proposed on this site between the previous PC project and this particular project. That was abandoned, or the owner decided to proceed with this particular project. It would just be a ministerial permit under state law for the accessory dwelling unit, and therefore would not be subject to design review or ABR review.
And would there be a possibility that that type of, I mean, it's speculative, but I'm just trying to understand the alternatives on the site, that it could have a third story? Or, never mind, that's kind of outside what we're talking about today, so never mind that question. That is all I have for right now.
Ms. Harmon.
Thank you, Madam Mayor. I think this is a question for staff. Is that appropriate?
Sure.
Okay, thank you. Councilmember Sneddon brought up questions about affordability, and I'm just trying to clarify for myself what we're considering here today. So the affordability covenant and the lot area modification, the time period for appeal on that has already expired. So that's not part of what we're considering today. Is that right? Or is that not?
Through you, Madam Mayor, yes, that is correct, Councilor Harmon. So the staff hearing officer, if you look at this slide, the purview of the staff hearing officer is to review the lot area modification request. Again, that's to add a second unit. That was approved with the conditions that I read out earlier, and with that approval, it was conditioned to have a 90-year affordability covenant that would be deed restricted. So even if the owner decided to sell it next year after it's built, that stays with the land. It doesn't stay with the owner. So that's all within the purview of the staff hearing officer, and that too had a 10-day appeal period, and that expired, and no one no one appealed the project.
Thank you, that's very helpful. So when ABR makes their decision about PDA, they are not deciding anything related to the lot area modification. That is outside of their purview, and our purview today is to look at their decision. Is that correct?
Madam Mayor, yes. Councilor Harmon, yes. And it's specifically the standard of review or the project compatibility criteria.
Thank you so much.
Okay, we'll go to public comment. BJ Denetra, you're first. Is Trudy Ramsey here? And you want to give her your 2 minutes? Okay, you have 5 minutes. If you can do it in less than that, we'd be grateful. Thanks.
Good evening, Madam Mayor and City Council. The wasted amount of time and money spent by neighbors and city workers on this project since 2014 is staggering. And I find myself constantly racking my brain trying to make sense of it all and make it better. The answer I've come up with is compromise. Each meeting, our neighbors diligently present research facts to the ABR to convince them that the design is too big for an affordable unit and not compatible with the neighborhood. The ABR listens and asks the architect, how can we pull back on the building so it isn't destroying backyard privacy issues and views and doesn't look too big for the lot? But the ongoing rebuttal from the architect is there isn't any room to pull back because of the parameters we need for the garage turnaround. So they shave 6 feet off the corner of a balcony and call that pulling back. Interestingly enough, no one ever says, let's try a new idea. Maybe without a garage and maybe just a driveway, we could get along. We never get to see new creative options. Why not? Because this is what the owner wants and we aren't budging is the attitude. So where's the compromise? It is interesting to note when the owner appealed the design to the City Planning Commission, they told the owner to compromise and perhaps build an ADU. This all made perfect sense, so you can imagine how blown away we all were when the architect and owners came back with a new design that was even larger than the unit that was initially proposed. Does this make any sense to you? It didn't to me or the neighbors, so here we are again at another appeal level with a new series of meetings, but the same debate points. Let me be clear, the neighbors do not oppose the building of an addition for the owner's daughter. What we do oppose is the fact that the lot is 7,500 square feet with a 23% slope, and normally, to build a unit, they would need 14,000 square feet, double what they have now. So as builders, what do? Well, they call it an affordable housing unit. And now the city will waive the lot size ruling, and now the owner can build a bigger unit on the lot than is actually allowed. Is this fair? Is this just? If the original city building rules were adhered to and not the affordable housing unit rules, we would not be discussing the mass bulk and scale and compatibility issues today, because the unit would be designed to fit the lot, period. So let's discuss the spirit of the Affordable Housing Act. This lot could still have an affordable unit on it, but can't we compromise and build 2 stories and forget the garage? We've been told that one lot can't have 2 driveways, yet that is exactly what we have. In the previous design, they had extended their existing driveway through to the backyard. Perhaps the compromise would be just have a single driveway with no garage. The garage was somewhat suspicious, as pointed out by the ABR, in that it had view windows and a bath looking like it might be heading for a 3rd granny flat type unit, since they're only allowed 2 units, for the zoning only allows them 2 units on that property. Let's look at what we are dealing with here. We are being told there are so many 3-story houses in the neighborhood. A precedent has been set, and that one more doesn't make any difference. To use precedents as an argument is very dangerous. If the design is correct for the lot, then a 3-story can be hidden. The couple of 3-story houses referred to in 601 zone on Cotter Street have done their homework, and they are designed into the side of the terrain, or at least don't stand out as, I am a 3-story building. The sad part is, once built, there's no going back. Besides the neighbors' concerns, we should also remember that the City Chamber of Commerce publishes a map that shows APS as a scenic driveway from the Mission. Tourists rent small transportation vehicles and take self-guided tours down APS. I wave to them all the time. If we allow more owners to build 3-story buildings on APS that block the only existing views from the street level, then APS will no longer have the historical charm and popularity. So can we shoot for a compromise? Could we see some alternative drawings and ideas? There is already a reinstall of an illegal ADU on this property. So already there are 2 units on the property, and that is all they are allowed to have. So one alternative may be to renovate and build out this illegal ADU for the daughter. You could still have your views at the 2-story level. Is this not sufficient for an affordable unit? It just doesn't seem fair that this 3-story affordable unit designed for a small family should outweigh the desires of not only all the surrounding neighbors, but the city's
Your
market.
time is up, ma'am.
Okay, great.
And we gave you extra, so thanks. Greg Baker is next.
Thank you.
Thanks. Followed by Yvonne Blanco, Edward Laflamme.
Hi, I'm Greg Baker, and my wife and I live down the street from this project, and we've been in opposition with the size of it. I don't want to go over all the other things, but I think you can see from some of the discourse here that it has been a problem project forever. And that may be because it is a tough lot. So I'm agreeing with BJ and, of course, Victoria in that there were guidelines established a long time ago as far as use of this lot. You know, basically it's 7,500 square feet, 25% slope, 20% slope, whatever. It's in the municipal codes how you can utilize that. That seems like a really intelligent way to approach building on this lot. I understand that the architect is working, you know, for the benefit of his client, and he appealed on the basis of affordability. He applied that to this lot in order to get an exception or a modification to the use of this lot based on previous historic guidelines. I think that's like a cynical use of affordability. I'm going to use that term because I think it is. I think originally, they had a large building designed. Then at some point, an ADU is discussed and it can be approved, and the neighbors are fully committed to letting that happen. But then all of a sudden, utilizing affordability, this became a 1,700 square foot addition again, which I think is inappropriate. And I think it sort of sets a bad precedent. And I think what I look to the city council to do is to sort of look at this as being a situation where many people have reasonable doubts about the appropriateness of this, and an owner wants to get what she wants to get. There is a middle ground here, and it seems like it's already been established in the past by guidelines for use of a lot like this. The affordability issue, to me, becomes kind of an abuse. It's like affordability, to me, has been used in the corridor concepts very effectively. 35 units or whatever the units are across from the Paradise, you know, they got the units they wanted. They're supposedly affordable. They were limited as far as parking. There's all kinds of considerations, you know, integrated into that. Municipal transportation, you know, being right downtown. This is in a R2 single-family residence area, which has, you know, done its share of affordable units there by doing a lot of ADUs. You walk around our neighborhood, there are ADUs, accessory dwelling units, going on everywhere. We're making the attempt in our area to make, you know, inroads into the need for affordable housing. To apply this affordability to this project, I really think is out of that character. It's cynical. That would
Okay.
be my perspective.
Very
And
good.
on your
Yvonne
note-
Blanco, your
Am I
time is
already-
up, sir.
Did I lose my time?
Yeah, you sure did, and I gave
Okay.
you extra because I hadn't set the timer. So, Ms. Blanco?
You needed to use the computer.
Yes, yes. Madam Mayor and City Council, thank you so much for staying late today. I appreciate you hearing us out. BJ is my next-door neighbor, and we have a direct site to this property. And so my husband and I have lived there almost 10 years now, and everything that's been said today, it's been beating a dead horse, but the problem with Mr. Gradine's argument is that our houses are not 3 stories, but they're set into the hillside. The houses above us lose no view. Trudy Ramsey is directly behind me, and she has a complete view. And in fact, I just trimmed down all my trees so that she could have a better view recently. So, you know, for them to want a 3-story on the downside, covering up, you know, APS's view, it's detrimental to what the American Riviera really is. So the 601 also, they currently have an ADU that they have eliminated in spite of many citations. They haven't eliminated it, but it's been there for about 25 years. And Mr. Gradine had mentioned earlier that he thought the dwelling, the current house, was about from 1960s. It's actually 1927, and it looks like it's from 1927 because they haven't done anything to it. So adding another unit would actually result in a triplex, and I have 2 short videos to show you.
Has had a history of the city calling it an IDU. The property owner may not envision it being an IDU, but it looks like, in terms of our zoning ordinance, it meets the definitions of it.
Private backyard area that the house currently has. And it's also where their trash is located. Don't put any doors down here. What if there's a fire right here? How do these folks get out? They have to climb out the window. If you want to make them go outside and empty their trash, I don't think those are good ideas.
So, in closing, I just want to say that, you know, the current dwelling, there are no improvements. We have to look out onto this white roof that has been pieced together over the last 10 years. I doubt very much that they're going to make much improvements to the existing dwelling. And also, one more try for story polls. Can we not get some story polls to see what this is actually going to be like? Thank you.
Edward Laflamme, and then Aaron Slavin is the final speaker.
Hi, folks. Madam Mayor, City Council, thank you, thank you, thank you. I'll be really fast because I'm tired as well. Mr. Jordan, you brought up a little while ago about what we're leaving our children and the legacy. And how about the legacy of APS? APS is the American Riviera. It is known around the world. People come to Santa Barbara to see the American Riviera. Now, if this project passes, it opens the door for people like me, who is a contractor, my neighbor, a contractor, my next door neighbor, owner builder. Why can't I start doing the same thing? Because your vote is going to change what the Riviera looks like. All us neighbors have had concerns about this project. In the very beginning, we have all asked for story poles. A single pole, like that flagpole on a property, does not give the scope and size of what it really looks like. If we wanted to be appeased, if you want to make us happy, put the things up, and you people wouldn't be coming around in caravans and by yourselves with blueprints and tailgate parties trying to see what this project looks like. Why can't we have story poles like every other construction site in Santa Barbara? Okay, today, the scope of this project has changed dramatically, okay? Now, Mr. Grandin, he was the chair of the ABR, and this project went in front of the ABR and was disapproved in the very beginning. It failed so many times, Mr. Grandin is no longer the chair of the ABR, but now the architect. Now, you know, friends in politics, we see this all the time, right? You can't tell me, and I shouldn't make assumptions, I will not say anything. I apologize for that, folks, I apologize. As for the affordable unit, they already have the illegal unit. It's already there. Why do they need to spend this much money to make an affordable unit? Okay, that unit's still there, they're making money. As for the house next door, the 535, the two-story with the double garage below, I was the building contractor on that project. That project, the garages were illegal dwelling units, and when the family purchased the home, I had to demolish those garage doors and the entire apartment, bathroom, shower, kitchen that was in that unit. I am not a fool. My other contracting friends aren't fools. This house is going to be turned into living spaces. I can't prove it, but I just seen it and I know it. And I'll be done.
Thank you.
You're welcome, right on time. Thank you, folks.
Mr. Slavin?
I'll be very brief. I don't have tons to add. Everyone's said everything already. I wanted to add to, thank you, Madam Mayor. I have the house at 601 across the street. Spent an ungodly amount of time rescuing a place that was in foreclosure for 7 years and still not done. I don't have real objections to what we're seeing from the APS side. In fact, I think my views are second story and won't be impacted much. My first story views will be impacted, and the views from APS will be impacted. It seems to be the crux of the matter is, I also wanted to speak to the architect and Councilwoman Snedden's objection to the scope of all of the other three-story buildings. I think that is a disingenuous argument, because ultimately all of those buildings they're up upon APS. None of them impact somebody's backyard. Same true for the CODA things that were represented. I think the crux of the matter seems to be, is it sensitive to the neighbors below, specifically to the appellant's property? That's something that you guys will have to decide. It seems like there are a lot of procedural mistakes. The only other thing I would say is that I would absolutely advocate for story poles. Isn't that just normal? I asked the same things. I did a little pre-viz myself in CAD so I could see what the impacts were to me. And it only seems logical if there are those kind of the dimension of questions from the public and perhaps from the council. I don't know about planning. It seems like a logical step, perhaps just to reconsider this rather than passing it at this juncture.
Okay.
Thanks.
We'll close public comment and ask Ms. Valente if she wants to do her final minute. You have 1 minute if you want to make closing remarks. Was that no? Oh, here she comes, okay.
Not exactly closing remarks. I just had a couple of things to ask. One of them is I requested a de novo hearing, which is, to my understanding, how city council appeals work. I read the city council meeting procedures, so my understanding was that this hearing was reviewing all of the decisions made on this project up to this point, not just the last one.
Keep going.
So I would like clarification on that. And, also my understanding is that an ADU is limited to 1,200 square feet. Could I receive some clarification on this? I've heard different numbers. So when I suggested that an ADU be considered for this property, I thought that it was, it would be something smaller, like 1,200 square feet max, which is pretty sizable in my opinion.
Okay, thanks. Thanks for your remarks. We'll go ahead and close. So this was a de novo hearing, if I'm correct on that. We've been talking an awful lot about the affordability issue, even though that wasn't an ABR, in the ABR purview. Mr. Kalan, go ahead.
De novo simply means that the matter that was appealed is being heard afresh here. It doesn't mean that everything in the past where the appeal period has run is now in front of the city council.
Okay, fine. Yeah, we've been through appeals before. So, and then as a courtesy, I'll ask about the 1,200 square feet, as the appellant seems to be asking about that.
Through you, Madam Mayor, I think that is correct under the current state accessory dwelling unit law that the maximum size unit is 1,200 square feet.
Mayor Murillo, council members, it depends whether it's attached or detached. So there's different varying things. It would depend what the property owner is going to propose. But yes, if detached, I believe
Okay.
it's 1,200.
I'm sorry, we can't. Okay, so we're to the city council now to make a decision on this question. And so we're asked to consider everything we've been presented today. Ms. Harmon, your light was on first, and then Mr. Friedman. So the decision is, do we concur with ABR or do we disagree with them? So go ahead, Ms. Harmon, you're first.
Thank you, Madam Mayor. I will try to keep my comments brief. First, and I'd like to respond to, and I appreciate all of the effort that you all put in, coming in and sharing your perspectives. And I hear the appellant and so many people that spoke that you would have preferred an ADU. Frankly, I myself wonder, why didn't this applicant do an ADU? That would have been much easier. But here's the point, that's really not relevant to our decision. If an applicant wants to go through the process to do something else and is willing to go through multiple hearings to get to an end result, that's their right to do so. So I appreciate that you have this suggested compromise, but if the applicant's willing to go through the process to get something else, then that's that, and that's really where we are. I also just want to follow up on the point about the lot area modification and the affordability. Again, I just seconding what our city attorney said, that is not up for discussion today. That is not within what I am considering on this appeal. The time to appeal that decision has already expired. And so truly, I appreciate the perspective you bring, that you don't like the use of affordability or that covenant or the lot area modification, but it is not playing into my decision today, and I don't think it's appropriate that it would, because that is not within the purview of what we're considering here. So I just wanted to make those comments to help explain my thinking. And I do believe that it's incumbent on us when we make these decisions at these quasi-judicial hearings to be very clear about the decision that we're making and the particular question that we're answering. Because if we take this opportunity to really broadly look into every decision rather than the specific decision in front of us, it undermines the process more generally. And I think that is a real risk, and that would be very detrimental to the systems that we've put in place to try to protect both the applicants and the folks that would want to appeal those decisions. So these systems are in place for a reason. So with that said, I am looking specifically at the granting of PDA, which we don't need to go through the criteria, but I think particularly relevant, obviously, is neighborhood compatibility and size, bulk, and scale. To me, I'm very swayed by the fact that we empower our design boards to make these decisions for us. And certainly, we are a check on that, but it's very important to me what they say on these boards, and that our ABR has found this compatibility and they are the experts is something that is certainly important to me. And I do believe that this project is compatible with the neighborhood, and it is in line, the scale, the size, the massing is in line with the other houses in the area. So with that said, I will be voting to deny the appeal.
Thank you. Mr. Friedman.
Thank you for those comments, and thank you to everyone who spoke today to provide some context. I'll also be denying the appeal, like my colleague. Just a few comments on it. I think Councilwoman Harmon articulated a lot of what I was thinking. But one issue that came up for me is there is a turnaround on the property. Originally, it had said that it was backing out onto APS, and that issue was raised, and and the fact that there is a turnout helps me make that finding because of the safety issues of backing out. I think there was that issue. It's been addressed. And then the other thing from tonight's hearing is that portion is not designated as a visual resource, if I am understanding the comments earlier from staff, whereas other parts of APS are. And that goes into the context of the visual resources for APS. And lastly, I just want to address the issue of a potential or alleged illegal dwelling unit there. It's not that I do believe you or not. That's outside of our purview of what we're able to consider tonight, because we can't make a decision for a project based on what we think somebody might do. We've had other projects in the past that have come up here with that very issue, and we can't base a decision on that. That's a slippery slope once you go down that. In terms of the garage, I think, again, that's not what the applicant proposed, but there is the thing that there's 4 spaces that are there, and so that's 4 spaces for the 2 units, which alleviates some of the off-street parking issues. In terms of just some of the findings, because I think we do, if Mr. Clun had some findings to base it on, so I'll reference the December 2nd, 2019 ABR meeting as part of their motion, and in particular, their findings A through F, that the project complies with the city charter, municipal code requirements, and the design is consistent with the design guidelines applicable to its location within the city. B, the design of the project is compatible with desired architectural qualities and characteristics of Santa Barbara and this neighborhood. C, the size, mass, bulk, and height and scale of the project are appropriate for its location and neighborhood. D, there are no adjacent landmarks or other nearby designated historic resources. E, the design of the project responds appropriately to established scenic public vistas. And F, the project includes an appropriate amount of open space and landscaping, although landscaping has been reduced. I don't have enough evidence to counter that, and from what I've seen, it does comply with that, so I'd like to include that. I'll hear my colleagues before there's a motion made, but if we go that route, those would be included as part of the findings for me.
Thank you. Mr. Jordan?
Thank you, Madam Mayor. I'll too side with the ABR and deny the appeal. The crux of this parcel is it's a parcel that has the alignment of above APS, but it's below APS. It's a sideways parcel that should be a sideways parcel above APS, but it's a sideways parcel down along the corner there where everybody else is facing Coda Street. And that's what's driving the issue. I have looked through all the compatibility considerations that ABR looks at. I can't disagree with any of those. I think you guys can disagree with some of them, but I think we're just going to have to agree to disagree. I think all the salient points that were made in the appeal letter have been addressed by staff's actions up till now, and I can't find fault with them. A couple items I would have for staff. I found this constantly in Planning Commission too, on multiple design board visits where 5 people were there, 7 people were there, 6 people were there, and you tried to rectify who were the consistent people through each one of those visits, as you heard Ms. Sneddon ask, and you can't figure it out because the names aren't there. And I think we'd struggle with that in Planning Commission too, on who was a constant no, who was a constant yes, because as people know here, those people work for a living, so they kind of come and go, and you routinely don't have 7 people there. And I think it'd be a good idea to get their names on there when it's multiple visits to a design board. And the other request I'd make from staff going forward too is when we're making a point on an elevation sheet that windows are going to go back to ABR, and as one of the things that have been accepted is those window sills are going to be moved up, we should show that on the elevation, because it clearly looked out of scale as it was. To the appellant, I sat on that planning commission I don't know if you know that, but I was on the planning commission for the last 10 years. So I'm sitting next to Deborah Schwartz, which you cherry picked out. And the end of that planning commission was a unanimous decision to approve that project that was being appealed by that time by the applicant at that time. But I have a hard time with cherry-picked video clips being pulled out of that for a comment when the project, as torturous as it was in its prior shape and form, was still approved unanimously by the Planning Commission. That is not an argument that sways me to see examples of that used. I also don't respond well to the city being in a place to resolve enforcement actions, but negative comments being made about an applicant as to what he possibly could do when we're attempting to fix what he's doing right now. It just seems contrary to a good argument, and it just does not help the case. So I'll be supporting the ABR action and denying the appeal.
Ms. Sneddon, your turn.
Thank you, Madam Mayor. Since I think we're moving into a new era of precedent setting, I just want to explain my feeling about ABR and their different design commissions. So ABR is there to work through all these issues to the best of using our design guidelines. This is how I interpret it. And if those decisions aren't appealed, then they've done the hard work and the heavy lifting of working with the applicant to make it acceptable. Once it has been appealed, I no longer think of ABR as the deciders. I think of their decision as being appealed. I think of us as the deciders. I take into account what they've recommended or not. I take into account the heavy lifting that they've done, but this is de novo. So I don't think it undermines ABR to treat ourselves as a discretionary decision-making body. It is the process. It's not undermining the process the way that I see it. Otherwise, an appeal would just have the same outcome as the original design board, and what would be the point of appealing? So I don't see it as undermining ABR in any way once it's been appealed. But I thank ABR for all the hard work that they do when things that aren't appealed, because they do so many multiple meetings to get it to a point of approval. So having said that, the things that I'm considering in this decision is the Hillside District. Things that we can look at are size, bulk, and scale. I find the skyline very awkward, the stepping and the 3 stories, but then the 2 stories flat. I actually think the previous bulkier model was more in line with the skyline and didn't have that awkwardness. When I'm considering neighborhood compatibility, I'll restate again that those equivalent lots are not equivalent to me. They're oriented in an opposite orientation. They're above APS, which gives a flat line bench street break. So when you have south-facing 3-story windows above that, it's not into anybody's yard. It doesn't disrupt the view from APS to the ocean view. I agree that the whole route of APS is scenic, and even though it might not be certain corridors delineated, it is a scenic corridor, and I just don't see why it needs to be 3 stories right there instead of cut in or spread out further, and 2 stories seems enough. So neighborhood compatibility, I'm not seeing the compatibility. Good neighbor guidelines, for those I think about how many neighbors are there. Sometimes no neighbors come to object. In this case, every single surrounding neighbor of the property has either written or is here to object. So that to me defines good neighbor guidelines. It's not a good neighbor if every neighbor is objecting. And that's how I look at those. I think it does loom over with maybe more unnecessary balconies. I mean, I just don't see why there need to be so many balconies on all sides. That again seems like good neighbor guidelines and compatibility. The other properties up on APS shown had balconies on one side facing outward, or the other buildings on either side of them were the same height, and you have these narrower lot corridors. I'm very familiar with that corner there, and the corner lot being oriented the opposite direction, as Councilmember Jordan mentions, it does make it awkward. If the height was put towards the sides of the downhill side of the lot, and that was 3 stories, that would make sense to me, but it's at the highest point of the lot that it's coming up so high. So I just, I feel that it is our position to use our discretion up here, whether we agree or disagree either way, and I will be upholding the appeal when the time comes.
Ms. Gutierrez, oh, you turned off your light, okay. So I will be denying the appeal. I found for neighborhood compatibility, I eyeballed it, and it looked eclectic. There was plenty of 2 and 3 stories. Mr. Gradine made his argument to me on that point. It's imperfect that we have former ABR members being applicants. We tried to address that, Mr. Casey, years ago. We reduced the number of architects because we couldn't find enough architects to serve on the ABR. So, and I'm convinced that the ABR is such a tough group. I watch the meetings. I know those gentlemen. I don't think there's a lady on it right now, a woman. So I think they did their job and gave it a really tough review. I don't think you meant, Ms. Valente, to take comments out of context. Mr. Jordan used the word cherry picking, but that's what it seemed like. We've watched meetings, and there's a flow, and they do sometimes say one thing and then they change their minds, and it's fine. Actually, you made some great arguments, very well organized. I just wasn't convinced to agree with your position, but thanks. A really good effort. The applicant did make some changes through the process, and the appellant's home is 1 lot over. That also said something to me too. So, okay, so when we have a motion, I'm denied the appeal. Okay, Ms. Gutierrez now.
So I was going to reserve my comments, but this property is in my district, and as much, I respect the city's process and the ABR, but I agree with Councilmember, that when it comes to us, now we have a voice in it, and I'm very familiar with the area. I drive through APS almost every day, and I know that if that driveway is there, there will be accidents. And so I will uphold the appeal when it comes to vote.
Okay, well, Mr. Gutierrez.
Thank you, Madam Mayor. I as well respect the ABR and their process. I drive that route every day to get to my other job, and it's one of the rare streets in Santa Barbara that you can appreciate where you live, even if it's a split second when you're driving by. And I do worry that if projects like this continue, then that will be a thing of the past, and it'll start to look like Mulholland Drive or something. So with much apprehension, I will be upholding the appeal.
Okay, it looks like we're going to have a 4-3 vote. Would you make the motion then, Mr. Friedman, since you were referring to the findings?
Yeah, I'll make the motion to deny the appeal based on the findings from the ABR from their December 2019 hearing.
And is there a second? A second from Ms. Harmon. Is there any other discussion? Okay, we're ready to vote. Let's go ahead and take a roll call vote, please.
Okay. And this is from a motion by Councilmember Friedman, seconded by Councilmember Harmon, to deny the appeal based on the ABR findings from the December 2019 hearing. Councilmember Alejandro Gutierrez.
No.
Councilmember Snit, I'm sorry, Mayor Pro Tem Snedden.
No.
Councilmember Friedman.
Yes.
Councilmember Harmon.
Yes.
Councilmember Oscar Gutierrez.
No.
Councilmember Jordan.
Yes.
And Mayor Murillo.
Aye. That passes 4-3. We thank staff for working so hard on this. Everyone who came out to speak today, thank you so much. We'll close this item. We'll move on to the next one, which is council member assignment reports and our liaison assignments. I think we're going to cancel or postpone, reschedule our closed session item. So Ms. Snedden, go ahead if you're ready to tell us what you did in the last week.
Thank you, Madam Mayor. I attended CCRB meeting where we continued to discuss the holding pattern we're in with the Bureau of Reclamation and NIMS.
Can we ask folks to leave the room? We have another item here. Thank you, and thank you. Then thanks for waiting so long all afternoon through our long meeting. Thank you. Go ahead, Ms. Snedden.
Thank you, Madam Mayor. And then just one other item. I had the honor, really, of making opening comments at our first Thursday opening in City Hall. It's curated by Santa Barbara City College art teachers and students. And if you haven't been downstairs there yet, and Sarah York Rubin did a terrific job welcoming everyone, and it's just invite people to come down and see it. And then also as a reminder of our first Thursday art events throughout the city, a lot of the people who attended weren't aware that they could go from our event on downtown and go see other art events. So I just want to give a reminder of that.
Thanks. Mr. Jordan?
I had a walkabout last Saturday with 3 or 4 members of the Safe Passage group that's up through the bottom of Mission Canyon by the Rose Garden and the Mission. Got a lot of, for me, got a lot of good old history and pointers on stones being historically and culturally important, which is always a missing part of my education. I had a meeting with last week of some representatives of Commercial Fishermen of Santa Barbara Fisher people, and pretty interesting there. And then I think the middle of the week, I attended a welcome reception for Santa Barbara City College's new head guy, Dr. G, at City College. So really good meeting. Got to see a lot of Mesa residents in particular, and had a great introduction with Dr. G.
Thank you. Mr. Friedman.
I attended the Community Environmental Council's Climate Change Forum. This is one focused on sea level rise. And the Wilderness Youth Project had their annual luncheon. I attended that as well. And thank you to that nonprofit, which is doing all it can to get kids back out in nature.
I had the pleasure of going to the Santa Barbara Middle School to see the class's Lego robotics, I guess the school's Lego robotics team. They compete. It was very exciting, fun to be up there. And the other youth-oriented thing that I did this week, some Cub Scouts came to my office and asked me some pretty good questions. They ate all my candy. They saw my candy stash, and I had to share. And then this morning was the downtown Santa Barbara board meeting. And I would invite any of our city council members, right, Mr. Casey? They could go, right? And it's to check it out, connect with people. Yeah, and you're welcome there, and it's a good breakfast. And then we also had a council retreat. Oh, that's right. Okay, so not more than 4 people. Yeah, so maybe one at a time. Come with me to the downtown Santa Barbara meetings just to connect with all their leadership. And then our city council had a retreat last week, and I'm really proud of the team that we are and the connections that we made, doing some exercises, getting to know each other, and then also talking about our vision for our beautiful city. So it was very, very well done, and thank you. So we are rescheduling our labor negotiation update, and if there's nothing else, I'm going to go ahead and close the meeting. Thank you.